All right, we're going to go ahead and call the June 16th, 2020 meeting of the Lake County Board of Supervisors meeting to order. At this point, we're going to go ahead and stand for a moment of silence. Do we have any dedications this morning from the board? Okay. Supervisor Crandall, would you please lead us in the Pledge of Allegiance?
Yes. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Supervisor Crandall. All right, as we move forward here on the agenda, I know that I would just like to address one item for the public that's in. I know there was a request that was made yesterday. We have an item 7.4, that I know has a lot of interest, and we have, it was not a timed item. So what I would like to do is just announce for folks, so if you don't want to wait for this time, we'll not take that item up before 11:30 a.m. today. And that's item 7.4, the urgency ordinance. And we'll do everything we can. We got enough stuff to keep us busy in the morning. I just wanted to just let folks know if they have something else to do, that we will not take that item up before 11:30 a.m. today. So it was just a housekeeping item. Next thing is number 4, consideration of extra items not appearing on the posted agenda. We do have an extra item today, item 4.1. Does everybody have that? Everybody downloaded it and got it?
Yeah.
Excellent. Okay. Excellent. And I think what I will attempt to do is move right through. We'll go with, move like we have been. Move through Dr. Pace's report and then come back to everything. Or actually, let's just go right to consent agenda. Consent agenda items are usually non-controversial, and they, did I miss a step here? We need to take up the extra
We
item.
want to approve.
Yeah, I apologize. Yeah. We take up the extra item. So go ahead and turn that over to Social Services or Tina Scott, who would like to address that.
I could probably make the argument for it to be heard today. Thank you for the consideration of this extra item. This came to our attention after posting the agenda, and it needs to be heard today. We're on a really tight timeline. The reason why it didn't get posted on the agenda is because we were still trying to figure out funding for this project, and funding did not come to light till Friday afternoon, and then RFP had to be put together over the weekend. We need to get this RFP out today to bring back to our board for approval next week before the 2 shelters are closed at the end of the month, and that's why it needs to be heard today.
Okay.
So that's a motion, I guess, to have it heard.
I'll second for discussion. Or is Social Service going to be here to present this? Because I would like to hear from them. I don't.
Yes, I'm here. I'm on.
Okay, thank you. Thank you, Crystal. Yeah, I just want to make sure we got the information, so appreciate that.
Okay. So there's a motion and a second to accept this agenda item as an extra. Is Johanna?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Excellent.
So shall I present now?
No, we'll take this up. I'll take it up as soon as Dr. Pace is over, I think is how we're going to try and do this.
Okay, sounds good. Thank you.
Okay, moving on with the approval of the consent agenda. Consent agenda items are usually non-controversial. Are there any items that need to be pulled from the board? And
Mr. Chair?
Yes, go ahead, Bruno.
I'd like to pull item 5.4 for further discussion and clarification.
Okay, thank you very much. Are there any other items from the board?
Mr. Chair, I would, not the board, but I would appreciate pulling 5.1 for discussion. It can be any time later in the day, but I think it would be helpful to discuss that.
Okay.
Thank you, Carol. That's one I was going to pull too. Thank you, Carol.
Thank you.
5.1 and 5.4, any more to be pulled from the board? All right, if not, we'll go ahead and open up the room. Are there any items that need to be pulled from the public? From the consent agenda? Jake, can you open the room?
Yes, we can open the room.
So go ahead and open up the room.
All right, the room is open. If you'd like to make a comment, please state your first and last name.
Okay, here none, Jake. Go ahead and close. Yep.
Is this just the general discussion or is this the consent to the agenda?
No, this is the consent agenda items 5.1 through
16.
5.16. And we had two items pulled and just asking the public if there were any items that need to be pulled for discussion.
Okay, no, we were just waiting. We have a couple people waiting for public input. And so,
Okay.
yeah, just clarifying. Thanks.
Yep. Okay, Jake, go ahead and bring it back.
Okay.
Okay. We'll bring it back to the board for action. Looking for a motion.
Mr. Chair, I move to approve consent agenda items 5.2, 5.3, and 5.5 through 5.16.
Second.
Thank you. Motion and a second. Johanna, go ahead with the roll call vote.
Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown, Supervisor Brown,
Yeah, sorry. Yeah.
and Supervisor Simon.
Aye.
Thank you.
Okay. Thank you very much. We'll go ahead and take those items up after, we're going to try and squeeze some things in after Dr. Pace's item 6.2, our 9:02 a.m. item, a consideration of update of COVID-19. So welcome, Dr. Pace, and everyone else who's online from Health Department. So go ahead and turn it over to you.
Good morning. You can hear me okay?
Yes.
Okay, good. Good morning. Thank you for,
Supervisor Simon.
Aye.
there's an echo there. This will be the coronavirus update for this week. And I'm going to make this brief today. Things are sort of stabilized now. We now have a total of 34 cases in the county, 4 that are active. Most of these seem to be from out-of-county contact. Either somebody went out of the county or somebody came and visited from in the county and turned out to be a case. The last case, the most recent one, had some kind of social gathering. So we're still in the process of tracking down, see if there's a bunch of contacts and what's going on there. So that person just turned positive yesterday. But overall, it's pretty much the same situation where we're getting a few cases here and there. Sometimes there's a little cluster. We're not seeing widespread signs of community transmission. And so things are we're looking pretty good where we're at right now. There are, so in terms of the changes, we basically reopened the vast majority of the businesses, or we removed the restriction last Friday. So most of the businesses were able to reopen as of Friday with keeping the kind of precautions in place to keep people safe. So we're supposed to be doing the social distancing, the required masking, and the disinfection. So this, as far as I'm understanding, things seem to be going pretty well. When I've been going around town, it seems like, there's reasonably good adherence to the recommendations. So the testing site, the Verily testing site continues. It's working 5 days a week. It will be closed this Friday due to some staffing issues that they're having, but otherwise it's moving along 5 days a week. People can register on the website. They did switch to the mid-turbinate swabs, which is more comfortable, seems to be working better. We are looking for some volunteers to help with it, and Supervisor Sabatier did come and help us yesterday and has helped get some volunteers for the Clear Lake site, and we really appreciate that. The housing situation, which is what Crystal's going to be talking about soon, is kind of important because with the whole variance moving forward with the state, with us allowing to move forward in an accelerated fashion, we need to have the testing capacity, which we are doing through the Verily site, and we need to have the ability to do some, to provide the housing to the homeless and also to people who are not able to isolate at home. This is part of the agreement with the state, and so it's kind of a key piece of it. So both of the homeless sites that we've been using for the last several months are needing to close now for various reasons. And so there's been a lot of work in getting the juvenile hall site ready to do part of that, and also just try to secure some hotel sites to be able to house people there if they need to. So this is all a key part of moving forward like this. The state does have this sort of what they're calling a watch list, which if there's some red flags on the parameters where some of the counties look like they might be starting to have more problems, the state gets involved and starts talking with everybody and trying to make a plan. There's something like 8 counties in the state now that are on the quote watch list. And so we'll see how all that plays out. We're not really sure what that means, but there are some counties that are having a little more trouble keeping things going. There's some new developments. Just in today's paper, there's some treatment possibilities. It looks like using some steroids for severely ill people in the hospital does decrease mortality. So that's a nice development, and hopefully we'll see more of these kind of things as more experience is had, more studies are be able to obtain the vaccines. They're really putting a lot of effort into getting some vaccines ready. I don't know, there's 150 groups working on a vaccine, and they're hoping, it seems like what they're doing is they're picking the most promising ones and then actually starting to develop the manufacturing even before the studies are complete. But there's a lot of effort on the federal level and around that. So, all in all, in the county here, we're doing well, and it seems like things are moving along okay on a general level. So the reopening process, we did open the 12 sectors that we were talking about last week on Friday. We removed the restrictions, and so they're able to open. The only ones that seem to be not covered by that, as far as we can tell right now, are the nail salons, massage parlors, tattoo parlors. They did come out with more guidance last Friday about those, and so they can open on this coming Friday, the 19th. And we'll go ahead and give the green light for that because we're doing so well. So nail salons, et cetera, can go ahead and open up moving forward. It seems like the main thing that's left is large group activities and big events. And those are, the state has not given very clear guidance about that. It's very kind of ambiguous about different things. The way we're trying to encourage people to do that is to sort of plan small and then with adequate social distancing, preferably outside. And so I'm usually encouraging people to aim for a 25 people event now. So, in the near future, if they try to do something that's 25 or less, using social distancing and disinfection, that's probably going to be okay. And if it's later on in the summer, maybe, start with a 25-person plan and you can increase it moving forward, outward, if things are stable. We just don't know how things are going to go. And so I think to get a plan for a big event and then have to shut it down is going to be very problematic. But, the state will probably be coming out with some guidance about that in a week or two. The masking requirements continue, and the evidence is coming out more and more that it looks like that there is some real protective effect with that. I know this is controversial, but a couple studies came out this week that basically strongly suggest that this is the way to go. So the trigger question, if we do get into some problems and we're watching these different parameters, including infection rates, but more important is the hospitalization rates, how filled the hospitals are we able to do the contact tracing, all those kinds of things. If the systems are starting to get overwhelmed and we're not able to manage, then we need to start thinking about slowing down the process or potentially adding more restrictions back in. But hopefully we won't have to get to that point. That's basically it right now. So we are continuing at the same rate in terms of the infection. Sonoma County is actually seeing a rise. They had like 30 new cases or something yesterday. So we'll see if that spills over. But at this point, we've been doing really well. And we're basically open at this point for the most part. Social distancing and masking is a very important part of slowing the spread so that we can keep open. And large events and kind of being careless about when you're socializing are going to be problems and probably set us back. So we really encourage people to try to be as safe as possible moving forward. The virus is definitely out there, and it seems to be in other parts of the country where people are being more lax. It seems to be spreading more, but I'm happy to say that we're doing really well and that now the restrictions are being lifted. So I think that's it for now. Thank you.
And you're on mute, Moak.
Supervisor Sabatier.
Thank you, Dr. Pace, for that update. I appreciate hearing that on Friday we will have the rest of our, not the rest, but more of our businesses able to open up with the guidance of the state of California. So that's our tattoo parlors, massage therapists, not parlors, and our nail salons, which have been waiting very patiently for this to finally happen. And so I'm happy to hear that. And I appreciate hearing that we're going to go ahead and move along with those guidelines. I know that the next step you said is the large group gathering. My biggest worry is probably one of the most important parts of our communities, and that's schools. And what's been the conversation for schools that you've had? I've heard from the state level that businesses are up to the counties as the guidelines are created by the state, but that schools will be directed solely from the state. Do we have a part to play in how our schools will reopen? Also, I understand from having other conversations that there was never an order from the state of California to shut down schools. It was a voluntary thing that they did. Do they get to open however they want, or do they have to follow guidelines? So I'm kind of unsure how it's all going to work, and I'm unsure if we have a role in all of that.
Yeah, the schools are incredibly important, right? And we've been in a lot of conversation with Superintendent Falkenberg and the other superintendents. And, the way I understand this, I'm not sure we exactly know what it's going to look like and who's going to be in charge of this. My understanding is that we are planning on moving forward. The superintendent is planning on moving forward with the schools. They're in a lot of planning now. If we are in a situation where it's not safe to do that, where the infections are going in a bad way, then we would probably modify that somehow. They're kind of working on different levels of plans, different modifications of more restrictive and less restrictive. It really looks to me like what the state's going to do is allow counties and regions to move along at the rate that they think is proper until things get out of control. And then I would suspect they're going to, and what they claim it's going to be is a collaborative process. It appears that as long as we are making reasonable plans and moving forward in a reasonable way, that I doubt they're going to make us do something different. But I may be wrong. I think they seem to have lost a lot of their appetite for trying to control the whole state like that, and it didn't really. They ran at first. It probably worked really well, and then they started really running into some troubles. And So I suspect as long as we're kind of paying attention and moving forward in a reasonable way, that I think we should be all right. And, we've got really good leaders in the schools. And so I think we should be okay.
I think their primary job has always been to keep our children safe. So I think that they're going to do the best they can too. My last thing is about the testing. So I did go there. I did volunteer. I was also tested. I had the new smaller, maybe 4 or 5 inch long swab rather than the the twice the size long swab that they used before that almost touched your brain. Definitely just felt funny and tickled, but it definitely was not a negative experience. It's free. The more we have people tested here, the more we can continue on the path that we're going. I know I had a conversation with Verily yesterday, and they're in agreement with what Dr. Pace had said, which is if there's not enough activity, it's not worth their time, and they may have to decide to go somewhere else to where the bigger bang for their buck, because they're getting paid to be there by the state. And if we're not showing up to get tested. So please, if you haven't been tested, again, it's free. It's an easy appointment process. I literally signed up at 10 p.m. and I was able to get an appointment for the following day. And so the more people get and you can get tested multiple times. If you feel you went to a large gathering or you went somewhere out of county and you want to get tested again, please do so. Again, this is one of those things that I don't want to see us having to have a hurdle on our forward progress that we've been having. I think the state would gladly work with us if we got into that kind of situation where Verily was looking at leaving. When I spoke with the state, they don't know what it looks like to be on the watch list and what the actual actions from the state will be. But at the same time, they said that they would collaborate with us to try and solve our problems. And as long as we're working with them, that they would work with us. So I'm not quite sure what that means for Verily, but I know that if you haven't been tested, please do so. It's available to you. It's free. And then you get an email within 24 to 48 hours to let you know what your results are. And so I think it's a good opportunity for everybody to know that it's there for you. Mondays and Tuesdays, they're in Clear Lake. On Wednesdays, right now, it's alternating between Clear Lake and Middletown. And then I believe Thursdays and Fridays, they're in Lakeport. So take advantage.
Supervisor Brown?
So Bruno touched on one of the issues I was going to talk about with the schools, because they weren't given an order to close. And I agree, it is their job to protect our kids, but it's also the job of the parents to have some input on that as well. Parents, can figure out whether or not they want to put their kids at any risk or not put them at risk, whatever the sentiment might be, just like our businesses are able to do. But so there's a couple of things that you said, Dr. Pace, that, we kind of gloss over. I wrote them down. So I want to make sure I got them right. You were talking about the hospitals, and our main goal that's one of the triggers is impacts that we have to the hospital. Obviously, that was the concern that we had initially. We didn't see that. Most areas didn't see it. And I kind of take exception to the comment that you said that the areas that were the most lax are it's now spreading. That's not necessarily the case. So it's in fact, in some cases where they didn't have any shelter in place or any orders at all, very little happened the same as us. So it went both ways. But what you said about the hospitals, where we need to manage them, why can't they manage themselves? They're medical professionals as well. Why can't they tell us when it's time? Why? Maybe we should look at the possibility as we move forward, because this is not the last time that this is not going to be tried on us to shut us all down. But maybe we should have a committee of health professionals to decide with the hospitals and our own staff to determine, as opposed to just one person, having that impact based on, government input from other neighboring counties and the state. Maybe we should talk to other doctors that are practicing and the hospitals. And I'm not sure if you meant that, but I think the comment, we need to manage them, is probably something they might take exception to. I think they're able to manage themselves. I would like to hear from you on that if I could.
Sorry. Yeah, you're absolutely right. I'm not at all interested. I don't manage the hospitals. If I said that, I was probably meaning to say monitor. We're in conversation with the hospitals regularly, and I have, the hospitals manage themselves. They have a whole corporate chain. So you're absolutely right. If I said that, I'm sorry. That was a mistake.
Oh, okay. I expected that was going to be the case, and I appreciate that. I accept that. That's probably the case. So that's good enough for me. And the other thing is, I know there's a balance. There's always been a balance, but I think we really need to impress upon ourselves that we're not trying to avoid this. We are hoping that it spreads, in a non-negative, impactful way through our community, so we can stop worrying so much about what might happen. And we can say, okay, it went through here, we had it, things, we wrote it out pretty well. That's what my hope is. So, why wouldn't we, open up some of these other counties? San Luis Obispo County opened up week before Memorial Day. They're not experiencing any outbreak. We were just down there. I had to go down there on business. And, people down there are living their life. There's some are wearing masks, some aren't. It's like, it doesn't appear to me like a community full of tattletales like we're having here, where, people are complaining and trying to get other people in trouble for trying to make a living and, all this other ridiculous stuff. So, and they're not experiencing any outbreak or surge in their hospitals or anything. Why wouldn't we want it to have some kind of, build up some immunity by letting it come through the community a little bit quicker? Let's do that before the schools start. Then we don't have to worry so much about it. I think, people, if you want to talk about, we do have large gatherings. We call that Walmart. We call that, other places that people are shopping. And we're not seeing all this stuff that we're so afraid of. We're afraid to even come to the courthouse when we have all of our employees here. And the board won't even come in to do a board meeting. We could have it here easily, but we expect our employees to, but we're not going to do it. It's gotten to the point of ridiculous. At some point, we just need to say, hey, let's open it up and give it a try. So I'll keep saying that until we open it up to give it a try.
Supervisor Scott.
Yes, good morning. Thank you, Bruno, for going out and volunteering at the testing site. I was under the influence that you had to be some sort of medical professional to volunteer out there. Do you need volunteers that do not have a medical background?
All I did was help with traffic and make sure that they were properly registered. And then I moved them on up to the clinical side of it, which I did not interact with whatsoever.
So do you need volunteers like that also, Dr. Pace?
Right. So there's two types of volunteers we need. We need the clinical people, and we need the volunteers that will help sign in people and, traffic control and just kind of help things move around. So absolutely.
Okay.
If people are interested, or if you're interested, Supervisor, let us know. We'd love to have you.
Great. I will contact you and put me to work.
She has traffic control experience from a cross guard experience.
Yeah. I did have one more question about that, Moke, if I could.
Go ahead, Supervisor.
I think there was some confusion by the public where, we're saying not many people are getting tested, and we stand the risk of losing the testing opportunities because we're not having this influx of people getting tested. Yet we're also putting out press releases that say we need volunteers. So I think I got the impression from a lot of folks that they're confused by that. So where are we with that? We're just looking for volunteers just in case, or are we're going to have a lot of people just, kind of hanging out, hoping for people to show up, or what's happening?
Well, so what we have is a site that's stood up, so there's a whole kind of flow with it, and we're open for a certain number of hours a day. And so there's just necessary staffing for that to function. And we've been basically trying to do that. There's a few volunteers that come with the project, and then we've been using a lot of our public health staff, which are very stretched. We've had some help with the Lakeport Police Department helped, and different, Willie Cepeda and his folks have been helping with EMS. And so we've been getting some help around the county, but, as it goes on for a month or so, we're needing some more just staffing to do it. That's a separate thing from the people coming through. Part of the way the state looks at this is they look at they have sort of a metric to see that we're doing enough tests. The main thing is and this isn't to encourage people to get testing just to fill the numbers. It's from the state point of view, they're putting a lot of money into this, and they're going to go places where they actually are getting the numbers. But the other side of it, from my point of view, is what I've been seeing is that when people are not too concerned about worried about the virus, we don't get many tests done. And then all of a sudden in some community or some neighborhood, somebody knows somebody who got tested positive, and all of a sudden 80 people want to get tested that day. And so we have to have the capacity there so that when people want to get this, they can do it, so they can see whether they're infected or not. And that's really, from the public health point of view, that's how we're going to stop the transmission. So it's really important to have this capacity. And so it's two separate things, the staffing and the volunteers. I think for the messaging to the community, if people are interested in helping out to run this thing, please let us know. And if people want to get tested, they should go. I would also just encourage that employers think about offering this to their employees to go, especially people that are kind of front line, especially if the number of cases starts increasing in the community. To have the essential workers, the frontline workers, get tested would be a good thing. But this is not any pressure on anybody to go get tested, but it's just it's an opportunity. And it's really, as you all are well aware, it's hard to anticipate what the state's going to do, but they have made some rumblings that the lower use places may get consolidated, and we may have to share with other counties or something. So,
okay. Yeah, no, I appreciate that. I just want to make sure that the public understood, because it was kind of a mixed message that we're not doing many tests, but we need volunteers. But we need volunteers for a different reason than a huge crowd of people being tested. It's just for relief for staff and have people available. So, yeah, okay.
Go ahead, Supervisor Sabatier.
Hey, just to talk on that, I know that the Lakeport Police Department volunteers were at the Clear Lake site, and I believe that they were done as of this Wednesday or something along those lines. And so I think that we have some expectations of certain volunteers completing their ability to be volunteers. So that's where there's going to be a need for more as well.
Okay. Supervisor Crandall?
Okay. Yes, just a couple things. Just wanted to thank Dr. Pace also for bringing up the new update about dexamethasone, which proves to possibly be a new way to save people from COVID. Apparently, it is a low dose steroid that would it decreases mortality by a third. Of course, that's still going to take some time to find out more, but that's promising news. I was glad he mentioned that, because I just got the information this morning. I am really excited also to discuss with Bruno and Dr. Pace about possibly getting a site over here on the North Shore, as you know, in the vulnerable community of District 3. We have a lot of folks that can't really get around, and that's also why I advocate for different attributes in lieu of business and whatnot. And one thing I'd like to add too is that a group of folks had went and conducted a survey amongst the businesses, and I think this will probably be more appropriate to get into more on 7.4, but they had conducted a survey around to talk about masking and whatnot. And so I just wanted to highlight that there was some work done, and there was about 60 to 70 that were accosted and approached about this dynamic. And it'd be nice to have more, but at the same time, that was Thursday through Sunday, so they really pumped out a lot of information and data that I'll give a report on. I think I'll inform more about that on 7.4, but it was really, I think it was sent to the supervisors as well, so it's really good information.
Yeah, Dr. Pace, obviously, thank you for the report and the update today. I guess what I would like to report about a little bit is the reopening committee. Obviously, things are opening up. We're having general conversations. As everybody knows, it's kind of a two-step process, like we said. The state comes out with the guidelines. Dr. Pace and the reopening committee, we go over things. And obviously at this point, he's already announced that the new stuff that's been rolled out, we will be opening up this Friday. So, a little simpler process the last couple of weeks, obviously, as things are opening up. But we did have a conversation, which was brought up by Supervisor Sabatier. We will continue meeting now for a while. We're going to keep it on the calendar. And then ultimately, if things start to change, whether or not that committee is the one that we talk about bringing restriction, if we have to roll things back to continue those conversations at another level, But at this point, all we're doing is following along and hopefully getting all the businesses open and providing folks the opportunity to do that. I know last week got a lot of phone calls from business owners, especially who own bars in the district, where to go to, where to get the guidance and stuff, just pushing them in the right direction. And ultimately, it's already been talked about, but businesses are reopening. If you're a business owner now, there is free testing that's available here in the county. If you feel like you'd like to do that before you do it, get up, send something out to your employees to encourage them to get signed up at one of these sites if you want to open up your business in that way. You don't have to, obviously, but there's an opportunity for free testing. So I think it's, benefits everybody, both the county and the business owners, to just a little bit of peace of mind at that time. Even though it's a point in time test, you could be affected the next day. At least, as you're bringing folks back, because there are folks who are traveling now from county to county into different areas, and you just want to make sure you're being as safe as possible. Other than that, I just thank you, Dr. Pace, for everything. And, continue to push the word down here for the testing in Middletown and across the county for that. Go ahead, Bruno.
Sorry, I had one last question for Dr. Pace, because I know that the testing is important, but I think more important, and of course, if the testing is even reliable now at this point, is has there been conversations? I have not heard, but have there been any conversations from the state about offering antibody tests so that we can see not who's sick today, but who has had the virus in the past? Because even if you get tested today and you had the virus 2 months ago, you're going to test negative, and then so on and so forth. And so I'm just wondering if antibodies is a possible future test that we can bring into the county where we can see how much of our population truly has been affected by the virus.
So with the antibody testing that is available now people can get it through their medical providers. And in Sonoma County, they've gotten it through the public health lab in Sonoma County. We don't have a public health lab here. And so we don't really have the capacity to do that. It is available at Tribal Health, I believe. And I believe it's at, Adventist as well, the quick turnaround machines. But if people want to get that, they can get it through their medical provider and to get it through the commercial labs. From a clinical point of view and a public health point of view, we're just still it's very early in the process of learning how to use them and what actual utility they have. So, but if somebody was sick a couple months ago and wanted to know if they have the antibodies to the coronavirus, that's a good way to find it. Whether that means you're immune and for how long, we just don't know any of those questions yet. We don't know the answers to those questions yet. But at this point, we have done a little bit of exploration on getting those kind of tests. They're quite expensive. And I think in terms of we're running pretty fast, just trying to deal with the response right now of the more immediate response. But, there's a lot of interest in it, and maybe we need to start really trying to ask about that. It's not a major push from the state to get those out because we just we don't really know how to piece that together in the picture right now.
Right. And if somebody goes to the hospital because of HIPAA, do you not get any information about antibodies because those tests are done on a personal level rather than at a public health level? just because it'd be good information to have, even though maybe you don't know how it correlates to what we need to do or what the community has dealt with. It's still at least a potential factor in the decision making.
Right. So that's a good question. I mean, at this point, it's very inconsistent what we're getting and what we're not getting. It's not part of the normal reporting mechanisms that we do for infectious disease that, you know, the state's got well set up, again, because it's just so inconsistent and spotty. It would be very helpful from a public health point of view to start getting this data and start mapping it out because, for example, all the town of Bolinas down in Marin County, they tested everybody in the town. Somehow they got a grant and they worked with Stanford and they tested everybody in there. I think it was the end of April, and nobody had antibodies. So that was useful. So at that point, it didn't look like anybody in the town had gotten the infection yet, you know, and now to do this again in 6 months, and maybe, you know, 20%, or who knows? But, you know, that from a population point of view, that's very interesting. From an individual person point of view, it's a little hard to know what to do with that because just having the antibodies doesn't necessarily mean you're safe from getting infected again at this point.
Right, right. Thank you. You're on mute, Moke.
Any more questions from the board? Okay, if there are no more questions from the board, we'll go ahead and open it up to public.
Mr. Chair, do you mind if I say something real quick to make sure the public is aware that 7.4 is the discussion of the businesses and the enforcement of masks and not this specific item? Because I have a feeling there's kind of some gray area where this might be part of that conversation.
Well, good luck on controlling what that is. Obviously, this is the report from Dr. Pace, and obviously we do have other items on later on in the agenda to address different things. So we'll go ahead and open it up to the public or the folks in the room.
So it doesn't look like we have any hands up right now. So I will open up the floor here. All right, the floor is open. If you'd like to make a comment, please start with your first and last name.
Hi, this is Dee Parker, Dolores Parker.
Yes.
Thank you for allowing me to speak. Just wanted to ask a question quick. I think you already answered it, but I want to clarify it. When you talk about testing, it seemed to me, my understanding was that when you do the test, it's for that date only, that you really know whether or not you have it. Maybe Dr. Pace could clarify that. The other thing is that if we're testing, we would have to go down and redo it often or wait 6 months or antibodies test. Did I understand Mr. Bruno says that even if you had it, that may not be, I'm a little confused about that issue, just a little small snippet of, because it doesn't seem to me like I want to go down and test every week to see if I have the corona flu. It doesn't seem to me it would be beneficial to know if I had it that day and then 2 days later maybe I have it. So, but I may misunderstand how this is working. If someone could clarify that for me.
We're going to clarify that, Dr. Pace?
Sure. That's a good question. And so there's two tests. There's the virus test, which is what you're talking about there and what we're talking about. And what Supervisor Sabate was talking about is the antibody test, the test to see if you had antibodies to the infection, so signs that you had the infection before. The one we're really focused on with our Verily test site, the drive-through test site, is the test of the virus. And you're absolutely right. When you get tested for that, you're basically deciding whether you have the infection right now. And the importance of this is that we are seeing whether you're contagious. Because if you are contagious, then we will talk with you about who you've been in contact with, and we'll do the contact tracing and see all the people that you've had contact with, and then try to get everybody to isolate at home so that they don't spread it. So this is how we stop the infection from spreading throughout the community. This is why we've had all the shelter-in-place orders and the masking and everything. It's to slow this spread. So your question about the frequency of testing, though, is really good. There's basically, if you have symptoms, so if you have flu-like symptoms, cough, fever, body aches, fatigue, that's when we really want you to get tested for sure. Because if that's a cold, that's one thing. If it's the COVID, that's a different thing. And we want to really get you to stay home and try to see who else might be infected from that, because it's very contagious. The other question, though, with this is that there are people who can spread the infection who never even know they're sick. So, for example, if you had contact with somebody a week ago at an event you were at, you might get the infection and you're actually spreading it, but you don't have any symptoms, so you wouldn't know. And this is what's happening in the nursing homes and in some of the stores and things, where people that have employees that work in a nursing home might be getting the infection and spreading it, but not even knowing that they're sick. And that's kind of where we're getting into all the problems with the nursing home. So one of the things we're doing now is we're going to start testing all the nursing home employees every month. And so we can start trying to uncover if somebody's infected and they don't even know it, so that we can protect the people inside the nursing home. And I think that's a good idea for some of the folks in the grocery stores, for example, or some of the places where there's high public contact, to think about doing that. But, for somebody who's been pretty careful, not symptomatic, maybe to get tested once just to see is a reasonable thing. Do you need to get tested regularly? Not necessarily, but say you go visit your mother down in Southern California and you want to get a test before you go see her. That would be there's ways to use it to be careful, but it's, you're absolutely right. Just to kind of randomly test periodically isn't necessarily going to show you a whole lot of information.
Okay, thank you so much for the answer. I do have one question. I'm trying to find the agenda to look at it, and I can't seem to figure out where on your website that I can go to get the agenda so that I can have the correct process of what's coming up next. Can someone help me with that?
You can go ahead, Carol.
Yeah, if you would like to email me your email address in the comments section, I'll forward you that link right now.
The comment section.
The chat, the chat.
Okay, thank you.
At the bottom of your screen, there's a chat button. So and you can chat just to me. I'm Carol Hutchinson. So if you click on the box for me, it will give you.
So sorry, the only options that I come up with is Moke and Jake.
Sure, Jake can help out.
Yeah. Or it's pretty easy too. If you just type in Lake County Board of Supervisors agenda, it'll pop up. You just kind of scroll down, and then you can go right onto there, and just kind of scroll down through the table of the agenda and the meetings that have happened already this year too. That's another easy way to do it.
I did that. It didn't come through, but Carol, I just sent that to you. Thank you so much.
There you go.
Okay, Jake, let's go to the next one.
All right, the next hand we have up is Terry Logston.
Thank you. Can you hear me okay?
Yes, we can hear you.
Great, thank you. So my question, Dr. Pace mentioned that antibody testing still doesn't prove, we don't have the science yet to say that it would provide immunity. And another supervisor mentioned opening it up, and I've heard this before, that we should have a herd immunity response. And so, Supervisor Sabatier asked about the reliability of the antibody testing. And I missed, if Dr. Pace, if you answered about the reliability of antibody testing. And then again, if you could update me on the immune response.
Okay. So a couple different pieces of that. I think the expert opinion right now has not been fully decided on whether we should try to clamp down on this and wait for a vaccine versus pull back and go for herd immunity. So Supervisor Brown's right. That's been one of the strategies, and it's been what we've kind of done in the past with things, measles and things in the past. That was sort of just before the vaccines, we would go for herd immunity. The kind of the expert opinion, they just haven't been able to decide whether we really should just kind of try to control it and go for herd immunity or go for the vaccine. So if you look at a place like Sweden, they decided to try to go forward with more of a herd immunity approach, and they've got a fairly high mortality rate in their nursing homes. And so there's a question there about all this. The thinking is that if you let the infection go through the community, there's going to be once you get to about 70-75% of people that have been infected, you will have an adequate immunity so that we won't keep getting these big outbreaks. It'll probably pretty much die out, maybe pop up periodically. The problem is that there's a couple percent mortality rate. We're going to lose an awful lot of people in that process. And the other is we don't really know what the long-term complications are for people that have had fairly serious illness and but recover, but we don't really know whether it's a full recovery or whether they're going to be impaired for their whole life. These are just questions that, it's so new, we just don't really know. I think the issue with the antibody testing is a couple things. They basically opened the door after the testing debacle with the virus testing. They opened the door, and now there's, multiple companies that are doing these tests. I think only 2 of them at this point are FDA approved, and the rest of them are very variable in their validity, in their accuracy. And even if they are accurate, so even if they do test and find that there's an antibody and that's correct, which a lot of these tests aren't very accurate, we don't know what the levels are. Like for measles, we know that if you need a certain level, and above that level, you have immunity. Below that level, you need to get another vaccine. And with the COVID, we just don't really know yet. We also don't know how long they last for. Some things, the immunity lasts a couple of years, some things it lasts for a lifetime, and we just don't know all that yet. So, all that's along, probably if you get the infection, you're protected for a while. We just don't know for how long or how well you're protected. And if we get a vaccine, it's the same thing. It's going to be a while before we know how long it lasts and how complete the protection is. So, it's just so new in the process. We just have a lot of questions still, and there's a lot of smart people working on it right now. But
Great, thank you.
All right.
Okay.
The next hand we have up is John Sheridan.
Go ahead, John.
Hello, John? Are you there? I can't.
Oh, yeah, I'm sorry. Yeah, okay. Thank you, Board. So, Dr. Pace, these decisions that you're making, it sounds like, is very uninformed. You don't know a lot, and my concern is that the psychological and the people's lives are being endangered over something that's not known. There's a lot of experts out there that are not really giving us a lot of information. So all these people, their lives are being destroyed. The psychological collateral damage is huge. And so there's a lot of evidence out there, a lot of research that, and you check with OSHA too, that these masks don't do a thing. You're restricting, and I don't, I'm questioning this seeming power that is being, put upon us to restrict our lives over an unknown thing. And the thing is that it's over 99.7 people survive this very well. And there are huge amounts of population that are asymptomatic. This has been blown out. And the thing is, what's really happening is that people's lives are being destroyed. So for the sake of, no deaths, fact of life is people die. You should take care of yourself, nutrition, stuff like that. That's the thing that you should be teaching, not vaccines, not all that, which destroy the immune system, but how to improve intracellular health, how to improve what, foods to eat to keep yourself strong. Instead, we're going the Western medicine route and saying that it's got to be these destructive chemicals that we're waiting for. So we're going to shut down our society and damage people's lives. They want to work. They want to feed their children.
That's 2 minutes, Mr. Chair.
Okay. So
If you could,
I will
you could
later,
wrap it up. Thank you.
later on the issue. And, those are my concerns. And the people are just fed up with this, fed up. And I question that you actually have the power to do this. I know people are wielding it, but, in a court of law, I just wonder how this will play out. Thank you.
Okay, Jake, let's go to the next hand up.
Oh, no, I can answer it.
The next hand we have up is Matthew Nelson.
Hi, good morning. Can you hear me?
Yes, we can hear
you.
Hi, good morning, everybody. I just wanted to jump on what Mr. Sheridan was saying was pretty much spot on. I just want to kind of extend a little bit. Dr. Pace, I understand that, the advice that you're giving is crucial for public safety. I understand that. But the concern that we have is that Lake County especially, you're missing out on a very prime opportunity to help a community that is already struggling financially, has been even before the fires even. But especially given this situation, we need to be able to have people go to work, because I can name businesses right now, and I know of businesses that are falling. Sanducci's, I know that they're closing their doors. Cactus Grill and Clear Lake looking at closing their doors. There's multiple other ones. I was just speaking with the people that own the Featherbed Railroad yesterday, and those are 6 cabooses there, and their mandate now, given by your order, is that they can only open to people and then have to have the caboose open for 2 days before they can put another person in there. They can't survive that way because they're based on a motel, hotel kind of a thing. They're actually a bed and breakfast. So we need to modify things accordingly to Lake County specific, because we have to take care of our people. I really, and this is not a shot, but if you would understand where I'm coming from, when I help out with things in our community, I'm out there on the front lines just like everybody else. I understand that you live in Sonoma County, but you're not up here in the front lines seeing every day what's going on up here. So please take a drive, come out here and talk to people. These masks, I've been working here out in this whole thing, during this whole thing. The masks aren't
2
working.
minutes, Mr. Chair.
Thank you guys very much. I appreciate your time.
Thank you, Matt. Okay, Jake, let's go to the next one.
All right. The next comment we have, John Arns.
Yes, hello.
Yes, hello. We can hear you.
I would like to know why you seem to focus mostly on the unsettled science. You have these back and forth discussions about the science that you don't really seem to have any empirical data on, while we seem to ignore the lawlessness and the absolute anarchy that we're heading for. We have crime is exploding. As an example, we have homeless in all of these privately owned hotels. What is your plan when the free money runs out and these people don't want to leave? the homeless shelters, the hotels. What is your plan? Where is the focus on that aspect of the problem that we created with our policies? And we have, I see no discussion, no planning on implementing an exit strategy from this situation that your policies have put us in. So I would like to see more of that. Thank you.
There's actually an extra item that's going to be addressing those extra exit strategies.
Thank you, Supervisor Scott. Okay, Jake, I see Dee Parker still has her hand up. I don't know if she's looking to comment again or just has the hand up.
Oh, I do. I just wanted to know, respectfully, the point of order, is this the time that we talk about the mask ordinance, or is that later?
That's later. Item 7.4 is, that's later on in the agenda.
I'm so sorry. I still haven't been able to get that to me. So can you tell me where we're at in the process? We're on item what?
We're in the very beginning, and as we made the announcement earlier, obviously, Dee, we are going to, it won't be no earlier than 11:30 when we get there. We have quite a few agenda items and some timed items we'll be working through. And so it's going to be later on, no earlier than 11:30 today.
All right. All right. Thank you so much.
Okay. All right. If there are no more comments at this point, we'll go ahead and bring it back to the board. Oh.
You can't just lay out training and not have grants in place to make sure to pay for it.
That's coming from you, Mo.
Yeah, it looks like it's coming from you. I'm not hearing it.
I don't got anybody around me, so I don't, wouldn't be me.
Yeah, it goes in the machine.
No, I don't know. I keep hearing that too. All right. Well, it looks like
we did have a hand come back up from John Sheridan.
Okay, we'll finish out with John, then we'll bring it back to the board. So go ahead, John.
Okay, I forgot one point, and thank you for hearing me again. I would think that this is the time that we start filling the chambers, coming back up here and having live meetings. We absolutely need that. Scrutinize the Brown Act. I've been reading through that. And really, to continue these Zoom meetings are actually leaving a great portion of the population out because a lot of people are not tech savvy, don't have the ability to have Zoom. We shouldn't have to cater to, or just have people who know what they're doing come in. And so we need these meetings to be assumed.
We hear you, and we are working. We had an update last week, and we're working on getting that completed. So, John, all right. It'll be sooner than later for sure.
All right, thank you.
Yep. Okay, we'll go ahead and bring it back to the board.
1 second, Mr. Chair. I do have a Kelvin here. He's been trying to comment.
Okay.
Sorry.
I didn't see it. All right, go ahead, Kelvin.
Hello, can you hear me?
Yes.
Okay, I just want to give a little background of myself. So, since the middle of March, I have been to Seattle for a week. I've been to LA for a week. All of my work is out of county. I've been up and down this state and in 5 different states in the last 3 months working. Okay, so I've been everywhere. And my concern is, as the Board of Supervisors, it is your job to protect our rights, not our health. That is our job. So there needs to be something legislatively done to prevent any reoccurrence of any form of lockdown, SIP, whatever you want to call it in the future. This should be a vote of the people to determine, not some unelected official whose salary we taxpayers foot the bill for. A pandemic does not justify any of these actions that were taken. To take our rights away for a pandemic is unconstitutional and should never be done again. The president's recommendation to slow the spread were exactly that, recommendations. Y'all took it to the next level and made them orders. There are several states that did not order anything of its people, only recommendations. They never ordered any business to close. They are all doing just fine and no worse than the rest of the states. Who is paying for these flashing signs sitting around the county that say to stay home by order of the PHO? They need to go, and we the people want an accounting of what the cost was for those signs. The PHO has no authority to order us to stay at home. He has the authority to quarantine someone he can prove is infected with infectious disease and those they were in contact with. That is it. You don't quarantine the healthy. Okay, so on the masking, New England Journal of Medicine, we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Cal OSHA regulations, cloth face coverings do not protect against COVID-19. California Department of Health, face coverings may increase risk if users reduce their use.
2 minutes, Mr. Chair.
Go ahead and if you can wrap it up, please, Kelvin. I know you've been waiting a while, so go ahead and wrap it up here.
Thank you. There's limited evidence to suggest that one of cloth face coverings by the public during a pandemic could reduce disease transmission. FDA, even if a properly fitted N95 mask does not prevent illness or death, there is no scientific evidence for healthy people wearing masks. CDC mask deception.
Okay.
There's plenty of, and I will end, but there's plenty of documentation out there. There's plenty of opinions out there. And here we sit, you know. I agree with Rob Brown. I appreciate his comments and his stand. And that's all I have to say.
Thank you, Kelvin. Okay, Jake.
All right, did we want to get that other hand here?
There is another one down there. John Arndt?
Yes, Arden.
Oh, it disappeared. I don't know if it went away or you still see it on your side?
No, it looks like it's gone.
Okay. All right, we're going to go ahead and bring it back to the board. Any other comments or questions for Dr. Pace? Supervisor Sabatier?
I just want to at least answer a little bit to some of what was touched on. That while the science is ever moving because of this being a new virus, Dr. Pace is not just doing knee-jerk reactions of what he feels needs to happen. This is based from at the very highest, the WHO, then going down to CDC, and then going down to the California Department of Public Health as well. And so this is not a individualized, personal decision-making that's happening. He has a team, and he's using data coming from above. Whether you agree with that data or not, at least we have to be consistent with what data we use. Unfortunately, I will also agree that some of those entities have not been very consistent in what their statements have been, where they've gone back and forth on the masking and things like that. It would be really helpful if they had not done that dance, because then it makes it controversial as to what is the facts of the matter. But I know that Dr. Pace is not just doing willy-nilly. He is definitely following the science, and again, that science is ever moving because of the status of the virus and what we know of it. And I hope that we can get to that final moment where we can say we know how this functions within our community, and we know what we need to do to be able to thwart it. But I know that, just wanted to make that statement.
Thank you, Bruno. It looks like Melissa has been trying to make a comment on the last one. Go ahead and I'm going to go ahead and open it back up to the public so we can have Melissa make a quick comment here. Go ahead, Melissa.
Thank you very much, Chairman Simon. And I apologize. I missed about the first 3, maybe 4 minutes of the meeting. But my question is, why is line item 7.4 being put off?
No, we put a, Melissa, that's obviously we're doing Dr. Pace's update. Made an announcement at the beginning of the meeting that we will not be taking up item 7.4 until past or not any earlier than 11:30 this afternoon. So we've got a lot of stuff in the morning agenda here, and we're going to do our best to. We will not take that item up before 11:30 today.
All right, thank you.
Okay, Melissa. So bring it back to the board. Any more questions or comments from Dr. Pace? All right, Dr. Pace, thank you very much. Appreciate the updates each week, and we will see you next Tuesday.
He'll be back for 7.4, I hope.
Yeah, he'll be back for 7.4 on that issue.
Okay. Yeah, okay.
As far as the COVID-19 update. Okay, I know we have some timed items that we need to try and move through, but I know we have some time-sensitive items. I know Supervisor Scott, let's take up item 4.1. I know Supervisor Scott is Crystal. Crystal, are you still on?
Yeah.
Yes. Yes, I am here.
Okay.
So what we are proposing today is to issue an RFP for an entity to come in and both manage and staff a emergency homeless shelter. The shelter would be at the former juvenile hall site. This project is really a follow-up to Project Room Key, and then also the COVID congregate shelter, Hope Harbor, that is in Lakeport. Project Room Key is scheduled to end on the 22nd, and Hope Harbor is scheduled to end on the 30th. Ideally, we would be able to move both populations to the hall. And, I think I don't want to give it wouldn't be functioning as a hall, obviously. It has been cleaned and painted early on in the COVID response as a place to potentially quarantine or isolate people who were COVID positive. And since that time, it really hasn't been used, but we do believe it has a good facility for what we're suggesting today, and we would put medical cots in to increase capacity. The bed spaces would also be counted, as Dr. Pace mentioned earlier, towards the 15% of our latest point in time count, which is part of the requirement in attaining the variance in terms of moving forward. So this would add between 40 and 50 beds to augment that number. And we would be losing part of those numbers upon the closing of Hope Harbor and Project Room Key. So we had the question, we'd been thinking about this for some time, but the question really was around funding. And in working with our partners, specifically Behavioral Health, who is the current lead for the the COC, we came up with a possible solution, which is money that is currently available to the county. It is not COVID money, but we could use that initially to start this project up, and then it would be backfilled by COVID money that we need to apply for, that we know we have a dedicated amount that we know would come into the county, and we could then backfill the money that we would be using initially. I know Director Metcalf is also listening in, and he may be able to answer any questions specific to the funding, but that is our proposal.
Okay, thank you very much, Crystal. I don't know if Supervisor Brown.
Well, so I get the need for funding for the ongoing place to house the homeless, give them services through this shelter in place process that we have. But what are we doing beyond that? Because I think we haven't had that discussion yet, and I think we need to have that. Rather, I know that Supervisor Scott was happy to announce that we're dealing with the caller's question on the last call, but this doesn't deal with it. This is talking about the homeless that we have right now. We're likely to have a lot more homeless if we keep screwing up, our actions And, you know, what are we going to do with that? You know, and you know, this ongoing funding source and all that. And the question, this is not the first time this has come up. We've had this discussion several times, several boards have. And the concern is always, you know, we have a moral obligation to take care of our folks here, but we don't have necessarily a moral obligation to create an opportunity for other counties to send their homeless here. We need to be able to take care of our own before we start inviting others, and that's what we see. You know, so you know, are we having that discussion? And I don't know what that looks like. I know there's a lot of people out there that are working hard, Crystal, yourself included, that work on this issue a lot, but we haven't had any really you know, process engaging the board as to what that's going to look like long term in Lake County. So that's what I'm kind of wondering where this is going to go long term. Getting enough money to get us through a month or two, that's one thing, but that's always a Band-Aid and never really you know, a solution to the long term problem that's not going to go away anytime soon.
Yeah, we'll go to you in 1 second, Bruno. You know, also to just bring it up, I know that the last time we had the conversation and potentially we're talking about the juvenile hall, I know that it was also mentioned that we have the space committee and some other things to talk about, you know, where some of these things might fit. So also just want to bring that up as we move through the process of talking about something long-term, just as Supervisor Brown said. You know, so Supervisor Sabatier.
Okay, sorry.
Oh, actually,
I would like an answer to my question. I wasn't making a statement. I asked a question. I'd like to answer that.
And I'm happy to respond to that.
Thank you.
So you're right, Supervisor Brown. This the intent is for this to be you know, part of our emergency response, and we know that we have access to emergency response dollars. But the way that we would do this is to create a system like it would be a housing hub, and we would, whoever the project was awarded to, we would work with them to develop a system for identifying the specific needs of each of the people staying there. And we would be looking for long-term housing solutions for each of them that would fit for each of them, along with making sure that they are receiving services throughout the community that they may be eligible for or need. So, you know, that is part of what we're thinking. We realize that we would need to go out and look for other grants to sustain the project, and that's what our ultimate goal is. We don't want to see this as only a temporary response. We want to see this as a long-term solution for serving the over 500 people that were identified in the last point in time count.
Okay, thank you, Crystal. Supervisor Sabatier.
And I wanted to somewhat respond as well. When I spoke with this to Supervisor Scott and to Director Marketan and also Director Metcalf, the idea was never for the county to be the purse of that program. The idea was we have a facility. Let's go ahead and get it started, get ourselves a nonprofit that would go ahead and take care of the rest, and we can support them with whatever we need to connect from the state, because there's some state dollars that are deliberately set aside just for homeless programs. And if we don't have a facility and a program to run, then we don't have access to some of those dollars. So I think that it'll be a collaborative, but it should not be, I don't feel, should not be something that the county is held responsible for, more so than being a collaborative agent of that program. I know that I was a part of a nonprofit, Lake Community Pride Foundation. We had the Lake County Safe House down in Clear Lake that housed some minors that were homeless. We didn't get any funding from the state, didn't get any funding from the county or the city. It was all through private donations and fundraising practices. And so I think this would be something similar. And we've seen some great nonprofits in our area, whether that's NCO, Lake Family Resource Center, or others, Redwood Community Services, that have done a lot of great work while they're collaborating with us and not utilizing only our funds to be able to do the programs that they're doing. So I'm hopeful that it'll be somewhere along those lines. And I think this RFP is a great way to start to kind of get the idea of who's interested in doing these programs. One of the reasons that it's coming to you as well is we're kind of at a window of opportunity here where because of COVID-19, we were kind of forced to do something with our homeless population that we've never done before. And rather than just dropping it and not taking that next step, it's a perfect opportunity to attempt to take that next step. And I think that we need to take it carefully, but I also don't want us to miss that window of opportunity either.
Thank you, Bruno. Supervisor Scott?
And because we are in an emergency declaration under COVID, we are able to use this building as an emergency function for our homeless population. If we weren't under the emergency, that building would need a lot of work before we could move forward. So our plan is to continue working on that building under the emergency declaration. So when it's over with, we'll be able to continue servicing, hopefully with the nonprofit that is chosen through this RFP, to continue helping our homeless population, along with Hope Center, hopefully opening by September. So we'll have one on each side of the lake to help our more than 500 homeless that live here in Lake County.
Okay, I see Director Metcalf. Go ahead, Todd.
Yes, good morning, Mr. Chair and members of the board. I just kind of wanted to chime in here in particular about the funding piece. We're looking at getting almost $1 million of COVID-19 monies to our county and the cities, the two cities, that we certainly don't want to turn away. And it would be a great opportunity for us to help convert the old juvenile hall into some sort of a housing hub, but specific right now to COVID-19 because those monies are coming our way. I do want to talk about, I'm working on putting a resolution together to bring to the board, hopefully next Tuesday. We do have homeless housing assistance and prevention funds currently available, almost $1 million there that the state has given us permission to use to start up this project. So the money is here. We already have it. And then these other COVID-19 monies will be coming, but we can use the homeless housing assistance and prevention funds now to get this project going. I mean, I can't say enough how urgent this is because yes, we have folks in the shelter, the COVID-19 shelter, and in Project Roomkey that, time is running out and where are we going to put them? And this I see as a golden opportunity for us to utilize these funds, maximize these funds, and long-term, hopefully turn that facility into something else. But now I feel that we need to use this money to get this project started. So that's my 2 cents worth.
Thank you, Todd. Supervisor Bhatti, I'm going to go to Supervisor Crandall. Go ahead, EJ.
Yes, and just wanted to highlight to what Crystal had talked about in lieu of getting the people that are homeless services. It's the best time to collect, especially since it's a dire need for people to live in an area or be sheltered in an area. Most of the time they're homeless because of a reason, it's either addiction or they're just in a hardship or whatever. And sometimes you're never going to even resolve that issue. Some people just like to be homeless. That's just the way they live their life. But there's times where, and it sounds like what you're doing is you're plugging people into services that they can actually obtain and hopefully get them out of the situation that they're in. And I just wanted to highlight that I appreciate that and that those are the type of things that need to take place to help with long-term solutions. And I hope we could, talk more about that as well. And I'd be willing to be a part of that if need be. So,
thank you, Supervisor Crandall. Supervisor Sabatier.
Thank you very much. I forgot to respond to another comment that was made by Supervisor Brown, and that's whether this will attract more homeless folks to come to the area. And I know that we've been in discussions, or at least I have been in discussions. I know others have as well. We just had a discussion with a group from Ukiah that run a homeless shelter. I've been to COTS down in Petaluma. There's some shelters in Santa Rosa. So we're kind of already surrounded by similar programs. We have not had these types of programs. And during that time that we haven't had those programs, we also saw an increase in our population of homeless. So I think that there's the draw of a shelter, it may be true if it's in an area where there's a lot of homeless people. Like if Santa Rosa builds a shelter, you'll see them from all around Santa Rosa go towards there to get the services. But here we already have our homeless population, and we need to at least try and provide the services, especially with the funding that's available through the state of California rather than coming out of our general fund. I do not believe that this will attract people from outside of the county versus providing a benefit to those inside our county.
Thank you, Supervisor Sabatier. Supervisor Scott?
And what we've already seen too at the COVID center and at Room Key is we've already stabilized some of these people in this population. They're not using like they were. They're getting used to being in a living environment. We've been able to get them jobs. We've actually also been able to get them housed. So that was the big fear, is that we have this 40 plus population stabilized, and we want to continue the work with them and to be able to move them to the next possible place instead of putting them back on the street to be able to start all over again. So it's really an exciting time that we are moving people in the right direction, getting them services and help, and getting them back on to be productive members of our society.
Thank you, Supervisor Scott. Supervisor Brown?
Well, okay, so this is why I want to have the larger discussion, because what we do now is going to morph into what's going to happen long term. And I think it's naive to think that no one comes from out of county if we provide more service, that they won't come from out of county if we provide more services. They just do. They migrate. The people that are in Lake County now, regardless of how long they've been here, are seen as from Lake County. Nobody says, well, you just moved here 3 months ago, so you have to go back. We understand that, but they're not. There's a large number of the homeless population all the time that's transient from other counties. They just do. We had some issues years ago. I don't know if Todd is aware of this. He wasn't here at the time, but we actually had Mendocino County was given bus tickets to mental health clients, behavioral health clients, and sent them to Lake County. That went on. That was, we had dozens of those until we put a stop to it. We wrote them a letter, so you guys can't be doing this. And so, it does happen. So I think it's naive to think that it doesn't. And I don't even know what the committee looks like. Who's actually a part of that. I know there are people that have that as a passion, and some are doing it because it's their job and their passion as well. But I don't know who's on that committee. It'd be nice that, if we ever open up the courthouse and people want to come to work here, we can, have that discussion here. It'd be nice to have everybody in the same room at some point. But it's the same. It's part of this discussion, but it's also separate. I'm trying to encourage you to, bring that to us sooner than later. We need to have that discussion because it's not going to go away.
Thank you, Supervisor Brown. Crystal?
Yeah, and I do understand Supervisor Brown's point. Absolutely. I do think that this is really, it's a county issue, and it should be part of a county discussion. There's a lot of momentum currently behind serving the homeless. It's one of 3 target priority areas for Hope Rising. And a lot of work has actually happened around this, including the purchase of a building in Clear Lake, which is currently being renovated to serve as a housing hub. Supervisor Scott mentioned that earlier. So ideally, if everything worked out, as we would like it to, we would be able to have 2 housing hubs, one at each end of the lake. And and the plan for both is to work intensely with people while they are staying at the housing hub to identify their needs, and then to help find appropriate housing for them. CDSS has become a new conduit for homeless and housing funding, and so money has been coming down through the Department of Social Services, and we have here in Lake County applied for and been awarded 2 different housing projects, and that's in addition to already having the Section 8 vouchers. And so I think and then behavioral health is currently lead agency for the COC. And I think that, we're in a good position to be working collaboratively on addressing this, the homeless problems that we have in Lake County. And I would like to think that most of the people that we have identified in the point in time count are Lake County residents. There may be some fluctuation there, but currently we don't really have services and that work like what we are suggesting. And so I think that it will become very evident early on, who are local Lake County residents in need of help. And that is definitely the population that we are wanting to address with this approach.
Okay, Supervisor Sabatier.
I will say I appreciate Supervisor Brown bringing up, saying a comment that I absolutely agree with, and we should formalize the ad hoc committee and bring it to the Board of Supervisors for approval, and also for what does that structure of that committee look like, because I think it's going to be a long-term committee rather than a short-term. And I think right now it just kind of got put together quickly for the fact that we wanted to find a way to fix this during the emergency. But I think that he's right, that we need to kind of slow down, formalize it a little bit, and then keep moving forward. That way it's part of the Board of Supervisors rather than this ad hoc.
Well, we already have a vehicle. We already have a group, the Housing Continuum of Care. I believe it represents every facet of the county. I mean, I don't see why we would want to reinvent the wheel and create some new committee. Let's just lean on them. They know this. This is their mission and their goal is to address homelessness in our county. So I say let's use them. They're already working on it.
Thank you, Todd.
So that probably would work, but we haven't actually had them in the board meeting and find out who they are. How many people are on there and who's on there? Can I ask that?
I wish I could say off the top of my head. It's a robust group. I'll say that.
Are any of them homeless?
Not to my knowledge.
I believe we do have one.
And the reason I asked that
homeless.
is, so here's the thing. After the Valley Fire happened and I put together a group of people to rebuild Cobb and Middletown, and I used only people from Lakeport, that would seem kind of silly. So I think that we should have somebody that we represent that has a perspective that the rest of us don't have, should be included in that as well. And I'm not talking about somebody who's applying for a grant for a home, or I'm talking about somebody who's actually living the life, and not just one person that's symbolically there. I think if we're going to be serious about this, we need to get a perspective on that committee. So I would ask for that too.
Thank you, Supervisor Brown. Carol?
Thank you, Mr. Chair. I just wanted to make a couple of points. First of all, as you know, the board has an advisory committee that typically advises it about the use of county facilities and space. It's called the Space Committee. And your board's appointees to that committee are yourself and Supervisor Brown. Ordinarily, this type of a discussion is accompanied with a recommendation from the Space Committee, but the Space Committee has not been convened on this subject yet. I don't think anybody realized that the RFP today included a definitive location, although I think most people were aware that there were some discussions going on about the use of juvenile hall. Given that this discussion is taking a more specific form and contemplates the juvenile hall in a definitive fashion, we are convening the Space Committee. We put out a meeting request to you later this week. So hopefully that can take place. And the other thing that I wanted to suggest is that we involve the administrative office and also the auditor controller, who is our disaster finance chief, to take a good look at the funding streams that are being talked about as a possible use for this facility. We want to make sure that there's no future audit disallowance for this type of a project. And as you know, there were some pretty definitive rules about, the use of COVID funds. And so I'd like to bring a couple of other folks to the conversation with this continuing ad hoc group, because thus far the Administrative Office and Disaster Finance haven't been a part of those discussions, I don't believe.
Okay, thank you for those updates. Okay, any more discussion from the board? Okay, we're going to go ahead and open it up to the room, to the public.
All right. It looks like the first comment we have here is from Silence Do Good.
Okay.
Can you hear me?
Yes, we can hear you.
So I live near that area, and I feel like this got snuck onto the agenda without really putting out much notice for the surrounding homes and not much oversight. And while I sympathize with the ones that want help, there's also some that want to be homeless and they also want to be trouble. And if you guys look at the police logs for in and around the homeless shelter that's currently in place, just last week there was potential stabbing across the street because the motorhomes that are attracted by the homeless shelter are an issue too. And so like you got the homeless shelter, but then you got the other homeless shelter across the street in the Kmart parking lot. Lowers the surrounding property values if there's a homeless shelter there. And no one knows who's on the current committee. The board doesn't even know. Like, I just feel like this is really, really rushed and probably just needs to take a step back and make an educated decision about this all. And honestly, this was probably Gavin Newsom's hope, was to have these counties rush into this situation and make this hasty decision. So that's all I had to say.
Okay, thank you. Okay, Jake, let's continue on with the hands up.
The next hand we have up here is Matthew Nelson.
Hello, good morning again, everybody. Thank you for giving me some time. So, a couple of points. We need to stop addressing this as a homeless problem and understand it as a political issue that's been ongoing for a long time. And like to the last person's comment that the COVID thing has been the accelerant on this, that's absolutely accurate. This situation has been brewing for years and years and years. It's not just something that now all of a sudden we need to put focus on because of the emergency due to COVID-19. This is something that we've had the opportunity to address and handle. As a matter of fact, I had spoken 2 years ago about possibly using a facility like the juvenile hall being one of them to accommodate a program for rehab and temporary housing and vocational training to get these people the help they need so that they can get back on their feet. A lot of people lost their homes during the Valley Fire or whatever, and they fell victim to this. It's not their problem. It's our problem. We need to make sure that we give them the ability to get on their feet and get going. As to the drug and criminal side of things, this is another reason why we need to absolutely support our law enforcement and make sure that they have the tools and training necessary and the staffing and funding that is necessary for our little community here and statewide. So I would assume people have worried about where the funds are going to come, because once the emergency runs out, so does the funding. That's where we need to press the state, the assembly, the state senate. We need to get them to dedicate funds so that we could be the flagship for the state. Thank you very much.
Thank you, Matt. I see John Art.
Yeah, I'd like just a little follow up to that. I think from your voters' perspective, the real emergency as they see it is not COVID-19. It's the lawlessness. All you have to do is follow police scanners, and you'll see months of anarchy and debauchery and disregard for respect of law. And your policies have created this situation. And simply passing the buck and saying we're going to develop these experimental programs to make committees to pass on the consequences to somebody we haven't awarded contracts to yet while we have this money, that's not a real solution. These people are not in homeless shelters most of the time because they have drug and alcohol problems that prevent them from being accepted. So we've created a situation where these people have nowhere to go, and then they're flying on the streets. And it doesn't seem to be, that seems to be the real emergency. And your voters are going to have that as their number one concern when they go to the polls for your reelection. So I hope you guys bear that in mind when you create future policies, and don't take the bait, so to speak. Thank you very much.
Thank you, John. So there's two more hands up here. John Sheridan. Thank you, John.
There we go. Thank you, Mr. Chair. The concern with this dedicating county funds and COVID funds for future, consideration, is there going to be enough funds to actually keep this thing going for years and years and years? This seems to be a little knee-jerk reaction to take money all of a sudden, that we're getting for the COVID thing, and moving on. I feel my heart is heavy for the homeless, but I've worked with homeless before at shelters, and it's bigger than this. There's a lot of things not being addressed right now. The whole psychological thing, the training. This is going to amass great amounts of cost. It's going to cost a lot of money to instead of looking to heal the symptoms of homeless by giving them a shelter and this and that. We need a whole education program. We need training. And these people, if they want to remain homeless, they can't be a part of it. Now, we can't continue to give these handouts to people who are intentionally homeless, but the ones that actually want help, that is whom we should reach. And the thing is will the funding after COVID's done be there to continue at that high level of help for these people that, and the homelessness being created over this COVID, over the destruction of businesses? There's a lot of repair that has to be done. So I would caution to use these funds very intelligently and keeping the future in mind. If this is just going to be a temporary fix, and then and you're going to have to scramble for more funds later on to keep it going. So that's my input. Thank you.
Thank you, John. Supervisor Scott.
We'd just like to add to that Lake County has missed out on lots of opportunities for funding because we did not have a program to be able to use to take those funds. So this is really the right step in the right direction to be able to help these people be able to get the funds that we haven't been able to use. So I really think this is a win-win. And we know that it costs far less to house somebody and give them treatment than to have them on the streets.
Thank you, Tina. Supervisor Brown, did you have a comment?
I did. There's been a couple of comments coming in that this was snuck in on the agenda, and granted, it wasn't extra, but we talked about this a couple of weeks ago when Bruno brought it to the board, and it's as an interim response, the juvenile hall was considered, and we talked about that, and it's going to be considered at the Space Committee. We probably should have done that, but this funding just came available. Now, here's the thing that I want to say on behalf of staff. Again, we've talked about this for years, this issue, but we've never actually, gotten into it because we've always got something else that comes up. This problem isn't going to go away. We need to have this discussion long term. I realize that's not what's on the agenda right now, but we can't just gloss over it and say, well, let's deal with it later. We have to have that. So, but here's the thing. The board, this current board, past boards, all of them have given staff marching orders. We've told behavioral health, whether it be Todd or the folks before him, when it was it's Crystal, when it was Carol, we all said, go figure out a way to make this happen. They're doing that. So I don't see anybody saying this is what we need to do. It's just, we need to apply for this funding. We need to get through this. We're going to be working on it. I know I've walked in on board chambers when, Todd was in there and Crystal's in there, and they've got a room packed full of people that are interested in this and trying to work to make this happen. So I know there's an effort. This isn't something that's being snuck in. It's just going to happen. It may happen interim, but until we have this healthy, thoughtful discussion, including everyone, there is no long-term approach to this. We need to take one. There's no question about it. And I agree, this funding would be the first source of that. I don't agree with the now all of a sudden, this is a big emergency and the governor's putting money in this. I don't agree with that approach, but that is what's happening. I know Senator McGuire and I had discussions, 4 or 5 years ago about funding to buy properties and use it for transitional housing. So there's an effort, I know, at least on his part, that his staff have been working on. I'm not sure where that is currently, but I know they've been working on it. But we better get to working on it. We can't just say, okay, we got through it. We're set for a couple of months of funding. Now we'll worry about it later. We need to maintain some momentum to figure out what's going on with this with the issue and how we're going to resolve it. But I just felt like I have to defend staff. No one's sneaking this in on us. No one's, forcing us to do anything right now. This is our job. We either have to own it or stop. Just stop what we're doing and move on to something else. I think it's not going away. We need to own it. And I appreciate staff at least bringing it to us. They're following marching orders to go find a solution. And if someone else has another solution, I'm open. I'm open to it. I got 20 more meetings left. But I'm open to at least using them to try to identify, some solution, because I guarantee you that the homeless issue has a hell of a lot more than 20 meetings left.
Thank you, Supervisor Brown. Crystal, Supervisor or Mark Tan. Crystal, go ahead.
I just wanted to say that I agree 100% with what Supervisor Brown is saying. I mean, this isn't a new issue. It's not an easy issue. It will take concerted, long-term effort. We do have an opportunity right now with some COVID money, but clearly, it will put us in a good position to apply for further funding down the line to be able to sustain whatever we put in place initially. I do think there's the parallel need to maintain the number of beds available for the variants in terms of COVID response. That's, this will also satisfy. But I welcome the board's participation in terms of solving the homelessness issue. I think that it is a county issue. I think that, we do have some momentum with Hope Rising and the group that works on homelessness as one of the 3 areas that they're concentrating their efforts. But I think that, they should be working in tandem and not in silos. And so what I'm hearing is really an understanding that there is, we do have something that we need to address in the county, and that this would just be an initial start to that plan moving forward.
Thank you, Crystal. Supervisor Sabatier.
Thank you. I just want to mention that, at least from my perspective, I never approached this topic as a homeless shelter. It was always the idea of transitional living, which would mean that it's people who want to be there, not forced to be there. And I think that makes a huge difference in how that program will be run. We're looking to be successful, not try our best to help everybody. We recognize that this is a chip off of the block of this entire solution for homelessness. This will not solve our entire homeless population issues that we have, but this is a good opportunity. And I think just like anything we do, even our Marine Patrol is based on grant funding from the state. How much longer are we going to get those funds? And I think we have to take advantage of the funds that are available when they are available, versus looking in hindsight and saying, we missed a great window of opportunity to do something, and instead we did nothing. So I think that we do want, I want more conversation. I want more concrete written program of what it is that we're going to do. And I think it starts with this, because we can't dictate what that's going to look like without the nonprofit sitting with us and saying, this is possible, this is impossible. And so I think that it will require more discussions. I look forward to that, but I'm looking forward to moving and taking action on this.
Thank you, Bruno. Todd, do you have a comment on this?
I was going to, but Supervisor Sabatier covered it.
Okay. All right. We have one more hand up here. Teresa. I see Teresa has her hand up.
I'm gonna wait until a little bit later into the meeting as well. They've covered pretty much what I wanted to add. Thank you.
Okay. All right, Jake, do we have any other hands up on this item?
It looks like that has been everything. I don't have any additional comments. Yeah, so we can open up the floor if you want to do that.
Open up the floor, and then if we don't get it, we'll bring it back to the board for action.
All right, so I'm going to open up the floor here. And the floor is open. If you would like to make a comment, please state your first and last name.
Clearance for
He's dialing in. Okay, Jake, go ahead and close it up and bring it back to the board.
Okay.
Mr. Chair, I move to approve the RFP for daily operations and fiscal management of a temporary support shelter targeting Lake County's chronically homeless population.
Is there a second? Motion and second. All right, Johanna, can you move forward with the roll call vote, please?
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Okay, for just timing here, we're going to try and get back on track here. I know we're behind schedule, so we're going to go ahead and take up item 5.1 and 5.4 later on the agenda. And we're going to move to, let's go item 6.1, public input. Public input is for items that are not appearing on the agenda. Did we have any today, Carol? I didn't see anything.
There was none received by email.
Okay, excellent. All right, Jake, can you open up the room?
Yeah, I will open up the room. It doesn't look like we have any hands, so the floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake. I'm not sure. Go ahead, Jake. We'll close it up and bring it back.
Okay.
Okay, moving right along. We'll go to our 6.3 item, or 9:45 a.m. Consideration of a continuation of a local emergency and an order prohibiting the endangerment of the community through the unsafe removal, transportation, and disposal of fire debris for the Mendocino Complex fire. This is put on by the Health Services Director, Dr. Gary Pace.
Hello again. Yeah, this is basically the continuation of the previous emergency declaration. We're just trying to coordinate the cleanup of these, I believe it's 22 sites from the Mendocino Complex fire. The update is that actually our EH director, Jazzjit, had some contact with Cal OES, and they said the issue right now is that there was a budget item in the state budget that they were not willing to come until they were sure that the budget item had survived the process, which was supposed to be determined yesterday afternoon. I believe they're still in the kind of the wrestling about the kind of the whole state budget right now. And once they get that secured, which he thinks it will be, then they will make plans to come on out. And he was talking early July. So if this works out, that it survives the budget process, then they should be out within a couple weeks to kind of take care of this. And so we're really trying to push them to come out. They have to come out and do some road repairs out there so that their equipment can get in all the way to these sites, and then hopefully they'll clean it up. And so we're really pushing them to try to get in before the fire season starts again so that we can at least close this process up. But so right now we've been in contact with them. We're waiting to see what happens with the state budget process that should be happening today or tomorrow. And he said he'd get back to us before the end of the week.
Okay. Any more questions from the board? Comments? All right, hearing none, we'll go ahead and open it up to the public. Any public comment on item 6.3, continuation of local health emergency? I don't see any hands up. Jake, can you open up the room?
Yes, I will open up the room. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, hear none. Go ahead and close it up and bring it back to the board for action.
Mr. Chair.
Supervisor, go ahead.
Move to approve the continuation of a local health emergency in order for prohibiting the endangerment of the community through the unsafe removal, transportation, and disposal of fire debris for the Mendocino Complex fire.
Second.
There's a motion and a second. Johanna, can you please do the roll call vote?
Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
Yes.
and Supervisor Simon.
Yes.
Thank you.
Thank you.
Mr. Chair, we're going to take a break at all?
Yeah, requesting a break. We want a 5-minute break right now.
Yeah, that sounds good.
Okay, we got 10:57, so let's say about 11:02 we'll come on back. Are we ready to go? Okay. All right, we're going to go ahead and reconvene the meeting. We are on item 6.4, our 10 a.m. item. It's a public hearing, consideration of draft Lake County housing element as an interim housing element to bring Lake County back into compliance with state regulations. Community Development Director Scott DeLeon. Go ahead, Scott.
Good morning. Well, we're going to try to be brief with this item. This is an interim step. Staff in 2019 and actually even before that, 2016 had developed a draft update to the housing element, and was submitted to the state. They had submitted some comments back, and it was going through a process. But multiple disasters, multiple staff changes, things of that nature. It was never formally adopted. It went through some public review, had gone to the Planning Commission, but had never been formally adopted. And as a result, the county is out of compliance with our housing element. Staff has been working with the state, and the state agrees that this interim step is acceptable. Basically, what we're asking you to do this morning is adopt our draft housing element as an interim step. What this will do is it will bring us back into compliance with state regulations, and more importantly, make us eligible for some funding that's available as a result of COVID-19 funding and other federal CARES Act funding opportunities. We have, as you may be aware, we have hired a consultant to complete the housing element. They are already working. They began in May. We had a kickoff meeting in May. We applied for some LEAP funding to help with this effort. And so you can expect to see public participation, public input, and a review of their draft later this fall. And our target, I believe, is April of 2021 for the final adoption of the final housing element, updated housing element. So again, this is an interim step. We've run it by the state. They're okay with this and are actually encouraging us to try to do this. And again, will bring us into compliance temporarily and make us eligible for some funding. So I believe Tokara is on the on this meeting.
Yep.
And between the two of us, we'll do our best to answer any specific questions that you might have.
Thank you very much, Scott. I don't know if you have any comments at this time, Takara, or you just wait and see if there's anything that you need to answer. You're still on mute.
Can you hear me now?
There we go.
Sorry about
Yes.
that. The only one comment that I do want to make is regarding the resolution attached to this agenda item. We need to make one clarification note for the title. It needs to say, oh, darn, I don't have it in front of me. But it just needs to say in the title that it's out of compliance and that adopting it on as an interim measure will bring us back into compliance.
Okay, thank you for that clarification. We can work on that before we take any action.
Would it be the same as the language on the agenda item? Because it actually states that in the agenda item.
Yeah.
I believe so.
And I can read that again.
I can verify it before we bring it back before you for final signature.
Okay. And I'll make sure, I'll just go ahead and read that again. Consideration of draft Lake County housing element as an interim housing element to bring Lake County back into compliance with state regulations. So I don't know if that's what you wanted to read, but I just put it there on the agenda. Read it back to you. All right, go ahead. Any comments, any more comments from the board? Go ahead. Supervisor Sabatier.
Thank you. So I was looking at our housing goals, and there's no mention of rebuilding or anything like that. Is that something that should be part of our housing element, is to kind of display the loss, to illustrate the loss that we've had in the past and the rebuilding that we have been working on and have not completed at all. And I'm just wondering if that needs to be in part of our state housing goals, because I don't see that on there. I read through the majority of this, and I don't believe I saw fires being identified.
Absolutely. I think that's completely appropriate to include as part of the narrative at a bare minimum. It needs to be part of the story. I'd like to see the housing element document be a standalone document and something that anyone could pick up and get a history of some of the challenges and the things that we've got going here in the county. And so absolutely that history needs to be included and incorporated as part of that. And we will make sure that at a minimum, it's included in executive summary or a narrative at the beginning of the document, for sure.
Okay. And then I know that we all received, it's in our agenda, a letter from Betsy Kahn, and she asks why only moderate housing. And I know that when looking through the entirety of it, it talks about very low and low income housing and provides numbers of what's needed. Is that a state housing element, a requirement to show only moderate housing map versus the others?
If Takara has an answer for that, I don't. So that'll need to be something that we make sure gets vetted as part of the new housing element And I have been in contact with Ms. Khan and plan to have her as part, certainly involved in the review process, and we'll make sure that her concerns are noted.
Okay. And then my last thing is, I noticed it as well, and I saw it in Ms. Khan's email, that we have, I don't see your name or I don't see Takara's name on there. And I would like to make sure that those who have followed up on this to make sure that we're now in compliance with the state are given the credit of the work that they've put into it to bring it to us and then get it updated. So I just want to make sure that we update that with the correct names of those who have been working on it as of late.
You bet.
Okay. Director Metcalf, go ahead. Todd, it looks like you want to make a comment there for a minute, so go ahead. And
just a quick comment. I want to thank Director De Leon for bringing this forward. As behavioral services oversees the housing continuum of care, as Director De Leon pointed out, it's prohibiting this, without this being approved, is prohibiting us from going after more housing monies, even housing monies for the homeless. So if there's anything I can do to help to fast track this, please let me know. But I wholeheartely support this, because without this, we're being passed over for funds that we would normally be entitled to if we had an effective and active housing element. So thank you.
All right. Supervisor Brown, do you have a comment?
Yeah, I do. I just, I appreciate Scott and Takara bringing this to us. It's one of those time and resource suck from the state that we're doing here. And it's unfortunate that we have to spend all this time, because it's like the testing. We have to have so many tests done, but we can't force people to be tested. And it's the same thing here. We have to have we have to prove that we have so much inventory, but we don't build houses. So, we just have to prove to them. It's got to be updated on a regular basis because of the grant funding that Todd spoke of. But that's really the only basis. We have the inventory available, but the problem is we have so much going on, and staff is just buried up there with people who are actually builders and actually developing and wanting to do stuff. So now we have to do this in order to once again kiss the ring of the state and beg them for money that's already ours to begin with. So it's unfortunate that we have to do this, but it's just a reality. So I appreciate them biting off that one more thing that needs to be done in order to pacify the state. So thank you guys for doing that.
Hey, any more comment from the board at this point? Okay, we're going to go ahead and open up the public hearing and turn it over to the community to comment on our 6.4 item. So public hearing is open. Go ahead. Is there any public that wants to? Yep, I see a hand up right now. Jessica Paiska. Jake, can you open that up for her? Yep.
Yeah. Hi, can you hear me?
Yes.
Okay. Yeah, I'm glad to see that this is moving through so that we can get some of the funding. And then as we move forward, I'd really like to see the strategies for the Cobb area, obviously after the fires, and how we can move that forward. I was looking through the document in 2.2, and I'm wondering what happened to the Lake County Redevelopment Agency? It says there's been a vacuum since 2012, and I don't really know the history, but it seems like that would be the group that helped move this process along. So I just want to put that out there and see if I can understand the history there.
I can give you go ahead.
Yeah. Well, I was going to do the same thing if you want. The redevelopment agency was something where the redevelopment areas like the North Shore and some of the city of Lakeport and the city of Clear Lake too had some, and those funds went away, so the agency went away. It's the same but different. Redevelopment agency was specific to redevelopment funds and money that was available for those specific areas, and it's not necessarily the same as the housing element for the entire county.
Yeah, and like you said, Supervisor Brown said, from the history standpoint, has been wrapped up. I am the board's appointee on the RDA, Rural Development Agency. Kelly Cox is the chair. And really, it's we're wrapping it up. There were properties that were bought and need to be sold and things. So there is no funding or anything. We're kind of winding it down. That's the responsibility of the county to do as we go through this process. And we're working with both cities and other folks as we move through there. So Clear Lake has been very active, and we'll be on that board as we wrap that up. That's part of the responsibility of finishing that thing out. So Jessica, I can talk to you more about that and give you some more information. But really, it's being winded down, and we're just kind of moving through that process as the RDA. And we meet kind of infrequently, just when it's needed, when properties are sold that were purchased at one point. So that's kind of where we are at this point.
Great. Thank you, guys. I appreciate that.
Is there any other folks that would like to speak in the public hearing on our housing element? Anita, go ahead, Anita.
Thank you, Mr. Chair. I would just suggest that since the title really should be brought up to be consistent more with the agenda item, you may want the title of the resolution to simply read a resolution adopting a housing element to bring the element into conformance with existing state housing element law, and then just end it. There's no real explanation for what the 6-cycle planning period is, and it really should say housing before element.
Okay. Duly noted. Thank you, Anita.
You're welcome, sir.
Is there any other public? I don't see any other hands up on this item. Jake, can we open up the room, please?
Yeah, I could open up the floor here. The floor is unmuted. If you would like to make a comment, please start with your first and last name.
Okay, Jake, go ahead and close it down, and we'll go ahead and close the public hearing at this point, and we will bring it back to the board for deliberation and action. Supervisor Crandall?
I think it's motion to adopt or offer the ordinance. Is it the ordinance or is it the?
It's a resolution, correct?
Resolution. Yeah, so offer the resolution. Yeah.
As amended.
Stated by county. Yes, as stated and amended by county council.
Okay, I see. Anita, your hand popped up there. Was that just for a clarification on the amendment there?
That's correct, sir. Thank you.
Okay. All right, the resolution has been offered as amended.
Okay. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
Thank you, Scott. Thank you, Takara.
Thank you, board. Appreciate that.
All right, we'll move right into the next item, item 6.5 or 10:30 a.m. item, a public hearing for consideration of Valley Oak subdivision, vesting tentative subdivision map extension SDX 19-02. Go ahead, Director Doan.
Thank you very much, board. This is an extension. You're basically going to be approving the extension of a time extension for already or previously approved subdivision map down in Middletown. The Planning Commission has approved the extension, and our county code requires that the Board of Supervisors also approve that time extension. I'm a little conflicted, to be honest. Staff has prepared a very nice and thorough presentation describing the project, all of the environmental review that's been done, and it's comprehensive and very well done. My concern is you have a lengthy board agenda today. You're already nearly an hour behind, and you have quite a bit of work ahead of you. And so I will offer, if you're interested in asking any questions or seeing the presentation, we'll be happy to to move that forward. But if, in the essence of time, if your board would prefer to simply forego that, we'll be happy to answer any technical questions about the project or the subdivision map. And then prior to taking any action, I need to correct the sample motion. It appears the board date on the board memorandum needs to be adjusted to June 16th instead of May 26th. But other than that, we'll be happy to take any direction that you would like us to go.
Thank you very much, Director Dillon. So I will open, obviously, we were provided the information in our packets. I will ask the board, what they would recommend here in this one. I think moving forward with the information we have, unless you have a specific question, I think would be positive. One other question I'd have with Anita on that would be, what's the opportunity with the public hearing? Could we just go with the information that's been provided to the board and then open it up to public comment? And what's the process on that?
Well, at this point, as long as staff has submitted its staff report, which it has and goes into detail, if your board has further questions that can be answered by the presentation, you can certainly determine that. And if the public makes comments that would require, according to staff or your board's assessment, further information, then you can do that at the time. But there's no requirement that there be an elaborate presentation for your board. It really depends upon how much information you and the public need to feel satisfied that you've got the whole picture.
Okay, thank you very much, Anita. So we'll go ahead and open up the board. Any questions or comments? Supervisor Sabatier. Go ahead,
I just wanted to ask CDD, am I muted? No. Wanted to ask community development about the mitigated neg deck, and no action has been taken on this property. Nothing has changed. Therefore, it still meets the requirements that it needed to have in order to be approved previously. And so therefore we can go ahead and move forward with the previous approval.
That's correct.
Has changed on that property.
Right. No, there haven't been any substantial changes. There has been a building permit issued for some grading and some construction work, but with respect to all of the environmental work that was prepared as part of the subdivision, the original subdivision map, nothing has changed. And I should point out also that the presentation that our planner, Victoria Kim, who I see has joined Takara, the presentation that she prepared is basically a summary of everything that you have in your memo, and but pictures do speak 1,000 words, and the pictures of the presentation she made summarizes everything that you have there. So it's nothing, no new information. It was basically a pictorial and visual summary of everything that's in the board memo.
Thank you, Scott. Any more questions from this point from the board? Okay, seeing none, we'll go ahead and open it up. Open the public hearing up for item 6.5, 10:30 a.m. item. Consideration of Valley Oak subdivision, vesting tentative subdivision map extension. So we'll go ahead and open it up, the public hearing. So Jessica?
Yeah, I just had a quick question. Looking at the subdivision map, it looks like there's just one main entrance and exit for the residential section. Are there other emergency exit areas off the cul-de-sacs? I mean, I'm sure CAL FIRE has been a part of the whole planning, but whenever I see a subdivision that just has one way in or one way out, I just want to ask the question, are there other ways to get out of this subdivision with such high density?
So the map that you see there has an access off of the state highway and then a secondary access, and it's there's one off Arabian Lane and one off of Hartman. And the developer is currently working with Caltrans on securing the official access, and they're in the process of codifying that with Caltrans. But yes, there are two ways in and out.
Great, thank you.
Supervisor Sabatier?
Just to follow up on that, I know that we've talked about Arabian Lane before as far as working with the developer. Is that completed, or is that still something that's in the works?
That's still in the works, and hope to have that completed here in the very near future.
Okay.
Thank you for that update. Okay, I don't see any other hands up at this point. Jake, can we go ahead and open the room up?
Yes, I will open up the floor. The floor is unmuted. If you would like to make a comment, please state your first and last name.
Okay, Jake, go ahead and close it up. We'll go ahead and close up the public hearing and bring it back to the board for action. And Supervisor Sabatier or someone can pick this up for me. I greatly appreciate it.
I will gladly do that. I will say thank you, Victoria, for preparing a presentation, and apologize that we're not giving you the time to present it, but really appreciate you doing that for us. I will go ahead and approve the Valley Oak subdivision vesting tentative subdivision map extension SDX 19-02.
Is there a second?
Second.
Okay, motion and a second. Please roll call vote, Johanna.
Supervisor Sabatier?
I just want to make sure, was I supposed to add the mitigated negative declaration portion to my amendment, asking for Ms. Grant to see if I need to amend that?
Yes. Anita,
Yes.
go ahead.
Thank you, sir. There are two sample motions on page 5. I am assuming that both of these have to be done. I would think that that's consistent with the law. So first you'll reconsider and approve the mitigated negative deck, and then the tentative subdivision map extension approval.
So I will start again with a new motion. I move that the mitigated negative declaration, which was previously prepared for initial study IS 06-01 for the property located at 18196 and 18426 South State Highway 29, Middletown, California, 95461, does meet the requirements of section 15162A of the CEQA guidelines, and that no additional environmental review need to be prepared for with the findings listed in this board memorandum dated June 16th, 2020.
Is there a second?
Second.
Supervisor Crandall seconds. All right, go ahead, Johanna.
All right, Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
And I apologize. I tried to shorten the motion, but I felt Anita's shadow over me saying no, no, no. So I move that the Board of Supervisors approve the tentative subdivision map extension SDX 19-02 applied by Land and Development Inc. on property located on at 18196 and 18426 South State Highway 29, Middletown, California 95461, APN number 014-260-36 and 014-260-51, and subject to the conditions and with the findings listed in the board memorandum dated June 16th, 2020.
Is there a second? All right, motion in a second. Go ahead, Johanna.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Aye.
Thank you.
Thank you, Johanna.
Board, thank you very much for this morning, and I appreciate your recognition of Victoria and We'll send you the PowerPoint just so you can see it. It's very well done. Thank you very much.
Thank you. Okay, moving along to item 6.6, our 11 a.m. item, a public hearing. Consideration of fiscal year 2020-2021 recommended budget. Consideration of the proposed resolution amending the position allocation chart for fiscal year 2020 and 2021 to conform to the recommended budget. And C, consideration of authorization of affected department heads to proceed with purchasing selected capital assets prior to the adoption of the fiscal year 2020 and 2021 final recommended budget. It's put on by Administrative Office. So go ahead, Carol.
Thank you, Mr. Chair. Stephen Carter and I are going to be presenting this, and I just want to make sure, Stephen, your audio is working. I know you were having some issues this morning, so can you give us a sound check?
Mr. Chair, I got a question.
Yes, Rob.
So, Carol, do you have any idea how long this will take? Because I don't want to speed through it, and I don't, want to give you the time, but I also know that we're all going to be here regardless of when we take this up, and we have a lot of people who have taken time out of their busy day to join us for the 11:30 item. So I'm not sure it would be valuable for their time.
To wait, Mr. Brown, absolutely. If the chair would like to take up 7.4, that's totally fine.
Yeah, it is 11:32. That's, yep, I'm fine with that. Thank you for that suggestion, Rob. So we'll go ahead and we'll address the item 6.74. Yeah. No, I was just going to let the public know that we'd take up 6.6 after that. So we'll go ahead and move to our 7.4 item. I made the comment earlier. Hopefully the folks are on the line. We said we wouldn't take it up any sooner than 11:30. It is 11:32. So item 7.4, consideration of an urgency ordinance establishing temporary compliance officers to assist local businesses and members of the public in the gradual reopening of Lake County during the continuing public health emergency, and to provide a process for the assessment of administrative fines for violators of state and public health orders. We took this up last week, obviously, as an extra item, so we could bring it to the board to have the discussion. Ultimately, it is part of the enforcement discussion that we're going to have today. Glad that there is a lot of interest, so we can get through this. But I think it is a very important issue that we need to address as we are reopening up our economy. So the administrative officer put this on. I don't know if we want to put it up on the board or how we're going to work through this process, but wanted to bring it back and have the discussion today.
So, Mr. Chair, that's all correct. I placed this agenda item on your board's agenda today after your direction to do so last week. County Counsel, Anita, had prepared a draft urgency ordinance for your consideration. It is included in your agenda packet. Could project it as well if you like. And I think Anita will probably present to you the components of it. Would you also like it to be visible on the screen?
Yeah, I think if that's possible, yes. I think that would be...
Give me just a moment, and maybe Anita can be speaking to it while I get it pulled up for you. So, Anita, if you want to go ahead and present it, I'll put it up.
Okay, Anita, go ahead. See Anita's hand up.
This is a very rough draft ordinance, Mr. Chair. It is intended to establish the opportunity to use code enforcement officers temporarily as compliance officers to first and foremost offer training, information, and assistance to local businesses and members of the public with the purpose of fostering compliance with state and local public health officers during the reopening period. As requested by your board at the last meeting, there is also a procedure for the imposition of administrative fines. You'll see the circumstances through which such a fine could be assessed, and the fact that there is an appeal option directly to your board. And that's the essence. That is the essence of it. As far as whether you wish to proceed and what changes you want to make to the form. I simply await the instructions of your board.
Thank you, Anita. And I think, as we're having this discussion, obviously everything we're talking about is from education, but at some point we talked about it, and I think Bruno put it the best, some type of teeth to help, navigate through this process as we move forward. Like I said, reopening the masking issue and, having some type of enforcement to be considered with the masking order that is in place by the public health officer. So wanted to have this conversation today here at the board level. And I know that everybody weigh in and we'll open it up to the public and move through this process today. So Supervisor Sabatier.
Thank you very much. So I stated my opinion on this last week, and I am going to say that while I have received a whole lot of emails, I'm going to say more in support of than against the ordinance that we have in front of us. I have a lot of issues with what I'm reading in front of me. And my issue is we are not, earlier we had Dr. Pace saying that we're doing really well. We seem to be stable at this moment in time. I know that we've upgraded to mandatory masking. And what I'm seeing when I'm outside, definitely not 100% compliance, but a good majority of people are definitely complying. And I think that with what we've experienced thus far, some businesses were fortunate enough and they were able to stay open the entirety of COVID-19 and some not. And I think that our job right now is to figure out how to support our businesses and not figure out ways to maybe knock them back down as they're trying to stand back up. And I also, my other issue that I have with this ordinance is the use of code enforcement when right now going after illegal grows, going after fire suppression issues, to me, are more important than them going to a store and dealing with the kind of complaints that I've received, which I would never want them to waste their time with some of the complaints that I've received, where some of them are completely bogus. For instance, I had one store that on camera, the person they complained about saying had no mask actually had a mask. So I think that because of our numbers right now and our hospitalizations and everything else, it tells me that we have been doing a good job and we are doing a good job for the majority of us. And until those numbers reflect something more concerning, I just don't think this is a viable option for us. I think we need to look at ways to support and help our businesses, not ways to make them feel like they're under our thumb.
Okay, Supervisor Crandall?
Yes, thank you. I wanted to try to get in there beforehand, but I think that thank you, Bruno. That was very appreciative. I wanted to just, because I know this was brought last week, and one thing that I've noticed about this discussion and topic is it has completely polarized the groups from different sides to different sides. And the intent of this was not to punish anybody, was not to take a side or anything like that. Like Bruno said, there's for me, actually, there's just as many that want me to vote no as they want me to vote yes. With that, it's hard to make a determination on that because that's not the way that we are taught to vote. We're taught to vote with the way that we, with how we study what we believe in. But for me, I also know that there's been a group that's been working with me. Lonnie Kane she works in Lucerne with me on the town hall, and she's got a group together that went around the lake to get the surveys from businesses. And there's some questions that they asked in there. And in lieu of this not passing, I wanted to make sure that we had more time. I was hoping maybe either to push this a week, or if we just rip off the Band-Aid now, that's fine. But the reason I say that is because this subject has brought in so much fear that I would rather have both sides have a look at what the outcome could be rather than just winning or losing. So, for example, if this doesn't pass, the people with masks, I would like them to know and be assured that there's businesses that have already written in these numbers stating that they would accommodate for seniors and susceptible people, but not all businesses have been asked. The same thing with also
there are also goals to, with the Blue Collar Committee, there's been another initiative that Mark Borgasani brought up that would state that on high rates of travel weekends, we can have like some sort of measure, like orange being the week that you should be using masks, or yellow being it's a free weekend, we don't anticipate a lot of travel, things like that. I would like to have these things kind of answered and ready. That way, when the vote comes and this happens, and then people are at least feel like they're not going to lose. They're really going to have the other side taking in consideration their outcome of things. The other thing I would like for the folks that are worried about their rights and worried about Dr. Pace being some sort of person that's going to come in and inspect, which we want them to be assured that that's not going to happen. We want them to be assured that their rights will be given back. We don't want people to live in fear this way. And so for me, if this moves back so we can answer some of those questions, I'm happy with that. But if we're forced to deal with this today, then we do that. But I just wanted to highlight those things because we also didn't bring this forward to come down hard on businesses, because that's not the intent. It's just to make sure that people will at least work to comply for those folks that are susceptible. In my district, that is highly likable. That's more likely going to happen. And so for me, it's another thing that's frustrating is the fact that, we are this divided over something so simple as a mask. So for me, it's just, I would really like to get to a point where we can, have a medium, but I know that that's impossible. And I am afraid. When I was in the military, I was trained to be afraid to lose lives. And so for me, I understand that we're at a level where we're not going to, because we have 34 cases, but at the same time, I'd hate to make a decision that somehow down the road puts me in a position to make the wrong one. But also, I'm willing to discuss and work this out. So with that, I'll end my.
Thank you, Supervisor Crandall. Any other board members?
Yes, I'd like to speak at some point.
Yep, go ahead, Supervisor Brown.
So I don't even know why this is even on the agenda. I couldn't understand it last week. I don't understand it now. I mean, I hear at least two board members and myself, they're, questioning the validity of this, but, and I know that it was part of the reopen committee, their suggestion, and I don't want to put words in their mouth, but I've heard that it's not really a consensus of the committee. It was three of the members who wanted to bring this forward, and I haven't heard the rationale behind it. And I heard it was the chair of our board and Denise Pomeroy, the director of public health, and Margaret Silvera, the city manager of Lakeport. So I wasn't there. I don't know that to be the case. That's what I've heard, and I'm interested in the rationale of three people, one of which won't be enforcing the county ordinance that we're asking. So maybe somebody could clear that up for me as well. But as we go down this thing, I'm not so passive about if this doesn't happen, then we need to do this, we need to do that. I think we need to kill this thing and never hear about it again. I think this is the wrong message to send to our businesses who have already struggled for 3 months. I mean, we went 2.5 months without them wearing masks, and many of them were open. All of the people that are shopping now were shopping then. We didn't require it then, and now all of a sudden we're going to punish businesses who want to dare to be open and dare to try to stay open to not comply and mind us. It's just ridiculous that we would even consider that. It's named improperly. I think it's got this real cute, we're here to assist. Well, we're here to punish. That's the bottom line. If you don't mind us, you're going to be punished. And that's what it really boils down to. It has divided the community. And I think it was done, may not have been intentional, but anybody that didn't see that was going to happen clearly hasn't been paying attention. This whole thing has been divided. I haven't received the phone calls because probably people already know how I feel about it. So they're not going to waste a whole lot of time asking me to enforce a mask rule for private businesses on private property, which, by the way, as a private business owner, somebody comes to my property, they better have a warrant. and don't just come knocking at the door and ask politely, because they're not going to be invited. As much respect as I have for code enforcement, for this particular issue, no one is invited to come to my property. And if any business wants to, they can put up a sign that says, "Do not enter this property without a warrant." And I can't wait to see where the first warrant comes from. No judge in his right mind is going to issue a warrant for this. So it's silly to begin with. It doesn't say in there anywhere what the penalties are. In this ordinance, it refers to other code sections. So if we're going to do this, maybe the chair could tell us what the thoughts are on that, since it's asked to be put on by the chair, what the penalties actually are. There are 25.123 of the government code allows for urgency ordinances, but it doesn't say what the penalties are. It does say that it's required a 4/5 vote, so I'm curious about that. How that's going to end up. Section 10129 authorizes the sheriff or peace officer to enforce the orders of local health officer. I don't think we're gonna see a lot of that. I know we're saying later on that code enforcement could be peace officers, but I think, like Bruno said, I think they've got better things to do, and they want to do those things. They want to protect us from fire hazards and from some of these other things that they're doing, and don't want to be bothered with the silly notion of going and assisting businesses. In educating them, because they're obviously not smart enough to have the education on their own. You go down to another paragraph here where it says, this board believes that an administrative fine or penalty should exist as a deterrent. If we're going to have this, we should change that to some members of this board, because this board does not agree with it. This board member doesn't agree with that at all. Go to section 2. It says, additional qualified personnel may be hired temporarily as compliance officers. Well, if we're going to do that, let's hire these people. Let's get them to do some of this other stuff, this backlog of stuff that code enforcement's been dealing with for years. Maybe we can actually put temporarily hired personnel to work for something valuable that will actually help businesses in protecting our county and not going through another disaster that would put more of them out of business. Which, by the way, I've heard of 5 businesses that are going out. 3 of them are in Tina's district. 3 restaurants, one of them in Bruno's district, and then I hear that Kelseyville Pharmacy, has been around forever, is closing the doors on the 20th. So it's unfortunate that we're not creating an ordinance where we do everything we can, or a proclamation of something, everything we can to support our businesses and not crush them and put our foot on their back while they're already down. Section 3. Compliance officers shall have the authority to enter local businesses and survey whether such business are presently in compliance. I've already stated how I feel about that. No warrant, no enter. That's all there is to it. And where applicable, to attain such compliance, but we should change that attain to force, because if we're going to do this, that's exactly what it is. We're going to force compliance. By God, they're going to do it our way, or they're not going to do it at all. And these people can exercise their rights, and they need to know what their rights are. If they want to comply, if they want to cave to some pretend authority by the board of supervisors or public health officer, that's up to them too. They're welcome to do that. But I think the people who feel that they actually can run their businesses much better than the government can should be allowed to do that as well. Section 5, any person violating any provision of this ordinance, what part of the ordinance, and I'm going to ask you a question, Mr. Chair, could you tell me what part of this ordinance could be violated? Just give me an example of anything that could be violated in this ordinance.
At this point, what was brought up and discussed as we were bringing it in was the enforcement of the public health officer's order that is out there at this point as far as masking in the businesses. I know there's been some clarification, and so that at this point, that would be the conversation that we're having. We've all gotten calls with non-compliance with the health order from businesses, and that is the general discussion today.
I've had 4 of them, and all of them were deemed unfounded. But this says any person violating any provision.
If I can just get that, we do have officers I've had in my district. They just said they're not going to do it, and so And
I did not say anything about your district. I said I had 4 complaints in my district. They were all unfounded.
And all I was saying was mine was, and I'm telling you what I was getting.
Yeah, and you'll get your chance. You'll get your chance to talk to. I was just asking you a question. Any person violating any provision of this ordinance. So what part of this ordinance can be violated? I'm not talking about another ordinance. What part of this provision of this ordinance do people need to be worried about?
Following the public health, that's what we're discussing today.
No, that's a different ordinance. That's a separate ordinance. I'm talking about this ordinance. It says this ordinance specifically. It doesn't say violating any provision of the other ordinance. It does say or of the state and local health orders or of county reopening plan. But what part of this ordinance could somebody have to be worried about? Anything at all? I mean, if not, I'm good with that. I'll move on. But
I know you don't like my answer. I gave you my answer. So,
well, there isn't.
Anita, I see you put your hand up. I don't know what it is for.
And I'll let Anita can speak, about that too. But I was asking if you knew what it was because it was your idea to put this on, and so I was asking you. I wanted to hear what.
Well, I gave you the answer, and obviously you didn't like it, or you're saying
you didn't answer.
Not adequate.
You didn't answer.
And
you didn't answer.
We'll do.
You didn't answer this ordinance. What part of this ordinance could be violated? So, anyway, I'll move on. So, section B. Paren B, the officer's direction are authorized to enter upon any property or premises. We touched on that again. Officers may seek an administrative inspection warrant. So we need to make sure that the public really knows that they can seek it. But if the person refuses permission, they're not in violation of the ordinance by doing that. They can't be penalized for requiring that. That is their right. They have the right to require that, and they should. I think that everybody should require that. It's again a really slippery slope to allow government officials to pretend that they're going to come in and protect us when much of this can't be enforced to begin with. The mask ordinance can't be enforced. It's ridiculous. So item E, paren 2, a statement that a determination has been made that a violation of this ordinance and or existing state or public. Again, I haven't heard where this ordinance could be violated. This ordinance is just telling code enforcement officers they can enter onto your property. So there's nothing that can be violated here. So I don't even know why that's on there. Paren 3, a specified time period of not less than blank days from receipt. What's going to be the answer there? That it has to be corrected. Is it immediately? I mean, we waited 85 days to impose the mask ordinance. So do we wait another 85 days for them to come into compliance? Maybe somebody could answer me that. And then specify the amount of such fines and penalties. Is it a misdemeanor? Is it going to be a misdemeanor? Is that your intention? Mr. Chair.
What's written in there is just a civil penalty at this point.
Where does it say that?
Let me pull this in.
Mr. Chair?
Go ahead, Anita.
It says under section 5D, sub D on page 4, that the maximum fine or penalty amounts for infractions are set forth in 25132, which is the statutory amounts. I believe it's 100, 200, 500, which rises incrementally depending upon the number of violations. Let me also say, too, that this is simply a draft, and it may offer multiple options, and in fact does, because your board hadn't determined what, if anything, you wanted to do at that point. You just wanted a mechanism for administrative fines. So the devil may be in the details, but you're really not at the details yet. That would come from further direction from your board. This is simply a rough draft of what the ordinance could include.
Thank you, Anita. So I'm going to go back to that.
Can I add to that real quick?
Go ahead. Supervisor Brown is still going, then I'll let Supervisor Brown finish, and I'll go to you, Bruno.
I just want to have the question answered. Is this intended to be a misdemeanor? Because it does say, like Anita said, 25132 is a violation of a county ordinance is a misdemeanor unless by ordinance it is made an infraction. It's not made an infraction in in this ordinance that's the draft or whatever, but it's not in there. So is it a misdemeanor or is it an infraction? I'm not good
And
with
as you made it very clear, we're having the discussion today. It is a draft. This is the discussion. If it passes, obviously it'll be put together with everybody's input. This is the discussion, Rob. Appreciate you read through it. You have your concerns and you'll give your input. So that's what the discussion is about today. You've made your position very clear.
I'm not done.
So there will be more discussion today.
Yep, that's all I'm asking. Is it going to be a misdemeanor or is it going to be an infraction?
It would be an infraction, absolutely. That would be the intention.
Okay, it doesn't say that anywhere. That's the first I've heard of it. So,
well, you know, we put it on today so we could have the discussion as we have to work through today.
Yeah, well, that's the first time anybody's mentioned it, so I'm glad that I asked because otherwise it wouldn't have been brought up probably. So, and then it has all these fines.
Nothing in there has been, this was a draft, so we can work through the process, have the discussion. Obviously understand your standpoint, and there's going to be
still having the discussion there. That's great.
It was not it was never intended, to not be an infraction as we move forward.
Section 6, Section 6 says it can be seen with certainty that there's no possibility that this ordinance may have a significant effect on the environment. Is the environment got a definition to it? Because the workplace environment, the livelihood environment is seriously affected by this. So I don't think we could, with a straight face, say that it is not significantly, doesn't have a significant effect on the environment if we're going to consider that as part of our environment, or are we just going to consider the trees and the birds and the critters and that kind of thing. So I want a clear definition of what the environment is in that. And, I feel so bad. We talked about the homeless earlier, and I said this before, where, it's been told to me that the difference between someone standing out on with a sign out a Safeway parking lot and us is 90 days pay. And I think it's less than that. And I think we've got people that are going to be found in that position because of not just our actions, but people who are sitting there a week ago hearing this nonsense from their elected leaders that were even considering something like this are just going, you know what, I'm done. I can't do it anymore. I think we kick people when they're down. They've been down for months because of our actions. And I think those actions were illegitimate. And we continue, instead of saying, you know what, we made a mistake and we did that, but we did it based on the information that we had at the time. Instead of doubling down and saying, okay, we can't admit we're wrong because that would be weakness. So let's move on and let's actually kick these people a little harder by pretending that we have this authority and doing more damage to their businesses than we've already done. And that's basically what this is saying. I think we need to dispel the silly notion that we can do anything about it. Or like Bruno said, there's a testing that's available where you almost touch your brain with this thing. Well, if we continue down this road, then we need to do that testing by inserting it in a different orifice than what we've been entering it, if that's what we're trying to touch is our brain.
Well, appreciate your comments. Glad we're having the conversation, Rob. Supervisor Sabatier?
I just wanted to mention that if it is a misdemeanor that is decided upon, that local emergency statute from the state of California states that we cannot go over $1,000.
Thank you, Bruno. Supervisor Scott?
I have to agree. I received a lot of emails on both sides. Both sides are very passionate about this decision. It has really put our community against one another. But as we look at our board, I'm not surprised that our community is acting this way when our board is acting the way it is. We can see that this is not going to pass. I guess for me, I'm just dumbfounded that people are so up in arms and thinking their business is going to fail because we're asking them to wear a mask to protect our community. I think we're doing just that. We want to continue to have our businesses continue to stay open, to thrive, and just simply wearing a mask may get us to that point. If we have an outbreak in our community, it may become out of our control and the state's going to jump in and then we'll have to follow their rules. So I think this is just something that we're trying to look at what we can do to make sure that we're doing the right thing, because we tried to do the education part. And as we've seen, I know in my district, there are some that are just blatantly saying they're not going to follow the rules. I do have a question for Dr. Pace. I know that the health department does enter our restaurants and such. Is there other things that you have that are similar to this that restaurants have to abide by? And if they violate those things, that their store is closed or they get a citation or something along those lines that, kind of the same?
Right. Well, thanks. I mean, I think from the health point of view, this is one of the things that we would like to have some ability to protect the public health, like food laws, like, seat belts, like different kinds of things that are in place that are to protect people themselves or to protect the public from health effects. And so, I think this is going to be the COVID is going to be with us for quite a while. And so we're really kind of moving into a more chronic phase of trying to manage this. And I mean, the way we were kind of looking at this as we were talking about it was more like inspecting of restaurants for food, and cleanliness and things like that. So it's, and generally what happens is there are inspections, the inspector goes in, they talk about things and get a chance to correct situations. And if it keeps being a problem, then there might be some fines down the road, but the point is not to make the money off it, but it's to get the businesses to stick with a certain sort of regulations. And just to clarify, this isn't just about the masking in this situation. It's also around disinfection practices in the business and social distancing practices in the business. So it's all three of these, which is just what we do with restaurant inspections and store inspections and things like that. It's in the same kind of category.
That's what I was thinking. I guess for me, I've seen Lake County. I think, we've struggled for years. We've struggled before the fires. We struggled before this. And it's always been said, we're always behind the eight ball. We're always trying to pick up the pieces after things happen. And I think this is just one thing that we're trying to put into place, that we're not trying to pick up the pieces after we have an outbreak in our community. We're trying to stay ahead of this. But it's looking like we're going to have an outbreak in our community for people to wake up and maybe want to come back to this ordinance to be able to do the right thing. I mean, maybe it's just not real for people. I know for myself, I've lost 2 family members. My husband's lost 2 family members because of COVID living on the East Coast. So it's real to me. And I just don't want to see this happen to our community. I don't want to see the outbreaks. I want to stay ahead of it. I don't want to be behind the ball that we always are at. I guess this is not the time for this ordinance to come to pass. I don't wish to vote on this today. Maybe kick the can down and see how things go. And hopefully we stay how we are. We stay healthy and our numbers stay low. I'm just concerned that people are getting lackadaisy and they're not doing the right things. I had a chance this weekend to visit Mendocino County, and I was shocked by how everybody was acting completely different there than we are here in Lake County. It's just almost like we just don't get it here. And it's sad to see that. But with that, I would hate to take a vote and have this drop. I would like to maybe wait and see how things go. That's it.
Okay. Thank you, Tina. Supervisor Sabatier?
Thank you. And even if it's voted and voted against, there's no reason why anybody can't bring it back if they wanted to. Just because we say no today is no different than kicking the can down the road. But I think if we look at Sonoma County, and we keep talking about how others are doing it differently, Sonoma County is being much more strict with their situation, yet they have a huge increase. I think it has to do with how we live and who we are. And we are already isolated by how we live in this community. We're isolated from other counties. We're isolated from ourselves. We have a very low population density. And I think those things are what helped us overall to keep the numbers low. And right now, the numbers are what they are when everybody was going to Walmart, everybody was going to Safeway, and now we're spreading that out to multiple stores versus everybody crunching into one place in different districts throughout our communities. And so I think that right now, this is just not the right timing. This is if we had out of control deaths, out of control hospitalizations, then I can completely understand. But I think that as we move forward, we're going to see that right now, this is not a problem. And if we continue as is, which has been a mix of people masking and people not masking, we will continue exactly as is. And I think that right now we have been led by being afraid of what could happen. I am not saying that what happened in New York is not real, but what happened in New York is not what's happening in Lake County. And we have to figure out what's best for Lake County. And we know that the struggle is real before, the struggle is real during, and the struggle will continue to be real tomorrow as well. And if we do this, we will make it that much. It's another brick in the wall for our businesses, and we have to be able to support them. I feel that I've had very positive conversations with our businesses as I've gone from complaint to complaint, offering suggestions. Some of them have taken the suggestions, some of them have not. But the fact is, we're not seeing any kind of hot spot happening in those areas because specifically of those businesses. And so we have to recognize that the atmosphere that is out there, yes, it's a political divide, and I wish it wasn't a political divide, but it is. And this conversation only adds fuel to the fire for the political divide. I think we need to look at positive ways to provide support for our community rather than the conversation which can provide a negative result for our community.
Thank you, Supervisor Spatier. Supervisor Crandall?
Yes. So just back to one of the things that I didn't get a chance to state, and was that in bringing this back eventually, or whatever the case may be, or not, or whatever. One of the things I was looking at is that's one of the reasons why the Blue Collar Committee is together is and continuing to move forward as we're opening is to ensure that if and when. And I hope that there is no when. We hope that we just end with whatever the amount is, 34 or 50 or whatever, and no deaths. But if and when there is a surge, we want the Blue Collar Committee is in a position to try and work out ways to keep their businesses open in lieu of that surge or whatever the case may be. Maybe this ordinance is the answer to that. Maybe the time being from here till then, if there's a then, we're working on this rough draft of the ordinance. We're working on those surveys and asking questions like, would you be able to accommodate the hours? Would you be willing to do X, Y, and Z? Those type of things, so we can quell some of the fears. Because, and the other thing is it's both sides of these folks are saying, we the people. We need to stand with we the people. Wow, we are all the people. So I just want to highlight that again, because I think that this could be a solution to something in the future. And so I'm hoping that maybe if this doesn't get pushed forward here, which I don't think it is, this may be the answer to the surge, if there is a surge.
Thank you, EJ. Supervisor Brown?
So I'm not going to be condescended to by some supervisor who chooses to do nothing as opposed to and then criticize me for misbehaving. I'm not going to be condescended to by somebody who has not demonstrated leadership and is going to criticize me for being a leader in the fashion that I find necessary. I think we need to vote on this. I think it's easy for a supervisor who doesn't own a business to criticize businesses for not doing the right thing. Well, some of us actually have to fight for everything that we get, and I'm willing to do that, literally and figuratively. I've done it all my life. I'll continue to do it. I'll do it here in the board chambers. I'll do it wherever I need to be. I will fight for the people that I work for, to do the right thing, and I won't be criticized or judged without some response. So be ready for that. It's not all about it's hard work up here. You know, it's not all about bake sales and sitting in our hands for 4 years waiting for an opportunity to get a photo op on Facebook. Sometimes you have to actually do things, and you piss people off by doing it. I'm willing to do that as well. I think we need to vote on this. We need to make damn sure that we kill this thing today, whether it be I don't care what the vote is. I really don't care. We need to vote on this. And yeah, Bruno's right. We can bring it back. We can do, whatever we want to do. We can continue to kick people down the road and kick them while they're down. But I think we need to send a message to our business community, or the hard workers in our community, not the government employees who are sitting here every Tuesday collecting a paycheck. I think we need to send a message to them that we are in your corner. We thought about this. It's not a good idea. Let's vote against it and try to find other alternatives to protect our community rather than some bullshit ordinance that pretends to protect people, protects nobody. We all agreed that the board would investigate complaints as we got them. I investigated 4 of them. I talked to the people. I went out and talked to them, found out what they were doing. They were found to be unfounded. And I know the supervisor that's criticizing me for misbehaving is also received some complaints, and I double checked and I found out that at least one of those never got a call from her. So, if you're really serious about it, go out there and talk to these people and see what they're doing, see what they've got going on. But don't criticize me for not acting a certain way that you think I should be acting.
Well, Supervisor Brown, I appreciate your opinion, obviously, and each one of us are fighting hard for the folks that elect us, and we're going to be on both sides. Decisions are going to make people happy and unhappy. So, the discussion was today, in the reopening committee, I appreciate what you heard, but, the conversation was with the entire committee of what we were looking at as far as enforcing. We talked about what was going on in both cities and other things. And so, yeah, this is a tough conversation. I've had many different calls. I got plenty of emails on both sides here. This is a conversation that needs to be had. I hear it loud and clear. It looks like there is no support for it. But as a leader, you got to have these tough conversations. You can't back away from them. And brought it here, and we'll look at it. Hopefully, down the road, we are not, we don't have to revisit it. But there is a public health order in place, and talking about the enforcement side of it is always on the top of our minds as we move forward with this process. So I know today our community, there are folks here that are going to speak on both sides, and we're going to hear that, and we're very passionate. But ultimately, this was brought with the intention just for the public health and safety of our community and family members throughout here. Hopefully, we won't have any deaths or anything like that. But what we've seen across the country is most likely at some point over the next 6 to 9 months, we are going to see the real impact of this. And you'll have folks that believe it or don't believe it right now. But the only thing is time will tell on the direction we're moving. So there is a public health order out there for masking, social distancing, other things. And looking at it will be from an education standpoint at this point. And we'll just try and move forward. The ultimate goal is to be open and to stay open. And if it does ramp up, that we have something that looks totally different than it was when we first started with this. So I think this is a conversation, obviously, that we know is passionate on both sides. But ultimately, it is in, at least for myself, and I'll make that very clear, not to be, punishing anybody who's open up. But, them words have been used very much. But it's really coming from the point of caring about others and individuals in our community, our family members, our large population of vulnerable community members here in Lake County, which we know we have. And that's where it is. And I'll have a conversation with people on both sides about this. And just want to make sure that everybody understands where I was coming from as having this conversation. And I think it's the right one, whether no matter how passionate or, people are on either side of the issue. I did see that Anita had her hand up for a while, and I don't know if you had any comments, Anita. Doesn't look like it. So, Supervisor Sabatier.
Thank you. I just have to make a comment because I've said it before, and we did it again last week. There's a tinge of hypocrisy in if this ordinance goes through. We represent government. whether it's community development, whether it's the sheriff's office, we represent all of government. And last week, while I don't believe it was bad what was done, we did not lead by example with what we're asking others to do. We celebrated 30 years of someone's life that they gave to us for safety in our communities. And there were wall-to-wall, shoulder-to-shoulder packed room. And that was put on video in public, picture taken, posted on social media. But yet we denied graduation. We denied other activities which would have similar situations. We have to recognize that if we want to move forward with anything like this, we got to clean our own house. Are we going to find ourselves? I don't think so. And I just think that we need to look at a different way of dealing with this, because I think that we went so far on one side to make sure we were safe, which I don't disagree, but it's taken too long to get us back to where we need to be. And I just, I can't help but feel conflicted that we are not, as a whole, showing the right example if these are the types of things that we are going to pass and make law.
Thank you, Beryl. Supervisor Crandall, I know you had.
I did. I had a question for Dr. Pace. But, you know, I'll let this, I think the public's been waiting long enough. I'll just let them speak and I'll ask Dr. Pace.
Okay. All right, we're going to go ahead and open up the room. I see we have 6 hands up at this point. I can't, we got 8, so I can't see the names behind them. So Jake, if you can work through them, I greatly appreciate it.
Yeah, all right. Looks like the first name we have up here on the list is John Ardent.
Yes, I have a few questions. How many small business owners should feel afraid to open because of situations and circumstances that may be beyond their control? Second question, and last Monday, my home was threatened by a fire that was, to my understanding, started by a transient. Do we have code enforcement available, and will this ordinance divert resources from that enforcement of obviously emergency or obvious threats to our community's well-being? Will that impact our ability to keep our community safe? Or do we have extra resources? Well, who are these? Where are these resources going to come from? And will we be able to mitigate these other risks to our community if this ordinance is allowed to pass? And thank you very much for recognizing me again. And I want to stress again that as members of community and leaders of the community, I hope that you guys will consider reopening in person in public so that you don't appear to be disassociated from the consequences of your decisions. Thank you very much.
Thank you very much. I think there were a couple questions there. Obviously, their code enforcement is available. Contemplation, we haven't gone through it. If this thing passed, we'd work it out, but contemplated now, there would be one person that would be put in place, you know, obviously. And so that was the contemplation, at least the discussions moving forward. But ultimately, you know, I have heard clearly that this is something that isn't going to go through. So getting down into the details, obviously, are, you know, down the road. Let's go to number 8 or number 9, whichever hand is up here.
The next hand we have up is Sally Peterson.
Okay, go ahead, Sally.
Oh, can you hear me?
Yes.
Okay. I just wanted to say a couple of things that I realize that our numbers may be down or staying down. And I think that's because we have been following Dr. Pace's recommendations. We're lucky that we are in a rural area that we are not having an outbreak. But I think a lot of that is because we have been abiding by the recommendations of all of the government agencies, the CDC, Dr. Pace, and all that, to call this ridiculous and a silly notion is just has me almost speechless, because I'm thinking that if we don't follow Dr. Pace's recommendations and we just go, crazy and, let everybody do whatever they want to, that eventually our businesses are going to have to close back down again. And that's going to be kicking them down. I think we need to focus on keeping our businesses open. And to do that, we need to be sure that we are providing public safety, health and safety. It's going to affect everybody, but wouldn't it be better to make sure that we can stay open and that we can all stay healthy? I'm just really disappointed that that this is turning into such a political issue when it shouldn't be. It's a health issue. It's a health and safety issue. And you as Board of Supervisors had the fiduciary responsibility for the welfare of our people here in Lake County. And you should err on the side of caution. To call this bullshit, that's bullshit. I mean, I'm just sitting here listening to the rhetoric, and it's very disappointing. So I think that you should vote on it, and I think that you should approve it, because it doesn't even have teeth in it. All it is just a slap on the wrist anyway. But at least it shows that the board cared about the safety.
We need to wrap it up.
That's all I have to say.
Thank you.
All right. The next hand we have up here is from MLB.
Okay.
It doesn't actually look like they have a mic connected. They might be.
Can you hear me now?
Yes, I can hear you.
Yeah.
Okay, sorry. It's hard to know where to start. I don't know why this has become an ideological or political issue, because it's really not. It's a science issue, and we have a scientist that's been hired to give us the expert opinion on what's the best way forward. And yet we're trying to assign him some dark political motives that really are just belong on the idiot channels of the internet, like 4chan or QAnon or something. So I don't know why we're trying to fight this on a political or constitutional rights or making other arguments, other than the fact that if we don't follow the smartest approach, which is what he's positing here for us, the chances of another shutdown loom in our future. People are coming up from the Bay Area. They want a vacation here. We want the tourism, but we don't want another shutdown. So the smart way forward for me seems to be to follow this policy. And if there are people that just simply refuse to follow it, then we need to educate them. And if they still don't want to follow it, then we need to have some kind of enforcement mechanism. I'm not saying we're going to go out there and serve a warrant on them. That's ridiculous talk. I mean, it's kind of cowboy Wild West thing. Nobody's going to be served a warrant. We're going to go out there. We're going to try to educate them. We're going to try to get a buy-in from them. But this is not crushing our businesses. What would crush our businesses for sure is another shutdown. And it's a real possibility. You look at places like New York or Texas, and that's where they're headed. So because they didn't take it seriously and they're not following the smartest way forward, according to the science, they are probably headed for another shutdown. And it would not be good for Lake County. We do things like inspect kitchens and restaurants. Do those restaurant owners want an inspection every time? Probably not, but they get one because it protects the public health. Helmet laws, non-smoking laws. And these same people were the ones that made arguments about all of those things, about how it was going to ruin everything for everybody. And yet, once we had them in place and people got used to them, things went forward.
We're going to try and wrap it. We can try and wrap it up. Thank you very much. Thank you. Okay, Jake.
All right. The next hand we have up is Stephanie Paula.
Yes, Stephanie Pawa. I'm a licensed respiratory care practitioner and a registered respiratory therapist through the National Respiratory Board. And I want to tell you, I'm appalled. I'm really sorry, Supervisor Brown. First of all, the COVID swab doesn't hurt worse any more than I've had manicures that hurt worse than a COVID swab. And trust me, I've been through 5 of them already. Okay, you want to talk about painful? I spent my last day at work proning a young, healthy man, a minority, a Native American who frickin's only comorbidity with being an essential worker. I spent my entire shift watching him try to die. And then the next day, and then the day after that. Okay, every day we get his breathing stable, then he's throwing clots. He was not unhealthy. He didn't have blood pressure. He wasn't overweight. He didn't do drugs. He wasn't homeless. Owns a restaurant in Calistoga. He's had to shut down 3 times because his essential workers tested positive. So he has to have everybody tested again. He has to shut down his damn restaurant and wait for everybody's swabs to come back. We're getting faster. We're getting better. There might be a saliva test pretty soon. But if we don't dampen and keep dampening, and the simplest damn thing is to wear a mask. I have to wear PAPRs, chemical suits all damn day. And I still don't bitch when I come back to this county and have to wear my damn cloth mask and hardesters. I've gone to every coffee shop and there are hordes of people just gathering in them with no mask. And you know what? Maybe I should just not wear a mask too. Maybe I shouldn't wear my mask and just go in everywhere and be a super spreader. Is that what it's going to take? One person who's going to get sick is going to be a super spreader in a contained area. And you know, it's not fun. I'm now taking my day off work to join this because I have to get another swab because I spent the whole night coughing and in the bathroom. So I may have COVID for the second freaking time.
Okay. I apologize and understand your passion.
I did send a letter to you, Moak. I'm sorry, I'm going to end it, but I sent a letter to Supervisor Moak on public comments.
Yeah.
I want all of you Board of Supervisors to read it. Please. And thank you, Scott.
Okay, thank you. Okay, Jake. And I understand everybody's very passionate on this. I appreciate just, we'll get through the 2 minutes. Thank you.
All right, the next hand we have up is Michael.
Yeah, can you hear me?
Yes.
Hi. Hi, Michael Green. Thank you, Honorable Chair. I want to express my strong support for the urgency ordinance before you today or any type of modified ordinance you might bring back in the future. The draft ordinance is very basic and well written. It simply authorizes code enforcement to handle health-related complaints and citations administratively. This same type of lawful process is used to cite illegal pot growers in Lake County. And as we saw last week, that process can and will work well if you just let it happen. Now apply that same process to public health orders. If a complaint is received against a business, they'll get a compliance check, maybe some education. If they haven't done a self-certification, maybe that's the first thing they do. What we're concerned about are those repeated flagrant violators of public health orders, the Romy barbecues of the world out there. Absolutely to mask their employees or their patrons and basically are lining themselves up to become clusters. Okay, people like that probably do need a citation and a fine, and that's it. Nobody's going to go to jail. Nobody's rights will be trampled. If they don't like the cite or the notice to abate, they can appeal to your board. And that enforcement process is fair and just and necessary. So you're going to hear from people today complaining about their rights or protesting the legal basis of the public health orders. Such complaints are wrong and dangerous. Let's be very clear. If you fail to pass this ordinance today, and if the sheriff and county staff make no attempt to enforce lawful public health orders, you will be trampling the rights of at-risk people to move about freely in their own communities. You will be rewarding scofflaws and punishing the vulnerable. You will allow rogue businesses to engage in unfair competition, and you will place the health outcomes of thousands of people, including uninsured line workers, in the hands of a few people. And that's not right, and that's not fair, and that's not safe. All we're asking the county to do is adopt a complaint-driven, fair-minded enforcement process to enforce public health orders in businesses and public places. Please vote yes. Thank you.
Thank you, Michael. Go ahead, Jake. Let's get to the next one.
The next hand we have up is D Pro Masking.
Hi, can you hear me?
Yes, we can hear you.
Yeah.
Thank you. Good afternoon, everybody. I'm going to try to do this in 2 minutes. I've written out my statement. I had a stroke last year, so I apologize if I stumble. I began watching the BOS meetings in March because I am one of Lake County's vulnerable citizens. I have watched as recreational activity and opening businesses took precedence over safeguarding Lake County against COVID-19. There has been a temerarious removal of safeguards that not only protect vulnerable individuals, but all residents. When there are no consequences to non-compliant individuals and or businesses, health ordinances fall by the wayside. They become useless. This audacious removal of health ordinances, while not purposely done by the BOS, remains true primarily because of the non-existence of consequences for those refusing to comply. If there are no consequences for disregarding health compliance or ordinances, you are leaving our community impotent against the dangers of COVID-19. The BOS is culpable for every action they take or don't take. As we rely on each elected official to provide calm and purposeful guidance during these times, it is disturbing to witness a BOS member mock and ridicule concerned residents during meetings. In doing so, he has emboldened others to behave in like manner. Rob Brown, you are elected to serve the whole community. You are employed to act on behalf of everyone in Lake County and not just those who meet your narrative. Your behavior is unprofessional and unacceptable. If you are unable or unwilling to adhere to this criteria, resign your position, allowing someone more capable to carry out the duties of this governing position. I ask that all the members of
2 minutes, Mr. Chair.
All the members
Wrap it up, please.
of the BOS hold their peers accountable. Further, remove members who are driven by a lacking moral compass. You should not be tasked to babysit anyone displaying a bully-type character. And my final thoughts are these. I urge you to vote yes on item 7.4. Businesses and recreational activity are important to Lake County, myself included. But finance and recreation.
I want to get you to wrap it up here.
This is my last sentence. I'm sorry, Mo. But finance and recreation should never usurp human life. And I thank you for hearing me today.
Thank you. Jake?
Yes, the next comment we have is John Sheridan.
Go ahead, John.
Thank you. Okay, I'm going to read a letter. I'm representing Brian Dabowski. He has to work, so just like I did last week. So in regards to the current discussion regarding fines, I'm appalled that we are sitting here having this discussion again. Myself and a ragtag band of, we'll just call ourselves what you referred to us as at the last meeting, bad actors, which I don't appreciate for the record. We are your constituents, not bad actors. Anyway, we came together and did some footwork. The goal was to gain public input on how they actually felt. So we made a survey and had it sent to you, to every one of the board members for review. I want to remind you that you represent those people too. E.J. Crandall, I understand that the elderly population feels as though they have no representation. My question to you is, do you flip on the majority of people you represent to only represent the minority and their feelings? What about the majority's feelings? Do they not deserve representation too now? Not that seniors don't matter, but they do have the option to shelter in place freely. No one is depriving them of that. Moke, let's just call this conversation what it is. You are upset because under the current order, it required you to get up and go educate these businesses who obviously disagree with you. I choose to keep the exact businesses I'm referring to confidential for their privacy at this time, but you received pushback. And it was at that moment you realized you had no power. Now we are here looking to flip the script on local businesses to try to make their lives even harder. Also in this discussion, from what I'm understanding, is the possibility of using code enforcement as a tool for these ordinances, which goes to show This discussion has nothing to do with public safety. As the board and community has already established, code enforcement is best utilized enforcing fire hazard type code violations. Since this agenda has nothing to do with public safety and everything to do with control, and in light of the facts I just laid out here, how about we just title the agenda item for what it is?
Mr. Chair.
Moke Simon's quest for power and control in the Lake County. To any board of supervisors looking to support this BS agenda item, I caution you, remember the fact that the House representative—
If you can wrap it up, please. We have
on
2-minute time limit here.
Abuse of power. And that's it.
Okay, Jake, if we can move on to the next one.
Yes, the next hand we have up is Teresa Harbor.
Hello.
Hello.
Most of you know who I am. I just want to first thank Rob for pointing out that this document is too open-ended. It is not conclusive on any measure and is not even close to being ready to be voted on. It's ridiculous. I am a business owner. I think you all know that. I have had no issues whatsoever with any of my people coming in with no masks, my staff not wearing masks. We do have them available. We're very respectful to anybody that requests one. We completely disinfect our place in the morning and again during the middle of the day and at the end of the day when we close up. We wash our hands constantly. We are just so on top of sterilizing and cleaning. The mask is something that is constrictive. It's not healthy. There are as much statistics out for the pros as there is for the cons. And I would really suggest that you all educate yourself on that. At this point, we are extremely safe in this county with the way we have been conducting business. Our businesses need to open. It's economic sabotage, in my opinion. If we don't continue to move forward, we will never get back to where we were, and Lake County will go back into its economic depression and its negative stance on the homeless, the Lake County being the poor county out of the state. We have turned that around in the last few years, and we've turned it around greatly. And you are going to do everything to put us right back into that same spot if you do not let us operate the way we need to operate. And we are responsible. We're educated. We know what we're doing, and we're adults. We do not need to be governed. Thank you.
Thank you, Teresa. Okay, Jake.
All right. The next comment we have is from Denise Lofstalot.
Okay.
No.
Go ahead, Denise.
Oh, Denise, I think you're muted again. I'm sorry.
Am I there now?
Yes. Hello.
Good morning, Chair. Good morning, Board. Thank you for this hard discussion. It's never easy, and it would always be easy if we could kind of kick things down and think about them longer. But the reality of it is we have decisions to make because we have lives to save and businesses to save in our communities. I do think that this ordinance is a little bit rough on businesses because I personally have had people, I've been enforcing the masks since day one. And I've personally had people say, I'll go down to blank place because they won't. So it's kind of puts me in a rough position. And I will not put my staff or my other customers at risk. But the thing is, to fine me for that, if they are not willing to put a mask on, I just find that really, really tough. I just think that we have to work together on this. Dr. Pace has been very informative on a regular basis of what to do, how to do it. And I want to say 99% of our businesses are complying. Since day one, I've had no chairs in my waiting room. I disinfect. I have social distancing signs up. They wear masks. We want this to end in Lake County as well. But to find a business in Lake County, we have been under scrutiny since 2012. Floods, fire, PSPS, COVID. And now you're going to put punitive damages on us if a customer decides they just want to be upset with us for that day because they're having a rough time in this situation too. I don't see it as being a proper way to have this situation enforced. So I'll keep it short because you guys got a lot to hear.
Denise, thank you very much. Okay, Jake.
All right, the next hand we have up is Val Lancaster.
Okay, Val.
Okay, good morning. Can you hear me?
Yes, we can hear you.
Okay, I had to find my mute button. Thank you for bringing us to the topic early. I think that the Board of Supervisors need to start holding their meetings in person. That'll
be another issue. Issue.
Thank you.
Today we're talking obviously about the ordinance.
I know. So my 2 minutes is ticking. The whole mask thing is obviously a very passionate topic. I was just in the bank today. They took me to the side table because I do not wear a mask. And I talked to the teller who's behind plexiglass. The situation hasn't changed. It hasn't changed for the essential workers, except for now that they have to wear masks and their customers have to wear masks. But going into the bank, everybody's wearing a mask. And I asked the teller how she felt at the end of her shift. And she said, from the time she gets to work until she gets her break, she's exhausted within 2 to 2.5 hours because she has to wear a mask. It's not fair to these businesses that, they say, oh, we're helping, curb the spread, but you're really not. You're making employees sick. And to penalize a business monetarily over a mask and over non-compliance of maybe someone's 5 feet instead of 6 feet away from another person, it really needs to be looked at. I think it doesn't make sense to me. It just doesn't make sense. We're the second poorest county in the state of California, and we are talking about monetarily penalizing, businesses that are just trying to stay afloat. My mind is blown that we've gotten to this point. So thank you guys so much for taking my call.
Thank you, Val. Okay, Jake.
All right, the next hand we have up is Lisa Pavlov.
Can you hear me?
Yes, we can hear you.
Oh, okay. I've never used Zoom before, so this is a first. I am Lisa Pavlo. I am new to the county. We moved here in August, so it's been a whirlwind year here. And I did write an email, and you have it, and I'm not going to repeat my points there. I'm just going to, I have some questions based on listening to your discussion. And my first question is, I'm now getting the impression that the county doesn't care. And I'm not trying to be inflammatory. I'm meaning it more factually. I'm getting the sense that people here don't really care if you mask or social distance. So I'm just not even sure what message you're sending. Number two is that I have pre-existing health conditions. I'm vulnerable. I feel pretty much I need to stay at home now if people aren't going to mask or socially distance. I totally think we need to open up, but I think we need to do it safely. So again, I'm wondering, well, what do I do? What do I do if I want to shop in the county? Because it doesn't seem like I can. It seems like I would have to go drive around and, do things outside the county. That's, again, the impression I'm getting. And then the third thing I wanted to say is that I'm a little disheartened at the notion that, well, we haven't had many cases here because we've been pretty closed off. That's why we don't have many cases here. Once the tourists come up from more infected areas, including Sonoma, including Santa Clara, including Sacramento. We're going to have spread, and I don't think we're going to be ready for it. And then we will have to shut down. Anyway, that's what I wanted to say. Those are my concerns. After hearing what you said, I hope you'll also read my email, which is in the attachments. And thank you.
Thank you very much for all your concerns and questions. I know, we're talking through answering some of those today. So thank you. Number 4. Go ahead, Jake.
All right. The next comment we have is Stephanie Paula.
Hi guys, it's me again. So the cloth mask thing is so minimal. I wear major equipment on me, PAPRs, N95 respirators with tight seals, and I still run the hospital halls. And I have a damaged left lung from when I probably had COVID back in January, February. And I still can run around and do my job with those heavy duty things on. A simple cloth covering, nothing too restrictive, it's going to dramatically reduce the spread of this virus. It's not a death sentence. We have to wear underwears. My bra hurts worse than the mask. Trust me, I can't wait to get home and take my bra off before that mask. A simple mask is going to reduce a lot of these problems, and we can stay open. My friend that owns the restaurant in Calistoga has had to shut down 3 times to retest all their employees because of the restaurant.
I know that you made those statements before. We appreciate your passion on both sides.
I have 2 minutes, right?
Yeah.
Then why am I being interrupted?
Right,
in all fairness, why am I being interrupted?
You're repeating some of the same stuff you said on the first one.
Well, then let me repeat it. It's my 2 minutes. I am working the front lines, Moke, and there's a lot of Native Americans. There are tribes on the East Coast that are wiped out from this. So I would hope that you, of all people, would let me finish my 2 minutes without interrupting me.
Let's go.
I see Rob sitting there smiling. I know all these hippies down in the South Bay are friends of yours, but guess what? Once their cuddle parties start opening to the people moving up from the Bay Area, then you're going to see the real stuff hit. You won't have your drum circles. They'll be all cut short. Okay? Because I'm putting all these naturalists on ventilators just as much as I put people who aren't naturalists on ventilators. It doesn't care. And when it's your mother or your brother or your dad or your daughter or your girlfriend that gets it, you're going to see what I'm talking about. And I hope to God that doesn't happen. I don't like to be the person that says, I told you so, because it's happened to me a few times in my life and it doesn't bring me any pleasure. It brings me no pleasure to have to tell people the shit that's going to happen.
Okay, thank you very much. Let's go to the next one, please.
All right, the next hand we have up is from Melissa Fulton.
Go ahead, Melissa.
Thank you very much. I appreciate all 5 of you, the turmoil, all of your stresses over everything you do, not just this. I want to make it clear that right now I am speaking as Melissa Fulton, a resident of the County of Lake, and not in my professional position. We have had many tourists up here. They were coming long before Memorial Day. And certainly we had a huge influx on Memorial Day. And as Dr. Pace testified earlier, there was no increase. Another thing, all of our residents in Lake County, and I would say the majority of them, not only have been trained, if you will, about how to take care of themselves, their neighbors, their families, but they also have common sense. Thankfully, I'm not one of those who is considered endangered or whatever because of health issues. I am because of my age, which kind of offends me, but that's okay. That's the way I am. The businesses and several of the callers have made this very clear. This is very punitive to businesses. They already have enough to worry about. They were closed for far too long and should never be closed again because of this particular virus. But now, if an ordinance like this passes and is approved by our county leaders, then it's just one more thing they have to worry about while they are trying to
2 minutes, Mr. Chair.
Their businesses and be an asset to the community. And my last comment is, this is not political, not in any way, shape, or form. It has to do with taking care of ourselves and taking care of our communities. Thank you for your time.
Thank you, Melissa. Okay, let's go ahead, Jake.
All right, the next hand we have up here is Dee Parker.
Okay.
Hi, thank you for letting me speak. I just want to be very respectful with my remarks. I think that's critical, and I'm hoping that what I'm going to say will bring some options. I don't think creating more division and making this a big, huge political football is healthy for anybody. So the first thing I want to say is, having gone to the state of California Department of Public Health, the statement there says that they do not mandate that face coverings be worn statewide. They do say, guidance is washing hands, avoiding touching your face, being around sick people, distancing, staying at home. It also says that face coverings may increase, and this is April 1st, 2020. It is still up on their website. It says under guidance. However, face coverings may increase risk if users reduce their use of strong defenses such as distancing and frequent hand washing. And when using face covering.
Oh, sounds like we lost her.
I think she disconnected.
Okay. All right. Well, we'll pay attention for her, but let's move to the next one, and then if she pops back up, we'll go ahead, Jake.
Okay. Let me check this back real quick. The next hand we have up is Matthew Nelson.
Okay. Let's go ahead.
Hey guys, I'm going to make this as info filled as possible with all the notes that I've been taking. So like the last lady said about the political football, this has become political because of the huge divide that we have. So I'm going to go through a few things. Where is the $6.5 million that was supposed to be given from the CARES Act? That's one thing. Second of all, if Dr. Pace is going to sit there and give a bunch of bumbling, like not sure's, well, maybes, yada, yada, mask, no mask, we kind of have to enforce, but we can't. There is absolutely no basis to have anybody on that board try to make a decision to fine our local businesses that are already struggling. Case in point, Moke, you're my representative down in South County.
Absolutely.
One of the things that you campaigned on, one of the biggest things that you campaigned on was single moms. And keeping that in mind, the employees that are single moms out there, or even the people that are out there struggling that don't have children, regardless, these are the folks that you're going to start affecting because their employers can't stay open, or maybe they themselves are trying to keep a business open and juggle a family. So keep that in mind. The other thing is the people who are trying to keep up with the back and forth of whether or not how this is going to play out, because the mask thing, either you're a Trump supporter if you're wearing or not wearing a mask, or you're this if you are wearing a mask. That stuff needs to stop. That's not even close to the fact. We need to be the uniters here in this county. We need to embrace the people that are afraid legitimately for their health. And if they feel that they have to wear masks, then by gosh, let's utilize the senior centers. Let's utilize DART. Let's help these people get grocery stores, talk to Jeff Hansen. These folks have tried to open up specific times for people so that they have dates and times that they can go and get the stuff they need, or we can utilize transportation. Just real quick, one last thing. If we can get together and work on a plan like this, Moke, you know how to get a hold of me, and Bruno as well. You guys have my numbers. I would love to be able to fix this and help you guys as a team. Thank you all.
Go ahead, Bruno.
I just wanted to say that there are no CARE Act funds until the governor signs and approves the budget. And right now, I haven't heard since we've been in the meeting since this morning, but as of last night, no budget had been signed yet, but the CARES Act funds were in there. So it's still up in the air. And until it's actually approved where we can access it, it doesn't exist as far as I'm concerned until I see it.
Thank you, Bruno. Go ahead, Jake. Let's go to the next one.
All right. The next comment is from John Sheridan.
All right, let's move through. Jake, if we can go to folks that hadn't, let's not get repeat, and then we'll move to repeat if, we got time for that. So, but sure. Go ahead, John.
Okay, well, thank you. I would have waited. It seems that there's a lot of fear out there, and a lot of this fear is driving a lot of decisions. I'm just wondering about all the other viruses that are out there, all the lack of attention that we've paid to all sorts of other health problems, when this has shown statistically that it is a very weak virus. People are getting over it. Now, if under the premise that masks work, then let those who are concerned wear a mask. Then they're protected. Then they shouldn't get sick. Okay, but to impose these kind of regulations on well people, to order shelter in place on well people, has a little constitutional issue that needs to be looked at. You guys have an oath to the Constitution primarily, and a pandemic does not cancel any of that. So, I don't know about future litigations or anything like that, but this is hurting people. The masks are hurting people. People aren't looking at the mask damage, the recycled carbon dioxide that they're breathing all day. People who have to work and sweat and wear masks, they're getting sick. It's not providing enough oxygen for people. So even Dr. Fauci has said there's no reason to be wearing masks. Now, are we going to do this for every other virus? Because the COVID virus is so less harmful than so many other viruses out there. And our immunity depends on us being affected by those. So anyway, this fear has to go. We have to start thinking logically. Fear doesn't preempt our constitutional rights. If people are afraid, they need to shelter in place. But Supervisor Crandall said about giving our rights back. Well, sorry, no government's given us rights. Our rights are from our creator.
Minutes, Mr. Chair.
Okay, and that needs to be adhered to, not anything else. The Constitution is primary.
Thank you.
Just real quick, that statement wasn't based on giving anyone any rights. It's the statements that I hear from people like him that you usually say, taking our rights away, giving them back. It has nothing to do. You have your rights. I knew that. I'm just stating. I just made it as a statement.
Okay, Jake, let's go to the next one.
All right. The next comment we have is from Dorina Lucas.
I'm right here. So I was on a couple weeks back, and I'm just going to state some of the same things have been said, but I wanted to bring up a couple different things too. First, I want to honor all you guys. I know you guys are in a tough situation, having to do, but it seems like whatever you do is not going to be right. It's going to be, someone's going to be mad at you no matter what you do. So one of the concerns I had with the heat coming, people having heat strokes wearing these masks. Also, I have a friend that has medical problems and she can't wear a mask. And I've seen people look at her and mistreat her. And it's illegal for them to ask because of HIPAA that she can't wear a mask. And so a question I had, are they going to enforce it on people that medically cannot wear a mask? Also, facts about wearing masks, it reduces oxygen up to 60%, so you can't think right. It increases the risk of CTO poisoning. It causes increased face touching because it's on your face. The virus and bacteria saturate the outside. Touching mask and surfaces spread germs. It contaminates within their mask fibers and get re-inhaled. Fresh air is vital for the immune system and health. It decreases your health by wearing a mask. So I don't understand why we're even wearing masks. And even Dr. Fauci himself said, why are we wearing masks. We need to build our immunities. We need to not have to wear a mask. And I know people are afraid, and if you're afraid, wear a mask. I'm not against that, but don't force other people to lower our health and our immunities. Let's see, we're not wanting to be governed. Another thing I really agree with Brown is you're going to have a warrant to come to my house. That I do not think that that's okay, that someone can come into my house and say, hey, you're not wearing a mask if I have more than, I don't know what the limit even is. Because I have friends that we hang out with. And you know what? When I wasn't hanging out with people, I was getting depressed. I was like, you feel like you have no life when you don't have your family. I couldn't even celebrate my daughter's birthday. And I think has it been 2 minutes? Okay, yeah. Well, I appreciate you guys and thank you.
Thank you.
All right.
Okay,
the next. So actually, sorry, we should have moved to her back earlier, but Dee Parker did come back.
Okay.
Hi guys, thank you. So I just want to tell you all that I appreciate your service and your time. Dr. Pace, I don't understand why you wanted to go harder on the masking than the state did. And even OSHA says, hey, if you have trouble breathing, you shouldn't be wearing it. But I'm not the expert. So I would like to offer an option. And so I'm hoping that this doesn't seem naive, unrealistic, or unsustainable. But what I'm asking is, instead of hammering the businesses and creating division and creating the masking police and all this stuff and adding more stress to your roles and your lives. And Mocha, I understand you want to try to protect the vulnerable. With vulnerable people within my family, which I protect all the time, I think this can be done without this kind of ordinance. So I'm asking, as someone who cannot wear a mask due to medical issues, I appreciate places like Hardester's where I can go in, get my food, and leave. Places where I can go grab a coffee. And they're very kind. I don't ever have a problem. No one ever mistreats me in these businesses. And so they have put that out there that says, hey, if you want to wear a mask, you should. If you can't, then don't worry about it. We're going to assist you in your life and in doing what you got to do in our business. So what I'm asking this board to do is, and Dr. Pace, please back up and say, hey, can we give individual businesses the right and the opportunity to decide for themselves whether they want to allow masking and unmasking. The people who want to be more conservative in their protections can go to businesses that do that. The ones that offer that option, those can go there. Who don't want to or feel that it's against their health. Could this not bring together our community rather than this big, huge division hammer? And I understand you're worried about the uptick. Thank you. Give me just a second. I understand about the uptick, but until it happens, can we live in the now rather the shoulda, woulda, coulda? And so I appreciate the opportunity to speak. Thank you so much. I hope the rest of your day is better.
Thank you for coming back on, Dee. Appreciate it.
All right. The next comment we have is from Jesse. Jesse, are you there?
Yes. Hello. Can you hear me?
Yes, we can hear you.
How are you today?
Okay.
All right. Well, I just want to speak first as a First Nations Native American person. And I really kind of take issue with the nurse who's culturally appropriating a Native American, one person as an example. I would appreciate if she wouldn't do that anymore. I just want to talk first as a Native person that, when Contact came, they came here and they put us on reservations, which is the same thing to me as telling people to stay home. They took our rights and they said, here's your boundaries, stay there. Then they tried to assimilate us and they said, be like us, don't talk your language. And that's what's happening with the mask. People are trying to tell me, you have to wear a mask. You have to be like me. Well, anything that takes people's rights to give somebody else rights is wrong. It's wrong. And I'm saying that as a First Nations person because we had our rights taken. And I am against anything that takes people's rights. You know what? I don't smoke, but I believe people have the right to smoke because this is America. And I'm going to say this again as a Native person. The spirit of freedom that was in this land was here before any non-Indians lived here. The spirit of freedom was always here because our people allowed people to live their life the way that under that spirit of God, the creator. And anything that takes people's rights is not, I believe, is morally wrong. And so I would say to this board, you know what? You need to be empowering people. You need to do things that empower people and give them rights, not be taking power away from people.
2 minutes, Mr. Chair.
And taking rights away from other people. And so I would just say, you know, as a final thought, I encourage you to empower people, to empower businesses, empower people to live their lives, because that's the only way we're going to overcome fear. And fear is the enemy in all this. And so I appreciate you, but I really hope you take to heart my thoughts and my comments. Thank you for the time.
Thank you. Okay, Jake.
All right. The next comment we have is from Frank.
Hi, this is Frank Deloso. You know, the fact that we're even in a shelter in place still is, I just, you know, it went from 2 weeks to 4 weeks to a month to 2 months, 3 months, and it was all just to slow the spread. And at this, you know, in the first portion of it, I mean, there was no mask. The ones that wanted to wear a mask and protect themselves, they did. And so we went this whole entire time with no mask. And all of a sudden we get this mask thing that you guys wanted to do. And then now we're going to, if you find a business, according to what I read, it not just talked about going on to businesses and residents. It almost appears to me that, you know, if someone sees too many cars in front of somebody's house, this actually gives the county the ability to go onto that property. It says private property on there, you know, and I don't know if that's the intention of it or not, but it's there. And that's what I read, you know, and you know, we got to realize, you know, that we have the Constitution. I know a lot of people, you know, have their interpretation of it, but we're the ones that are actually, you know, we're living within our rights of the Constitution, and taking away our freedoms is actually breaking that law right there, our constitutional rights, and violating us and trying to just live, you know, go to work and feed our families and stuff like that. We're law-abiding citizens. We've done nothing wrong except follow the Constitution. So I'll leave it at that. Thanks. Have a good day.
Thank you, Frank. Okay, Jake, let's go next one.
All right. The next comment we have is from Eric B.
How's it going? Can you hear me?
Yep.
Yeah, yes, we can hear you.
All right, cool. So what I notice is that there's, you know, there's no way to really, you know if shelter in place is effective or not, because we really don't have no scientific method, obviously, and that'd be hard to do. But I was thinking of a way that perhaps it would suggest some form of scientific method to where if for a particular amount of time, you know, on even days, let's say, for instance, you know, people had no masks, and on odd days, people had masks. These people, of course, would be different kinds of, you know, people with different beliefs. You could assume that, you know, that they'd be with their beliefs. By doing something like that, we'd be able to have some sort of a data compare and contrast to be able to see if, you know, if it's really helping. If shelter in place is really the thing to where we can go, you know what, I think that we're doing really good because of shelter in place. I don't think we're in a position where we can say we're doing good because of shelter in place. That's like saying, you know, I am where I am because, you know, I drank orange juice last Tuesday. Can I prove that? Is there any scientific method proving that? I mean, I know that's kind of abstract analogy. However, you know, we can't really prove these things. So what I was thinking also is that, you know, if a person doesn't want people around them, you know, and they go into public and everybody else is practicing a whole different belief. Well, if you were to wear a particular colored t-shirt, let's say, for instance, let's say orange is a color, it means stay 6 feet to 10 feet away from me. And if you don't do that, then of course you're violating that person's personal voice, because that t-shirt thing is a voice. Then everybody doesn't lose their rights. If people want to congregate together and they're not wearing an orange t-shirt, let's say, for instance, then they're not losing their rights. And the people okay, so one more second. And the people who are wearing the orange t-shirts, that's their voice. That's their voice, and it should be respected. So you're respecting a voice rather than compromising your constitutional at that point. It's a win-win for everybody. So just a couple ideas right there, huh?
Thank you. Okay, Jake.
All right, the next comment, we have Michael.
Thank you. Very briefly, I want to address the constitutional issue directly because it's a tangent, it's a distraction, and it's utterly wrong. There is no constitutional right to spread infectious disease. There's no constitutional right to yell fire in a crowded theater. And for those people who are saying, oh, the at-risk people can hunker down in fear while the well people go out there maskless and do their things, they've got it exactly backwards. The well people, the people who are not at risk, the inconvenience of putting on a mask for the time that you're in a business or a public place is nothing. It's no violation of your rights. We are asking through this board's inaction and through the failure to enforce the most basic of public health orders, telling our at-risk people that their rights matter less than the rights of the self-appointed constitutional scholars in this county. If we're going to relitigate the face masking, 28 California counties require face masks. Prior to the issuance of the mandatory mask order, our prior health orders had a strong recommendation for masking. He did not pivot rapidly. He has adopted what is the majority thinking of public health officers in the state of California. I think constitutional language is dangerous and a distraction from the issues at hand. Thank you.
Thank you, Michael. Okay, Jake.
Sure. Okay, the next comment is from John Ardent.
Thank you again. What signal are you sending to bar and restaurant owners knowing anonymity emboldens criminals by requiring masks? How safe does this ordinance make the community from a safety and law enforcement standpoint? Should bar owners and restaurant owners close indefinitely for concern over armed and masked robberies made incentivized by your requirements and impositions? Are you willing to accept responsibility for crimes and injuries imposed by your controversial health recommendations? They are recommendations. There is no determinative evidence either way that masks actually stop super spreading. So the consequences of our actions go much further than just economic, where you're asking bar owners and bartenders to accept a grievous divergence from our standards for safety and health. I mean, all business owners who handle cash are less safe for the masking requirement that they sometimes have no control over. So who's ultimately going to be affected? Who's responsible? And who's affected by the consequences of this? What are you going to tell my mom if I get shot late at night by a masked robber and you have no idea who he ever was? These are important questions. And I think it's maybe a little too soon to impose an order based on science that is not settled in any way. Thank you very much.
All right, and just clarification, we're talking about a resolution of enforcement. The order has been in place for a while. Okay, seems like we're down here to one more, Jake. I see one more hand up.
I do have a gentleman who's been waiting to comment who has been able to raise his hand, Moses. Here we get him on right here.
Okay.
Okay, can you hear me?
Yes, we can hear you.
Okay, I just want to read a statement that I wrote, and I'd like to just read it and just leave it up for whatever comments you might have. Okay, my subject is, are face masks necessary? First of all, is there an epidemic sufficient to warrant the use of face masks here in Lake County? I believe that the science does not support the existence of an epidemic, which is the only instance demanding the use of face masks according to California health codes. And an epidemic is a widespread occurrence of an infectious disease in a community at a particular time. This definition would mean that many other sicknesses that plague our society and have not had the same response from the health community, such as the flu, typhus in 2019, hepatitis A, and others, are just samples of what is affecting our communities and to which there has not been a public cry for a similar response by health officials here in California. As citizens, we ask you that you who were demanding this to unequivocally qualify the use of these masks publicly or privately before demanding of us, the people of California, people of Lake County specifically, that we make the wearing of these supposed protective devices a law. You have a responsibility to make known to us all of the facts pro and con regarding this important issue before you place the demand upon us to submit to what amounts to us, and in the opinion of many, a scare tactic and an overreaction to a perceived epidemic. An epidemic is 6,000 plus cases per county. It does not exist. There is not an epidemic sufficient to warrant the use of face masks at all. The truth is that face masks are not able to produce or create a protective line of defense against COVID-19 or any other disease, except as a precautionary measure.
Mr. Chair.
2 minutes, if you can wrap it up.
Okay. All right, well, let me just read this. While face masks may help some who are already sick from passing on a disease, it is not foolproof in preventing the user from contracting a disease. The usefulness of these masks is in helping others by preventing the non-user from becoming infected by those who are already sick. Amen. I have a quote by Dr. Professor Mary Beth Sexton, who says that the most commonly worn, cheap, and disposable mask known as surgical mask will limit but not prevent entirely the chance of inhaling large infectious particles circulating near the face. And she's an assistant
Okay,
professor.
if we can wrap it up.
Okay. The answer, I believe, is not in demanding the absolute use of face masks, but in vetting the public to determine that the disease is actually present. Thank you.
Thank you. Okay, Jake.
All right, so it looks like we have a hand up from Eric B. again.
All right, and as we're doing, obviously talking about the enforcement issue, the ordinance and the resolution. So go ahead.
All right. So subtracting the whole constitutional part, because I know that the fellow that spoke after me was talking about this shouldn't be a constitutional issue.
We're talking about the resolution today, obviously, and not
talking about resolution, of course. Okay, so as far as resolution, I think that
sorry, not resolution, ordinance. I apologize.
Well, resolution regarding how we're going to deal with this, some sort of resolve, something that's going to move us forward, something where we can all be happy about it, right? I don't know, outside of being concerned about everyone's health, what kind of incentives do the board have? I mean, I'm going to be straight up. I mean, what's really on the table here? And as we stay in a state of emergency, do you have a financial incentive? I would like to know that. I'd like to have, to know, is there a financial incentive to keep us in a state of emergency? Does it produce more funding? And then furthermore, do you get more funding as we have more cases? So I want to see, what position you are, because potentially the, board members could be, inadvertently, out of their hands in a position of conflicting of interest, giving that incentive, that potential incentive. So that's my question on that. I really do care about, it is a concern with everything that we've seen on TV. None of us really have hands-on this boogeyman, okay? You don't, and all the people that I see there on the board don't really have a hands-on this boogeyman. But we're told there's a boogeyman. So what's the incentive for us to continue this at the rate that we don't have very many cases at all? And the cases that we have are, it hasn't been at the cost of anyone's life or even near that.
Minutes, Mr. Chair.
Thank you very much for your questions. Obviously, incentives, no, we're looking at the public health issue here, and we're talking about the enforcement of the public health issue, public health order that is currently in place. Okay, Jake.
All right. The next comment we have is from Jillian Perillo. I think I did it last week too.
Yeah, everyone does, Jake. Don't worry. Thank you very much. I already put a statement in, but I've been listening throughout this whole discussion, and I think a lot of it is to do with both sides talking about economic recovery. We're all worried about the economic recovery. And so is there a way to be able to inform us on a weekly basis at the Board of Supervisors meeting as to how our economy is doing in terms of recovering? We talk a lot about the health issues, and we hear a lot about the numbers. The numbers don't look so bad. We know a lot about the health and all the facts that go with that. But what are we hearing about the economic recovery? Is there a way to be able to look at sales tax numbers and see how we're doing compared to a year ago, a few months ago? Because I think that would be very helpful in these discussions going forward. And I want to thank everybody who was part of this. It's been tough, but it's definitely worth discussing. So appreciate it. Thank you.
I think moving forward, those will be things that we definitely talk about, the economic impacts as we reopen and looking at our future here as Lake County. Supervisor Sabatier.
And I would suggest that in our later agenda item about the budget, it does talk about the impacts that the state has offered to provide certain guidance as far as how much we may be missing out on when it comes to sales tax, property tax, things like that.
Thank you. Okay, Jake.
Yeah, so the next comment is from Johnny.
Okay, go ahead, Johnny.
Can you hear me?
Yes, we can.
Yeah. Okay. I just think that if you guys enforce this now, it's going to be a step that you're taking back. This should have been something you should have enforced in the beginning when you guys required the face mask. And like everybody is saying, even amongst the board, it's causing separation. It's causing a divide. You do this now, it's going to cause a bigger divide. And another reason people are getting upset with this is how can you go out and protest in crowds of 100, but you can't go to the park and be more of a crowd than 10 people. I mean, this is why it's like everybody thinks this is bullshit, that this is just stupid, because the public health officer is allowing you to go protest for BLM, but I mean, you just can't go to the park and have a barbecue when it's your right to go barbecue. But he's allowing you to go protest for something that doesn't, I even saw like 5 of the groups for Lake County on Facebook. I saw that they would push the okay to go protest for this BLM, but when they were protesting the requirement of wearing masks, they didn't push that. They immediately would take those posts down. This is what's pissing people off. So it's just stuff, that's just stuff you got to look at. I mean, you should have enforced this in the beginning. You can't go back now and do it. And businesses are closing because people are like, oh, like me. I'll be honest, I don't go to a business that I have to wear masks. I will just stay home. And if my wife wants to go out and do the shopping, then she can go. But I won't. It's just ridiculous. I have a health condition. I'm not necessarily worried about catching it. I just know the precautions I need to take. And that's hygiene. That's staying your 6 feet. I mean, it's just ridiculous. I mean, so you guys got to sit and think real hard about this because it's going to...
2 minutes, Mr. Chair.
It's going to affect you guys in re-election. It's a tough decision, but I just say if you do it now, it's going to make you guys look bad.
Thank you very much. Okay, Jake.
All right. Looks like the next comment we have will be from Guy's Galaxy A50.
Okay.
Are you there, Guy? Hello? Guy?
Just trying to unmute. Can you hear me now?
There we go. Yes, we can hear you.
Sorry, you guys needed a little break there anyway. Hey, just from my side of it, been the business, have been open ever since this started. So we've been open the whole 13, 14 weeks has been going on. During that time, probably just putting in conservative average, about 100 service customers, salespeople, plus 25 employees. We've never wore or required them to wear masks. It's been their choice. None of our employees have. We do have customers that come in. When they wear their mask, they ask if they can take it off, and we tell them yes. We also tell them if they have to wear their mask for some reason, want to stay away from handshaking, we do. And we've been, like I said, we've been doing this for the whole time. The month of May was even bigger. We probably had a couple hundred people in and out of here, easy the month of May. Same thing. Also on the, I'm just trying to say this because it's real life. Nobody's contact traced me, or nobody said any of my customers or my salespeople or my service department or my detail department have had it. So I just want to say on this side, to go after this now, I think it's crazy. And to have somebody come in to my dealership now and say, you're not wearing your mask, I'm going to go tell the supervisors, we're going to give you a warning, we're going to educate you. We've got, we try and clean the pens and, but we can't clean every door handle. We can't, and nothing, I don't want to say nothing's happened, but I'm just saying nobody has said, hey, we got sick over at Strohmeyer's Auto Center, or this happened. And I just think to really put this restriction out there and even to do it, I think is, it's just kind of wrong. But thanks for the 2 minutes. Appreciate it.
Yeah, thank you. And thank you for coming in today, giving your comment. D. Parker, it looks like D, you have your hand up again.
Yeah, just a real quick finish up here. The reason why I offered the option, or what I asked you to offer the business, let the businesses decide on whether they want to enforce or not enforce, is because as a real estate agent and a property manager, I have lost minimum 3 to 4 businesses in the county who are not coming back. I go out and I try to develop opportunity for businesses to come into the county that I feel would be beneficial to the area that I am servicing. And it's going to make it much more difficult to entice or to woo commercial businesses to come in if this ordinance is here or this atmosphere is in place. And I feel like my job is to try to say, hey, Lake County is a good place to come. Here's all the benefits. Would you please come and consider, and to give ideas to open up to diverse businesses that maybe we don't have, or something that I see a need. And this is just going to make my job much harder to fill those spaces. And I'm concerned about the amount of commercial businesses that are going out. They're not coming back. And I'm not saying it's the masking fault. I realize there's a lot of other stuff involved. I'm not that naive, but I do know the masking is having an impact. And if it's already to this degree of division, let's just back it up a little bit and try some other options. And so that's why I was wanting to offer that option, was because then I can say, it's optional, it's recommended, this is what Dr. Pace says, but it doesn't create division. It doesn't create such a forward motion wall stopper. I know I'm not communicating as well as others, but I hope you get my drift. So what I'm asking is, you need to seriously consider this, not only for businesses in place, but future businesses, or getting businesses in here in an already economically impacted community. So I just would really, really, really ask you to consider that. I don't think this ordinance is necessary.
Mr. Chair.
Final thought here. I know it upsets people when people are like, kiss my rear, I'm going to do what I want. But don't let those few dictate what the rest of the good population is doing. Don't let precedent be the error marker here, because I don't think it's healthy. Thank you so much.
Okay, thank you very much. Okay, Jake, that looks like all the hands that were up there. So we'll go ahead and bring it back to the board. Oh, you know what, Jake? One last thing. Let's. We always open it up the room. Just open up the room one more time.
Oops, sorry. All right. Unmute all here. All right, the floor is open. If you'd like to make a final comment, please state your first and last name.
Guy Strohmeyer?
Yes, we can hear you.
Yeah, guys. I know I spoke for Strohmeyer's Auto Center, but I need to let you know too that my pastor asked us to speak. We're the church that's across the street from the closed Kmart, and we've been meeting for about 6 weeks. We've been meeting outside most of that time. One time we did have to go in.
Hey, Guy, we're talking obviously about the enforcement resolution. Is this, about the enforcement stuff we're addressing today? I know churches are open.
Moke, I'm just going to let you know that it is about the face mask, because we've had 60 to 90, maybe 100 people, and no one's wore a face mask during that. And again, now asking us to wear them or going to fine us is what, our pastor's saying we don't think is right.
Okay.
Thanks.
Yeah. Thank you. Okay, we'll go ahead and close it down and bring it back to the board. Jake?
Moses Zapata.
Hello?
Hello, Moses Zapata.
Oh, yeah. Okay, go ahead, Moses.
I'm the guy's pastor, and I just want to reiterate what he said, that we found it not necessary, and that the people were very cooperative in not wanting or using the face mask, and it hasn't upset anyone, and we've been having a great time together. We've been functioning as a church, as an essential service to the community, and so we stand behind the no mask policy anyway.
Yeah, well, that's not what we're talking about. There's a public health order that it is mandatory masking. Today we were talking about the enforcement issue. So thank you very much. I appreciate it.
I understand, but I just want to know where our church stands.
Yeah, whatever vote happens today doesn't change the public health order that is currently in place.
Yeah, well, again, that's a recommendation, and I appreciate it.
Okay, we'll go ahead and bring it back to the board, Jake. Thank you very much. All right. Okay, bring it back to the board. Obviously, I wanted to have the conversation today. I know it was going to be a long one and a passionate one on both sides. Obviously, the intention of the enforcement, what we were talking about today was, like we said, we understand there are 90% of the folks are following right along. There was a conversation we thought needed to have, so brought it here with the enforcement, and ultimately I've heard from 4 board members that they don't think it should be done at this time. So I think it's pretty clear at this point. But ultimately, as the board chair, felt like it was a conversation that needed to be had. We had it at the reopening committee, and attempted to roll it out here. So bringing it back to the board, either for action or no action at this point, but kind of wrap it up here for the end of this discussion. Supervisor Sabatier?
I just want to make one comment, and I appreciate the discussion, and I also recognize that it's very personal for some people what this discussion means to them. But I hope that in the future, and this includes us as a board as well as the public, that we can make sure to discuss the issue and not individual folks. I think that everybody should have the right to express themselves, and they should be able to express themselves without any repercussions from verbal comments made. And I hope that we can move in that direction.
Yeah, I think being respectful through these tough times is always something to be considered. People, personal attacks and other things, it's unacceptable. As a board, we sit here making decisions, hopefully to move our community and our constituents forward. We always have different views, but ultimately, I I do enjoy serving with each and every one of you, and I know it's a hard job that we do. And so we're in the public light. That's what happens. But as we move forward, respecting each other and others' views are always, are on my mind as we bring these things through. So thank you very much. So we'll bring it back to the board for action. If we don't hear any action, then we'll go ahead and move forward. So go ahead, EJ.
Yes, Dr. Bates, are you still on?
Yep.
He is.
Yes, I'm here.
Okay, I just had a quick question because that, of course, one of the main goals for the Blue Collar Committee to be still intact is to ensure that if and when a surge takes place, and like I said before, hopefully one doesn't. Their goal is to try to maintain a status of being open in light of that. And so, is there a possible way that, rather than shutting down, something like this be reformed, of course, because obviously it's a rough draft and it needs a lot of work that we can all put into it if we can get to a point of discussing it. Maybe this be the roadblock rather than shutting down so that then businesses don't have to be affected by it. Just asking if that's a possibility or something we can discuss later, because I'd rather do something like that than to shut down, because I know the businesses probably won't. And that's another thing that I wanted to add is that my experience is with those businesses that I've actually educated, and I have no problem doing. I enjoy doing that. It gets me in front of the people. Is that they have a hard time trying to enforce it themselves. They try to tell people to wear masks. They also feel like it's redundant to have plexiglass in front with a mask when they're not having really contact, or they're not, or none of that's being transposed. So there's just a lot of different moving parts that can be adjusted to fix this thing. In light of that. So back to the main question, is just something like this more viable rather than shutting down later on?
I think we can certainly have that conversation and try to figure out what steps to take as we start moving. The problem is that sometimes there's a lag time. There's like a couple week lag time. So if you start seeing a rise in cases and we start putting measures in place, we may overshoot where we want to get. But certainly, I think that would be one of the conversations to have, is to how to implement these orders and actually enforce them if we start seeing a lot of spread. Right. I think that would absolutely be something we could consider. I'm not sure the conversation will go a whole lot different in the future, but I mean, maybe.
Okay.
Worth a try.
Supervisor Brown.
So I'm going to ask that we find a way to vote on this. I think it's important that the public knows how we feel about it on record on this thing. And if no one's willing to make the motion, you could always pass the gavel and make the motion yourself. I mean, there's a way to do that. So.
Well, I brought it to the board for the discussion. If someone feels very strongly about it, that's what we're doing here as far as moving forward with it. So felt it was, very critical that we have the discussion. We have it here in the public forum, as we've done. We allowed folks to weigh in on both sides. And, if no one's ready to make a motion to move forward with it, then we can move on if there's no motion.
So no one's for this. It's all five against it.
At this point,
I'll say that I am, yeah.
Well, at this point, obviously, I've heard it very clear. I felt like, obviously, bringing this thing forward to have the discussion about the enforcement was very, very clearly needed. And so we've done that. Obviously, I've heard from all four board members that there's no support for this, so we will move on.
So are we all, I want to know, I'm curious to know, I'm asking the board how they feel about it. Are they for it or against it?
Yeah. Go ahead. Each one of us could say it. You start with me. I brought this up because obviously there needs to be some type of enforcement with the public health order. And I felt like it was warranted to have the discussion. So yes, I brought this forward. So do I think there needs to be some type of enforcement at some point? Yes.
I'm not sure why there's a need to have this part of the conversation when we've been expressing ourselves throughout this last hour or so.
The public needs to know.
Well, I would
the public
suspect,
deserves to know.
I would suspect that the public should know based on the conversation that we've just had.
Yep.
And again,
So
the
item was an action item. It wasn't a discussion item. So that's why I'm asking. We had people take out of their busy day to express themselves, and they want to know how their elected officials feel about it. So either way.
And I think the elected officials have made it very clear. So being if there's no one to make a motion on this issue, we'll go ahead and we're going to move on to our next item.
I don't have a problem explaining where I'm at right at this point. If that's okay.
Yeah, if you want to do that now, go ahead.
Yeah, no, I just want where the ordinance is. It's a very rough draft situation. I also mentioned that this would be a good roadblock for it closing down rather than opening up. As it stands right now, we would need a lot of work. So passing it today, when Anita had mentioned earlier, this is a very rough draft. And also with the survey in place, I know that there's a lot more questions that can be answered by businesses who could possibly be able to open for different hours and meet in the middle rather than having something like this go further out. Of course, there needs to be some sort of, I would say, some sort of teeth because other agencies or other cities are doing this already. It's very difficult for us to have code enforcement do it, but at the same time, we're just looking for a way or a mechanism to ensure that the folks that are really trying aren't the ones that are being, in essence, affected by this. We're looking at trying to have something in place to make sure people at least try, but it seems that that's not going to be the issue, and plus it's a rough draft, and so passing it in the rough draft form doesn't seem to be favorable. But I would need more time to work on the ordinance or the resolution or whatever, the urgency ordinance, and that's where I would be at right now.
Okay. All right, any other comments from the board on this item?
I do have a question based on that. Does that mean it's coming back? If it's a rough draft and that's the reason that we're not going to vote on it, does that, because I haven't heard anybody add anything to it to change it. So I don't know, we've had the draft for a week now and I didn't hear any changes to it. So I don't know, is it a rough draft that's going to be coming back or is it done?
I'm only looking for the rough draft to be enhanced.
Go ahead, EJ.
I would only be looking for the rough draft to be enhanced as of now, because it doesn't seem like it's going to pass because of its state, to be a deterrent from closing businesses. And that would be the way that I would go about it.
Okay. All right, if there's no action to be taken on this item, we'll go ahead and we're going to move forward. We still got a full agenda for the rest of the day. And let me just looking at what we have. So I do have a question to admin staff and the rest of the board. If we wanted to take a break here for a while or just keep pushing through the agenda. Go ahead, Supervisor Sabatier.
I was wondering if we can finish the item 7s. They look like they're pretty quick, and then maybe take a break and come back for the last one, which would be the budget.
Yeah, we have also item 5.1 and 5.4 that were pulled from the consent agenda item. So we have a couple of those. So
I promise 5.4 will be quick.
I think 5.1 will be quick too. So I think what I'd like to do is go to item 5.1.
I'd like to, we have staff that we have to consider. We have actually workplace laws that we have to abide by. So I think at some point we have to give them a break. So.
Yeah, so that would be the thought. Maybe we go until about 2:00 and then take a 30-minute, or 2 or 2:15, then take about a 30-minute break and then come back and finish with the rest of the agenda for this afternoon. So I think these two items we could probably work through in the next 15 minutes and get 5.1 and 5.4 out of the way, and then take a 30-minute lunch break and then come back and finish with the rest of the afternoon, both the budget item and also the rest of the day. So just thought.
I would like to check with staff. They've been going since 9:00 with 5 minutes in between for a break. So.
Well, if you're asking me, Mr. Chair, my preference today would be to power through and be done, but I'll do whatever your board wishes.
Okay.
I'm doing.
I know we have Johanna. We have other folks on.
Johanna, how about you?
I'm fine. Mom's watching the baby,
let's put everybody on the spot. Let's just power through and worry.
Just trying to set up a point for a break with the rest of the board, that's all I was asking. I think what we're going to do is we are going to take a break. We're going to go until 2:00, then we're going to take a break for 30 minutes, and we're going to come back and finish the rest of the items this afternoon. Do we have any objections to that from the board?
I agree.
Okay. All right, moving on. Let's go item 5.1. Approve addition of a special meeting of the board's annual meeting calendar for 2020.
So thanks, Mr. Chair. We have on your agenda a recommendation to add a special meeting to the June 30th agenda. The recommendation was to set it at 1 p.m. for the purpose of holding one of your development workshops with department heads. But I know in my discussions with one of you, you asked if we would also have a COVID-19 report. So if your board decides to add that special meeting, and by the way, I should clarify that because it's a 5th Tuesday of the month, you didn't have one previously scheduled. If you decide you want to add it, staff needs some clarification from you as to, what you would like on the agenda. And then there's also the issue of whether or not the meeting would be done in Zoom or would be done in the hybrid platform that we've been working on. I believe from a technology standpoint, we would be ready on to have this June 30th meeting back in the boardroom. Well, actually, the way it would work is for those that want to be in the boardroom, they could be up to the capacity that we could host with social distancing. And for those that prefer to remain in Zoom, they would be able to do that and participate that way. So we need your direction. There's just, so that is really the question for June 30th. Do you want to have a special meeting at 1 p.m. on June 30th? If so, what, in addition to the economic development discussion, would you like on the agenda, and how do you want to host that meeting?
Excellent. And because it is a special meeting, obviously we got to be very clear about what we're putting on the agenda, correct? I mean, there are some items that need to be done in a certain way. So, I think, during the times that we're in right now, I think I think the meeting is warranted. I know we want to talk about economic development coming out of this now that the reopening's up. We've kind of put this off, and, COVID has kind of pushed it. We pushed it to the 30th. I think that is, it was a wise call to do it today, as long as the meeting took. Otherwise, we've been here till 9:00, which is acceptable at some point. But, we just moved through that process. So my thoughts on it are that we have the meeting. And if a request of the board is one of the members asked to have a COVID update, I would be fine with that. Have a COVID update and also the economic development workshop. Supervisor Spatier.
And so just for the record, I requested the COVID-19 update, and I just think if we're in a state of emergency, to ignore it on a weekly basis is basically we're not in a state of emergency. I want the public to be updated. I think we can keep it brief. I know Dr. Pace was fairly brief today. We had a longer conversation about the ordinance than we did about the COVID-19 update. And I think that it wouldn't take up much time if it was just an update at that point in time. And I think that it would benefit all of us to make sure the public as well as we are updated on what's happening.
Okay, thank you. Supervisor Scott?
I agree. I think because where we are today, I think we need to continue having these discussions every week with the COVID, and that should be included in our special meeting.
Okay. Supervisor Crandall?
I'm fine with it. I'm fine.
Okay. Supervisor Brown?
21 meetings.
Sounds like you got what you wanted. You got the extra meeting, that's fine. You got enough votes for it.
Yeah, the board's open to an extra meeting, absolutely.
And so then the question of Zoom or hybrid, which would be a combination of Zoom and the board meeting, if you could clarify your sentiments on that.
Yeah, it seems like you guys have been putting some hard work into it. I think the hybrid meeting, that would be a good one to start with, yes.
Yeah.
Okay. So then
all right.
I'm hearing that there's consensus for that, so I'm good. Thank you.
Okay. All right, we'll go ahead and any more comment on the special meeting? Okay, if not, we'll go ahead and open it up to the public. Do we have any public comment?
It doesn't look like we have any hands raised, but I will open up the floor. Oh. Sorry, okay. The floor is open. If you'd like to make a comment, your first and last name.
Okay, Jake, let's bring it back for action. Or do we need any action or just direction?
Consensus is good, and I've heard that there is consensus.
Okay. All right, let's take up item number 5.4, which was also pulled off the consent agenda. Waive the formal bidding process pursuant to Lake County Code, Section 38.2, as it is not in the public interest due to the unique nature of goods or services, and B, approve the agreement between the County of Lake and Hardeep Singh, MD, to fulfill responsibilities of substance abuse or disorder medical director of fiscal year 2021 for a contract maximum of $90,000 and authorize the board chair to sign. Supervisor Sabatier?
So I pulled this because there's a typo on item number 1, services. This is a contract or an agreement with Hardeep Singh, medical doctor. And in number 1, services, it says set forth in this agreement, Stephen Bradley, MD. And so we need to replace that name with Hardeep Singh, MD. So I wanted to make sure we didn't sign an agreement that was with the wrong doctor.
Okay, thank you for that clarification. I don't know.
And I have spoken with Mr. Rudolph about that, and I believe he said he was available if we needed to ask any questions. I don't know if he's still on.
I doubt it. He's probably off doing what he needs to do, working hard as usual. Yes, Anita? Go ahead, Anita.
Sorry. The fix could be just as simple as drawing a line through the incorrect name in that first provision and simply handwriting in the correct doctor's name. And then, Mr. Chair, when you sign the agreement, if you could initial that section as well, you'll be good to go.
Okay. All right, and there are two actions, obviously, that need to be taken on this. A, waiving the formal bidding process, and then B, making the second motion. So we're ready for
Open it up for the public.
Oh, yeah. Sorry about that. Any public input on item 5.4? Jake, if you could open the room.
Yeah, I'll open up the room. The room is open. If you would like to make a comment, please state your first and last name.
Open it up for the public.
Oh, yeah. Sorry about that. Any public Okay, here none. We'll bring back to the board for action.
Mr. Chair, I move to approve the waiving of the formal bidding process pursuant to the Lake County Code, Section 38.2, as it is not in the public interest due to the unique nature of goods or services.
Second.
Motion and second. John, if you could do the roll call vote.
Okay. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Aye.
Thank you.
And Mr. Chair, I move to approve the agreement between the County of Lake and Hardeep Singh, MD, to fulfill the responsibilities of the substance use disorder medical doctor for fiscal year 2021 for a contract maximum of $90,000 and authorize the board chair to sign.
Second.
It's been a motion and a second.
Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
You're on mute, Rob.
Yes.
And Supervisor Simon?
Aye.
Thank you.
Okay, thank you very much. All right, we're going to go ahead and it's 1:57. We go ahead and take a 30-minute break here. Be back at 2:30, and we'll finish out the rest of the agenda.
All right, see you then.
Yep. Okay, thank you very much. All right, we're going to go ahead and reconvene our June 16th Board of Supervisors meeting for Lake County. We're going to go ahead and I think we should just go ahead and start with item 6.6 and get moving forward with the public hearing. That's 11 a.m. item. I know we're behind schedule, obviously. 11 a.m. item, a public hearing, A, consideration of the fiscal year 2021 recommended budget, consideration of the proposed resolution amending the position allocation chart for the fiscal year 2020-2021 to conform to the recommended budget. And 6, consideration of authorization for affected department heads to proceed with purchasing selected capital assets prior to the adoption of the fiscal year 2020-2021 budget.
Thank you, Mr. Chair. Stephen Carter and I are going to present this budget to you. And Stephen, I know you've been in communication with Kathy Saterlin. Will she be joining us today or just viewing?
She's on, but I don't believe she plans on talking.
Okay, thank you. So, Mr. Chair, before we get started, I also wanted to call to your attention that there was one emailed public comment that came in regarding this agenda item. It couldn't be added to your agenda packet because the meeting was already in progress, but I did forward it to you by email. So presented for your consideration today is the recommended budget for fiscal year 2021. By approving this budget, basically what you are doing is authorizing the expenditure of funds for our operational needs until we come back in September with a final recommended budget. So basically this gets the ball rolling for the fiscal year. We would be coming back to you September 23rd and possibly September 24th if needed for the discussion of final recommended budget. This recommended budget before you today is structurally balanced, meaning that it reflects only the use of ongoing funds to support ongoing operational costs. As you recall, that hasn't always been the case during some of these disaster years, but as it stands right now, that's where we are. As you remember back on March 31st, when we talked to you about the COVID crisis and how it had really ramped up at the time we were working with department heads to prepare your recommended budget. You approved our recommendation to bring forward at this time a budget that is essentially the 1920 budget replicated, just to get us started. And that's what you have before you today. However, there are also a small number of inventory items and some capital asset items that the respective department has indicated to us had to be budgeted July 1. A large number of those were taken out of the budget, and we'll consider whether or not they go back in for September. But there are also some that you'll see in this budget that department had said needed to be funded because they may extend funds sooner than September 23rd. And so that's why you'll see some of that there. So the capital assets in last year's budget, the total was nearly 49 million. What you have in this budget is only about $21 million in capital assets. And there's obviously a separate sheet that details all of those. And I have asked if you would like some of the responsible department heads to give you status updates or answer questions about some of that work or those expenditure plans. I believe they are here, and we'll do that for you today. So as I said earlier, we also removed all of the inventory items, which is object code 38, and there is a slight typographical error in our cover memo for this item. It said all general fund inventory items were removed, and that should be corrected because it's all inventory items were removed except for those where the department head made it clear that they may need to expend funds before September 24th when final budget is considered. And those were all in either the sheriff's budgets or in the air quality management district budget. So again, as I have explained, it's essentially a replica budget except for those changes noted. And then just a few minor adjustments in the position allocation, the removal of one accountant auditor 1-2 supervising in budget unit 1121, one limited term assistant assessor recorder 123, one limited term chief deputy assessor recorder valuations. And then we are updating the class title for the behavioral health administrator to behavioral health director. So as you know, this replica budget is unfortunately a common theme right now. That is something that the governor's budget essentially is too. It's in the process of being adopted, but from all indications, the real budget work will begin shortly thereafter. So in the next couple of months is when the state will make some of the tough decisions, and I expect the county will too. There are just many unknowns yet in terms of the impact of the COVID-19 crisis. And so at this time, we had also promised that we would give you an update on what we know at this point about some of the revenue streams that we're monitoring. And so Stephen Carter is going to give you an update on that. The last time we talked about it was May 5th, as you recall. So Stephen, I'd like to turn it over to you and let you talk about some of the revenue streams we're watching.
Good afternoon, board. So the revenue streams that we plan on watching include sales tax, realignment, transient occupancy tax, property tax, and interest. And then the major expenditure we want to keep our eye on is pension liability, or PERS. So going back to our previous conversation, we rely on data from HDL companies for sales tax and their estimates. That's what they do. And within the memo, you can see that the 90-day deferral could possibly cost the county up to $462,000. But this is just a shift. So we would still receive it in 1920. It would just be third and fourth quarters instead of second and third quarters. HCL also estimates for the local Bradley Burns 1%, most of our discretionary revenue from sales tax exposure for the 12-month deferral. It's, again, a monthly payment, so we will eventually get it. It just won't be during our normal timing. Going on actuals, so for the 1% Bradley Burns local, so far we've received in fiscal year 1920, $3,070,000, and we budgeted $3.2 million, so we're about $129,000 short at this point, but we haven't received our June payment yet. So we're not seeing the full effect of how the sales tax is going to go down at this point, but we are all aware that it's going to go down upwards of 17 to 20%, which hopefully by final we will see some of the effects of that so we can budget that properly for you. And the 3-year average for the 1% is $3,063,000. So we've already reached our 3-year average. So we're doing pretty decent for at least for 1920. But like I said, we are seeing a decrease, going to be seeing a decrease. The other part of sales tax would be Proposition 172, and that goes along the same lines as the Bradley Burns local 1%. We've received $3,042,000, and we budgeted $3.1 million. So we're almost at what we thought we would receive in 1920. It's going to be the beginning of 2021 that we're going to see the major dip. Okay, and then moving on to realignment, which is also sales tax, but it's called Realignment 1991 and Realignment 2011, where it was realigned from the state to the counties. I don't have specific data on that, but what I have been seeing in our financial system is that this year's amounts came in significantly lower than the previous year, but they're about on par for about 2 years ago. So it still is a reduction, I believe, a little over $500,000 so far in 1920. That is significant, and those departments that are funded by this generally are what we consider self-funded, so social services, behavioral health. Those ones, if realignment isn't sufficiently funded, they either have to make cuts or possibly come to general fund for some relief. That's mainly for Realignment 91. Realignment 2011, there are some general fund departments where you have the sheriff, probation, and departments like that. This funding source is expected to be lower. Not seeing it just yet, but so there will be more to come with final budget when we talk about it. But there is a plan in place to take care of, from what I've heard from Rob Howe, on how that will be handled. And it sounds like it will be okay, at least for 2021 going forward. All depends on how things go. And the next item, revenue that I'd like to look at, is transient occupancy tax. And for fiscal year 1920 so far, we have received $833,000, which is actually extremely high for, if you look at our 3 and 5 year averages. And that's all due to staff's efforts on finding the TOT operators and bringing them into compliance. The 3-year average is actually only $561,000, and the 5-year average is $597,000. So it is higher, yes, but that's only a temporary increase because of the previous years that have now been collected. So we do plan on seeing a pretty significant decrease in the first half of fiscal year 2021, and the rest of that fiscal year will depend on our shelter in place or masking or people's willingness to travel. So we'll keep a close eye on that. And then the next revenue item would be property tax. Surprisingly enough, in fiscal year 1920, we've actually received $21,897,000, and we budgeted only $23,435,000. So we've actually come in right where we should. We aren't seeing a major dip, but the big worry is the first installment for 2021. that's where we may or may not see some problems happen. And then the last one for revenue would be interest. Within Noveline, our accounting system, I have not seen the third quarter interest post, but from previous conversations with Kathy Saderlin, she stated that the 1920 third quarter earnings are currently 30% less than the third quarter of last year. So we are expecting a pretty good sized dip in the interest. And to put that in perspective, last year I believe we had just over $1 million in general fund interest. So 30% is a good amount. And just recently it had started going up. The 5-year average has only been 481,000. And I'm sorry, the 3-year average is 686,000 and the 5-year is 481, correct. So it sounds like it's coming down to the historic level instead of the higher level we've been seeing. The interest also affects more than just general fund departments. Building and safety, child support, road, mental health, museum improvement fund. So quite a few other departments also receive interest, so it affects them as well. And then the major expense that we want to keep an eye on is our PERS, our pension liability. I do not have any recent updates past what I gave you last time, but to reiterate, CalPERS has been hit very hard by the stock market decline during the COVID crisis. And if history is to repeat, which usually it does, that means our interest investments for them are going to take a huge dive, and that in turn means CalPERS rates will certainly increase more than previously expected. So we've been seeing like a 2% increase year over year. You can bet then when it catches up in a year or two that instead of 2, it would be much higher, like a 3 or 4% increase. So that would affect our salary and benefits cost. And that's basically what I have for what we would watch.
Thank you, Stephen. So as you can imagine, there's no time like the present to get these economic development workshops underway. As you recall, those had been planned to start in the early spring, and all of that got sidelined when the COVID crisis began. We're kicking off the first one next Tuesday afternoon at 1 p.m. with the planning, I'll just call them the planning and infrastructure departments. And we have them grouped into 4 different groups of department heads over a 4-week period. So we're very pleased to bring that discussion to you. So at this point, that essentially completes our brief presentation, and we're recommending that your board approve the recommended budget, that you adopt the position allocation resolution, and that you authorize the purchase of the capital assets that are detailed in your capital asset listing.
Okay. Thank you very much for the presentation and hard work presenting this. So thank you. Go ahead, Supervisor Sabatier.
Thank you, and thank you for that presentation. I know that still at this moment in time, our state government has not approved a budget as of yet. I know it's passed legislation. AB 74 was passed, I believe, last night. And there's some trailer bills. They anticipate some changes to go in and out all the way through August, potentially. But what I am concerned about is they kind of kick the realignment portion down the road. I don't believe it's part of the budget. I believe they want to continue discussions. They're talking about, I know that with CSAC, we've been asking for at least $1 billion to be reinvested into the realignment to make sure that we stay afloat. And I believe that we originally wanted to ask for $2 billion. So that was already less than what was originally sought after. And so now that part, we don't know exactly what that's going to look like. I also know that the state is kind of leveraging their budget on this belief that the federal government is going to, I believe they are asking for $14 billion from the federal government. And that's how they anticipate to continue to pay schools in full. And I'm assuming that will also be to continue paying counties as full as possible with that insertion of liquidity. So I'm very nervous about a copy and paste budget. I understand that it's hard to budget when there's not enough information for us to know, but I don't think any of us are anticipating a budget that will be larger than last year's budget versus a budget that's going to have to be pinching pennies here or there. So my biggest nervousness that I have is that we are starting to do contracts, annual contracts right now from July 1st all the way through June 30th of next year. And I am looking to see if it's possible for us not to slow down those contracts, but maybe to look at reducing what the expectation of those contracts are, because I don't want to see the county be involved with contracts we can't afford at a later date. And so I know that it's important for us to check off the boxes that the state asks us to check off. For instance, today we brought item 5.4 for the addiction specialist, doctor. Those are things that are needed in order for us to access other pots of money. And so just one example of many other things that we have to contract with. And I don't want to see us overwhelmed by our contracts versus what we're going to receive. So I don't want to see changes necessarily on actually, I don't want to see changes at all when it comes to our salaries, but as far as our other expenses, I'm going to ask that the board provide a consensus, if that's what we do, to try and at least aim to have a 10% reduction. I know all of our schools around us are aiming for a 10% reduction to be better prepared for what the reality will be. And I think that we should be doing the same, because what we spend in the next 3 months, if it's exactly with the same budget in mind as last year, we're going to have a lot of trouble cutting back the next following 9 months. And it's going to be the hardship is going to be that much more intensified if we have to really cut back because of the amount of spending we did in the first 3 months. And I know that some of the numbers that Mr. Carter gave us was about what we were doing in 1920. And as far as I'm concerned, that was the height of the economy at this moment in time. But as of February and then later on, that's when it started falling down. And so for me, I understand the lack of ability to get the budget done. It's a large budget. And I know we will get more specifics when it comes around to September. But I'm nervous about our expenses looking exactly the same as last year and us moving along like it was last year and spending that kind of money. So I think that we're in a tough spot, but I think we can make it easier if we do the right things, such as taking some of those measures.
Thank you, Bruno. Supervisor Crandall?
No, I'm on the same page with Bruno. I'm kind of just thinking about certain aspects of the budget, and also the state budget not being approved, but also just thinking about different entities, and especially in lieu of talking with other departments like the education, like I think it's Brock was discussing how 10% of their budget was cut, things like that. So I just want to be careful, but at the same time, we'll work it out. So.
Thank you. Obviously, going forward, having a crystal ball is, no one has that. So I want to thank the staff for putting the hard work together as we move forward. I know this will be refined more as we talk about moving forward with it in September, but I think the recommendations that they brought forward at this point are reasonable to move forward with, and as they will do and they have always done, I think they will keep us informed as we move forward through this process over the next year. Very clear, 2020, the end of 2020, the beginning of 2021, even moving on into 22, 23 is going to be very different, I think, than what we had for the outcome. But as we reopen up the economy, and see where things going as far as federal legislation to backfill any state money, and then the state money coming down with the advocation of CSAC and other things through the realignment. I think we're moving in the right direction. So myself, I'm ready to obviously move forward cautiously, but I think that's what's been put together here and brought to us as a board, both with admin staff, budgeting and everything, and all of our department heads to put this stuff together. So my thoughts on it. Go ahead, Tina. Or if any other board members have any comments at this point. Go ahead, Tina. Supervisor Scott.
I agree with that. I think we're in a much different place than I thought we would be 6 months ago. Like you said, there's no crystal ball. We don't know where we're going to be in 6 months. Our state doesn't even really know that. For me, I'd have to rely on staff and the budget that they put together, and just know that September, when it comes back, we may have to redo some of these numbers. Do we have any idea of how much, what the percentage of salary savings that we have? Because I know we still have positions that are being funded, but do not have a person in that position. Would that be, what's the percentage there? Do we have any idea?
We continue to operate at least a 20% vacancy rate, Supervisor Scott. So there is always a tremendous amount of salary savings resulting from that. Does that answer your question?
Yes, I was just, trying to think, could that be, part of the percentage of putting away? But I know that's money that, we have from year to year to year, because that's not a new phenomenon to have those empty positions. That's it. This is a really tough place to be in.
It is, and based on what I'm hearing, I might offer a couple suggestions and see if there's any consensus around it. First of all, for contract renewals, we want to be certain, if it's not already in place, and Anita, you review far more contracts than I do these days, but don't all of our contracts have in them an out clause in the event we do not have adequate funding for them?
Well, Mr. Chair, is it all right if I respond?
Yep, go ahead, Anita.
Many of them do. The behavioral health social services that deal in large amounts have those appropriation clauses. They, depending upon the circumstances, they have varying levels of worth. They're not a get out of jail free card. They're not a panacea. So they do offer some protection with appropriations, but not necessarily directly across the board. So you're probably safer to ensure that everyone is contracting very conservatively. Other than, again, social services and behavioral health, where those provisions are generally very effective.
So we could certainly give some departments direction to make sure that those out clauses are in all contracts, and we could also give them some direction to reduce expenditures, if you like, by 10% in the fiscal year. There will probably be some exceptions that department heads would need to speak with you about, as those contracts are brought to your board for consideration. We also work with a finite amount of general fund dollars, and each year as we work with the department heads to prepare the budget, we give them a net county cost number for each department. And we could conceivably roll those numbers back by 10% until we have more information. In fact, our office is just finishing up those net county cost numbers, so the general fund departments will know what they have to work with in the coming year, and we could adjust those to 90% of what we would have ordinarily told them. As far as the self-funded departments, frankly, the self-funded departments may not be as self-funded as we're used to them being, in light of some of the factors that we're discussing today. And I think we could give them the same guidance that that they need to roll it back and not spend more than 90% of anything that they expect to receive. So would that give you a bigger comfort level?
Supervisor Sabatier?
And I would say yes, until further notice when we get to the actual final budget. And then we'll figure out exactly what that needs to look like for the rest of the year. Just
exactly.
Little caveat.
Yeah. Yeah, definitely. Conservative, conservative, what we're looking at going forward, because we all know there's going to be an impact at some point just as it comes in. Yeah, absolutely. I think that's a good direction to move in. So. Supervisor Sabatier?
I have some more questions, and I see that the department heads are here if they can respond. But I was looking at the capital projects list and all of the reductions that were made that dropped it by about $27 million. And I'm wondering, I'm looking at Public Works, where there was a decrease of $3.6 million for roads. I'd like to get an idea of what that looks like for us as far as what is taken away from what could have been done. I'm looking at the disaster response and recovery, where there's about $4.2 million taken away. And then also, if special districts can discuss a little bit of the decreases that I'm seeing not across the board, but in many different categories. And the last one is Watershed Protection District of about $4 million. Just to kind of get a general idea, are those projects that have been completed? Are those projects that are being postponed? Just to get a better idea of what that is.
So then I might suggest we start with Scott DeLeon for both the first and last items on your agenda. Yeah. First of which was roads and the last was water resources. Mm-hmm. Scott, are you here?
Yeah, I was actually going to ask if I could go second, because the documents that I have are the final ones, and I'd like to see the form you're looking at, Supervisor Sabatier.
I'm looking at recommended budget book fiscal year 2021. It's a PDF, and I am on page 42. It starts on page 41. And roads is number 98, and watershed protection district is number 200.
So you're looking at a PDF page 41. Is there another identifier on that page?
C6 and I guess C7. Yeah, C6.
C6 and 7. Scott, while you're looking at that, would you like us to see if Jan is available to answer Supervisor Sabatier's questions?
Yes, please.
And I am, and
I'd be happy to answer. I just need to find the document you're looking at. Thank you.
I think, I believe what you're looking at is the capital asset requests that we needed permission to start spending right after July 1st and until we get the complete total budget before you. Ours, we reduced them way down to only request what we really needed to spend right away, and most of it's generators. We're preparing for PSPS. And when the real budget or the total budget gets to you, you're going to see a lot of our capital requests will jump back up. For instance, we might need to spend $5 million on a project, and of course these are grant-funded projects, but we only need to spend $1 million between now and say October 1st. So that's why you're looking at those decreased numbers. It's just to get approval to spend until you adopt the permanent actual budget.
So I guess what that clarifies for me is that this is what's taken off right now is not taken off permanently. Some of these things may be put back in the September version of the final budget.
Correct. Especially that is true for special districts. We took off
quite a bit.
Yeah, a lot. The only things we're requesting to be able to purchase right away mostly are generators or things we need to prepare for PSPS. And even if we get permission July 1st, we're still a little bit behind the gun. We're scrambling because we need to get some more things in place.
Okay.
And Supervisor Sabatier, I found the document that you're looking at, and Jan was absolutely correct in her explanation. We did the same thing. We eliminated or reduced expenditures or only listed what we thought we would use between now and the final budget, with the expectation that it would be brought back in later.
Okay.
And Supervisor Spatier, could you ask your question again? There was a disaster budget.
Yeah.
There.
Item number 110 on C6 says a reduction of $4.2 million for disaster response and recovery.
Stephen, do we need Kathy, or are you able to respond to that?
Looks like we have two hands up. I can't see who they are. I don't know if
Kathy would be the best to respond to that, but basically I had her redo the entire, or she requested to redo the entire disaster response and recovery budget. And it's all based on what we would possibly spend between July and September. This isn't meant to be your entire 2021 capital asset, et cetera, budget. It's meant to be what you can spend between July and September in certain areas like that.
So then the answer would be similar, that it goes back in later?
Possibly.
Supervisor Simon, it looks like Kathy actually is one of the hands up.
Yeah, I couldn't see the name. There was no name with it. Kathy, if you're on here and would like to respond, go ahead.
I am on, but I'm not sure if you all could see me.
We can hear you.
We can hear you.
Hear me?
Yeah.
Awesome. So the changes that you see there in the disaster response and recovery budget unit are a reset, because you are absolutely right when you're talking about this. A 1920 ditto budget for the disaster response and recovery budget unit would not be appropriate. So what you see there is a recalculation for what I anticipate for 2021, what I knew as of April of this year. So we know that things are changing, but this is more realistic based on the active disasters we currently have. And we had a lot of activity in 1920. We received funding for a lot of our older disasters. So that is a reflection of the ongoing COVID and any carryovers from previous disasters. And it will be refined when we come back for adopted budget.
I appreciate the feedback from the directors, so I have a better understanding of what I'm looking at. I expected that this was kind of the first part of creating the final budget, not a fix for July to September. So I thought this was for the entire year. And I will say, and it's not a negative towards the staff, it's difficult when the budget was received on Friday and Monday is the only day to have those conversations with everybody. And I wasn't able to have all the conversations I needed to have, and some more questions popped up. And so hopefully in September, we'll have a good 2 weeks to be able to sit with the budget and go over it and get all those questions answered. Because it makes it difficult when it's just pretty much a weekend in between when it comes out and when we discuss it. My last question is, I know in Vision 2028, we talked about a reduction in positions that aren't filled. I hope that we will continue that, because that will help create more savings. And I know it also puts a little bit of a crunch on certain departments. But again, I hope that we can continue with our Vision 2028 with the plan that we had put into place. And if not, definitely open for discussion, but I hope that we can continue doing that for the positions that are not filled at this moment in time.
Carol, I see you have your hand up. Go ahead, Carol.
Oh, I'm sorry. I guess it was left over, but I wanted to respond to Bruno's comment about when you would all be receiving the final budget package and how much time you would have to review it. The way it is scheduled at present is that you would get your budget books, and it appears that you all prefer them in electronic form. At least you did now. So get them in electronic form on September 15th to be heard on September 23rd. Will that work for you? So that's about 8 days.
8 days, yeah.
It's better than 4.
Okay, thank you.
That'll be good.
Okay.
So I wondered if you would like to hear a brief update from Lars Ewing about one project in particular. I thought it might be beneficial for him to update you on the Lucerne Harbor Docks and Dredging Project.
Yes.
All right. Well, thanks for letting me in. So quick update on that. Actually, before I touch on that, Jan and Scott, Special Districts and Public Works, they talked about how they had reduced some of their capital assets for basically to get them through to the actual final budget. There were some projects that we oversee here that we did that on, and others we did not. And largely just based on where those budget, the budget units where the funds lie. But for specifically Lucerne Harbor, the funding is still there. I actually, it's in 1781. It's $250,000 there. A quick update on it is that we had solicited for an environmental and engineering proposal for that, and the costs were as expected, pretty high. Taking up a good portion of that budget, so we elected not to pull the trigger, so to speak, on that, to see if we can look for a solution where we might be able to do it in-house as much as we can. So at this point, we don't have any expenses that we are, we're actively waiting on, but we did not specifically pull that because we wanted to ensure that the board had an understanding that there may be expenses, but there aren't any that we're actually waiting on paying.
Okay, thank you very much for that update, Lars. I know it's a project that's been talked about for a while. I'm glad we got it funded, and hopefully we can get it completed. So, good job.
So unless your board has any other questions for us, I think we're complete.
Any more questions from the board?
More to come on September.
Lots to talk about in September.
Thank you, EJ. Okay. If there are no more comments from the board at this time or questions, we'll go ahead and open it up to the public.
So it looks like that we don't have any hands raised for this, but I will open up the floor and see if there's any comment. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake, close it down and go ahead and bring it back to the board.
All right.
Carol, I did know that you said we had one written email here. You sent that in the email. Do you want to read that public comment or?
Yeah, if you give me just a moment, I will do that. So this comment comes from Steph Lucas of Nautilus Ridge Farm. She says, the person says, this letter is in regards to the county budget. Seeing the events of the past few weeks and the despicable actions and constitutional violations committed by police and sheriff's departments across the country, it's time to take millions of dollars from the police, sheriff, and jail in our county. The police do not see citizens as anything but sheep. It's part of their training. They have become too militarized, and our community suffers from it. Our children should not live in fear of being killed by these out-of-control lawbreakers. The police feel they are above the law. It is time to take their money, invest in mental health services, healthcare, education, and feeding our community. It's time to set up organizations that can handle mental health crises without weapons and incarceration. I'm not asking to just shut the doors of the police department immediately, but their budget needs to be reallocated to social services. Also, the thin blue line needs to immediately be removed from all police and sheriff's vehicles and be banned from the premises. It is a racist reaction to the Black Lives Matter movement, and it is a disgusting show of power. Thank you, Steph Lucas, Lower Lake.
Be part of the record. I'm not sure. Okay, thank you very much, Carol. Seeing there is no more public input, we'll go ahead and bring it back to the board for deliberation and action. This we need to move forward with the presented resolution amending the position allocation chart for fiscal year 2021. To see in resolution attachment. Supervisor Sabatier.
Do we, I know that Carol asked for consensus. Do we need to add any of that into our motion, or was that enough right there to provide guidance to our departments to try and watch the spending?
If you'd like, I could repeat what I believe I heard and what my direction is, and then we can just confirm that there is consensus for that. Would that work?
Yes.
So for the departments that rely on a net general fund county cost figure, the figures that we distribute to departments would be reduced by 10%. For non-general fund departments, we would instruct those departments to reduce their spending to 90% of their usual until more is known for final budget. Well, it sounded like the discussion around the out clauses in contracts wasn't necessarily as helpful as possible, but I still think that we should review all contracts that are coming forward to the board to make sure that the non-appropriations clauses are in them. And we can also make sure for the contracts that don't come to the board that are approved at department level that they have those. And then you also asked us to continue to encourage departments to eliminate unfunded positions to the extent that they can between now and September. Does that sound right?
Sounds like the general discussion that did happen. I see that Anita's got her hand up. Go ahead, Anita.
Thank you, sir. Just to clarify, it's not that the appropriations clauses and failure to have the sufficient appropriations to have that language in many contracts isn't helpful. My only point was it's not a panacea. It won't solve all problems, and it won't protect the county from all contractual obligations. That's all I meant.
Okay.
Thank you, Anita. So that's what I think my direction is. Is there consensus for that? I'm seeing thumbs up. Okay. Thank you.
Thumbs up too. Yeah. EJ, were you making a comment? We didn't hear you on that, EJ.
Oh, I said yes. I agree.
Okay. Yeah, that's at this point, that's consensus, Carol. Okay, we'll bring it back for action.
Mr. Chair, I move to approve the fiscal year 2020-2021 recommended budget. And I will just add until the final budget that it will be approved in September.
Second.
Okay, there's a motion and a second. Johanna, can you do roll call, please?
Yes. Supervisor Sabatier?
Aye.
Supervisor Crandall?
Aye.
Supervisor Scott?
Aye.
Supervisor Brown?
Yes.
And Supervisor Simon?
Yes.
Thank you.
And before I make the next motion, I do have a a question for Ms. Hutchinson. You said the 15th would be when we get the final budget, and the 23rd is when we would have our board meeting to discuss the final budget. Is that correct?
Yes.
Okay, I just wanted to make sure that there's enough room, because I believe October 10th is when we have to have our budget submitted to the state. I just wanted to make sure there was enough room in case there were changes that were made by the board. And that seems to be the case. Okay.
Still need another motion.
Mr. Chair, I move to approve the proposed resolution, amending or I offer the resolution, I guess is what I'm supposed to do here.
Yes.
Yep.
Okay.
The
Supervisor
resolution has been
Sabatier.
offered.
Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Aye.
And Supervisor Simon.
Aye.
Thank you.
And the last one, Mr. Chair, I move to authorize, to approve the authorization for affected department heads to proceed with purchasing selected capital assets prior to the adoption of the fiscal year 2020-2021 final recommended budget.
Second.
Motion and a second. Will you please do the roll call vote?
Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Aye.
And Supervisor Simon.
Yes.
Thank you.
Okay, thank you very much. We'll move on to our item 7.2, consideration of update to return to work protocol.
Thanks again, Mr. Chair. So you approved the original return to work protocol on May 19th, and at that time you directed that it be reviewed every 30 days. And so staff decided that the easiest way to track that would be to set it for the same agenda when you're considering renewal of disaster proclamation related to COVID. Hence, this item back to you today. We knew from the beginning of this that it would be a living document that would need some refining as we go through the COVID recovery and return to work. And so we have two versions of the document, the new document in your agenda packet. One is showing track change. One is showing it in final recommended form for today. And then, of course, there's a third version in there that is as it reads now. And the changes brought to you today have been compiled based on a lot of conversations with department heads about some of the issues that they are dealing with in their departments as we manage staff through this phase of the disaster. So first, we're recommending that we change the title. It's presently it's called County of Lake COVID-19 Public Health Emergency Return to Work Site Prevention Protocol. We're suggesting that the last three words be Work Site Protection Protocol instead. We updated the opening remarks in the beginning of the document to more accurately reflect where we are in the movement of the stages of the disaster at present. We revised the employee self-screening section to place emphasis on employee responsibility to conduct his or her own self-screening symptom checks before coming to the workplace for the safety of their fellow employees and the public. And perhaps the biggest change is to the employee testing section, which had been previously titled employee testing, but we're proposing to change it to employee exposure and testing. And with the revisions that we are proposing, we would no longer be promoting the concept that the county refers an exposed employee for testing. The decision for testing would rest in the hands of the employee. The proposed revisions put further emphasis on the need for employees to take responsibility to follow this protocol for the safety of fellow employees and the public. It would require, in the event an employee believes he or she has been exposed, that he or she self-isolate for 14 days, but that period of self-isolation could end sooner if their healthcare provider releases them to return, or if the employee has proof of negative test results. It further clarifies that if an employee believes they were exposed on the job, they should complete a workers' comp form. And it also provides additional details on Public Health's Verily test site and further explains the role of public health in responding to questions. We found that over the last couple of weeks, there were several little flurries of situations where employees thought they were exposed or might have been exposed. And so based on some of the issues that came up around that and how best to manage it, that is how we came up with these proposed changes. So what we're recommending today is that you approve the changes to the protocol as I've just described to you. And we'll continue to work with this document and be back to review it with you again in another 30 days.
Thank you for the update, Carol. I'll go ahead and open it up to the board. Any comments, or go ahead, Supervisor Brown?
Well, so Carol, and I apologize. It was frozen up for a minute. Did you say you'd working with the units on this? I know it may not be negotiable type thing, but they should have something to say about this. So I just want to make sure that.
Yes, and in fact, what I'm asking for today is, I'm sorry I didn't elaborate on that, but allow me to initiate the meet and confer process with the labor groups. The labor groups received the earlier version, and they would receive this revised version and have an opportunity to comment.
Okay, because
we bring it back.
Yeah, okay, I appreciate that because they're just Bruno actually said it earlier, made the connection that we're the same as any other business and we should be treating our employees the same. And if we're going to be consistent, like I feel we should be, then we should let our employees determine what works best for them in the work environment that they have. So I appreciate that.
Yes.
Okay, Supervisor Sabatier.
And I am absolutely not trying to force this upon our employees, but maybe suggesting, especially those that have a high interaction with the public, maybe a suggestion of looking to get tested.
So would you want a sentence in there that encourages, that the County of Lake encourages employees who have considerable amount of public contact to be tested regularly or something like that?
And I wouldn't even say tested regularly, but just a suggestion, a recommendation. There should be no negative connotation about not doing it, but just it's another safety measure for them and for their colleagues and the public.
So can I add to that?
Sure.
Go ahead, Supervisor Brown.
I don't think that's something we need to take to the bargaining units or even wait until this is over. I think you could send out a blast to our employees right now that we had this discussion. This testing is available. Here's where the sites are. We're looking for folks to come in and get tested. Just offer it to them, and if they want to take it, whether they have a lot of communication with the public or not. Even those that have a lot of contact with the public, it's still minimal with the glass and the safety precautions that are different departments. But I think just send them a blast like you would any other announcement by email or however you usually send it, and just leave it at that. So
just one little comment on that is that if we send them an email blast offering that encouragement and giving them the information about the resource, I imagine the question that will come back to us is, can we do it on county time? So what is your position about that?
Well, so what would be a problem with that? What would be a problem with setting up testing, in the board chambers or out here? I mean, I think as many employees as we have, we could make it easy for them to do it. I have no problem with that at all. I mean, it's for their
We do the flu
their
shots in
safety
here.
and the safety of the public. So, what's that?
I'm very
I'm
receptive
sorry, you broke up.
to the prospect of offering on-site training, and I see that Denise Pomeroy is in the room. Denise, are you hearing it? Is that possible?
Hi, Carol. Yes, I am hearing that. We'll have to have a conversation with Bearly, who is our state site that's working with public health. Right now, they are at both ends of the lake. They're in Clear Lake 2 days a week and in Lakeport 2 days a week over at the college. So for people working at the courthouse, it's like a mile away or 2 miles away. But we can have the conversation with them and see what we can do.
Great.
So,
I think that would be great.
So the question I would have is, are they obligated to be in that particular location, or can they be mobile? I mean, if they have 200 or 300, I think we should offer it to the court, the fourth floor as well. That, if we have, 200 or 300 employees right here in this building, why would we have them drive a mile when, a group of half a dozen people could drive over here?
Mainly because it's a drive-through clinic. People don't get out of their car. We don't have a walk-in clinic set up with them. So we have to go back and have that conversation with them. That's our arrangement with them right now, is all drive-through.
So I'm pleased that we can have the conversation and we can update your board at your next meeting on how that went.
If we really wanted to, and they really wanted to, I'm sure they could figure it out.
It's a great idea.
Yeah, I'm happy to have the conversation with them. Absolutely.
Okay. It is a pretty simple process. So, Bruno, though you walked through it, you gave the update on that yesterday. It is a pretty simple process.
That's the take-home.
Even signing up and getting into there for the appointment. So, okay. All right. Any more discussion from the board? All right. Here none. We'll go ahead and open up public input on this item.
All right. It doesn't look like we have any hands raised, so I will unmute the floor.
But you heard me? Hey, Brian here.
If you'd like to make a comment, please state your first and last name.
Brian Martin.
All right, we can hear you.
Go ahead, Brian.
Hi, question on the, it calls for a 2-week isolation of employee who's been exposed or feels that they've been exposed. And I understand if it's a workplace exposure, that's probably going to fall under workers' compensation. For employees who were exposed away from the work site, are they supposed to take their own accruals? And what are we going to do in those situations when we have an employee who may have insufficient accruals to take that time off?
Very good question.
So basically, there are 3 rules that apply in response to that question. First of all, if it's an employee that can work remotely and be productive during the period of isolation, as the department head, you can authorize them to do that. Or if they have paid accruals, meaning that they have some of the EPSL or other federal benefit left to them or their own accruals, then they would take that time. The last resort would be if they have no time, they would take leave without pay, but the department head would approve them for it, and there would be no form of disciplinary action resulting from that. So they would be allowed to return to their job.
Thank you.
Thank you.
Thank you for the question, Brian.
All right.
Okay, any other questions in the room? Go ahead and open the room up, Jake.
Yep, the floor is still open if you'd like to make a comment.
Okay, Jake, here no more. We'll go ahead and bring it back to the board.
All right.
So, Chair, I move to approve the update to return to work protocol.
Is there a second?
Second.
All right. Johanna, go ahead and with the roll call vote.
Okay. Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown,
Aye.
and Supervisor Simon.
Yes.
Thank you.
Okay, thank you. Move to item 7.3, consideration of a resolution amending resolution number 2020-32, revising and extending the Lake County COVID-19 interim policy for working remotely.
Thank you, Mr. Chair. The first thing I need to call to your attention with this item is that the resolution number needs to be corrected. What you just read was resolution number 2020-32. It should be 2020-33. As you recall, you approved 32, and then a week or so later, we made some minor changes to it and amended it with 2020-33. So that's the one we are amending today. And there's just one piece of that resolution that we're addressing today. There were several things in that one to support our employees. But in particular, today we're focused on the temporary policy for working remotely that your board implemented for COVID-19. At the time that was authorized, it was only for a 90-day period, and the 90 days is just about up. For the most part, department heads tell us that working remotely has been fairly effective in most cases. In many situations, county employees were able to take home their desktop computer equipment, and it worked fairly effectively. Some also made use of laptops. Some are continuing to do so on some levels. Some employees are back in the office mostly full-time. Others are still splitting the time. It varies a great deal from office to office, given the size of offices and the ability to manage social distancing with people back in working. So what we're recommending today is that we extend it for another 90 days, which would mean that it would expire September 20th, unless your board takes action to end it sooner. And there are a lot of good reasons for continuing to do that. I mentioned earlier that a fair number of employees are continuing to juggle their time between in-office and working remotely. And we also have some employees that are still facing some childcare issues by virtue of COVID-19. The Human Resources Department did a quick survey of county employees, and 92 of our employees indicated that they still are juggling the childcare needs of their children, given how the COVID crisis has disrupted all of that. So our recommendation is to continue this policy another 90 days. And given it has worked as effectively as it has, we have a team of staff that will soon work on developing a permanent remote work policy for your consideration if you'd like to have these arrangements made more permanently in the future.
Okay, thank you for that update. Board members, do you have any comments? Okay. Seeing no one, Supervisor Sabatier? Yep. Okay.
So can you hear me? Because I'm getting a really bad reception right now. Okay, good.
Can hear you, yes.
I want to first, good, thank you. Before moving forward with this, I just want to say thank you to Mr. French, the Director of Information Technology at the courthouse, or just for the county in general. Him and his team have done a fabulous job, and I don't think we should be moving forward without making sure to throw the kudos in the direction of those that really helped make this possible. I think that this ended up being something we were a little weary about, and now that we're looking at the results, while it's not all 100% positive, I think that a large majority of it has been very positive for the fact that this allowed us to put our workers in a more safe environment and allow them to work from where they felt better and safer. So I think this is great, and I'm happy to hear that we're looking at a permanent policy for the future. I guess I do have one question. Is 90 days the right amount? Do we want to look at 30 days instead? I know that we did 90 days, which was approximately correct. We've been at this for 90 days already. But is 90 days the right amount of time versus kind of keep reviewing how things are fluidly changing as we go back to normal?
We could certainly calendar this to come back to your board at the same time every 30 days the return to work protocol comes back. But with that in mind, I believe I would recommend that you go ahead and authorize the resolution for 90 days. So we don't have to repeat that every time. We could report to you. And if it's no longer needed, we could rescind the resolution.
I'd be fine with that.
Absolutely. I think it's a good suggestion to get updates, but as you said, return to work is going to look different. I think this is a great policy that we can work on developing, and I think that 90-day window would obviously give them plenty of time, seeing how quickly it was implemented to go virtual and allow these opportunities for our employees. So, and I also want to commend IT and all of admin, everybody who did the heavy lifting, all of our department heads that have operated on this to this point. It's been it's just been phenomenal. It's been something very impressive for a small rural county to accomplish. All right, any more comments at this point on the board? Okay, seeing none, we'll go ahead and open it up to for public comment.
All right, we don't have any hands raised, but I'll unmute the floor here. If you'd like to make a comment, please state your first and last name.
Okay, Jake, hearing none, go ahead and bring it back to the board for action.
All right. Mr. Chair, I offer the resolution.
Resolution's been offered.
Okay, Supervisor Sabatier,
Aye.
Supervisor Crandall,
Aye.
Supervisor Scott,
Aye.
Supervisor Brown,
Yes.
and Supervisor Simon.
Yes.
Thank you.
Okay, moving along with our agenda, item 7.5, consideration of a resolution of the Board of Supervisors of the County of Lake, State of California, authorizing Canocti Unified School District to issue its Canocti Unified School District General Obligation Bonds, election of 2016 Series 2020.
Mr. Chair, this is Anita Grant. I'll present this item. The resolution that is before your board is essentially a document whereby the board will allow the Canocti Unified School District to begin a new issuance of bonds. So it will be submitting a bond measure for the electorate of the district, hoping to get the 55% of the votes cast in order to allow that issuance. What your board does is allow, again, or authorize the district on its own behalf to issue and sell those bonds at a negotiated sale. The responsibilities to transmit all the necessary documentation to the treasurer, tax collector, and the county auditor controller lies with the district, the Canocti School District. The county's responsibilities are essentially to levy and collect taxes when due and hold the bond proceeds and tax funds that have been duly issued. There is no responsibility for either setting the tax rate, for the issuance of the bonds, for whether or not the fiscally this is an advisable or wise move. I'm not saying it's not. I'm just saying the board does not pass on any of it. The resolution, by this resolution, the board simply says you may go ahead to the Canocti School District. So they can attempt to raise money for school purposes. And again, the County of Lake faces no liability by making this decision. So if your board is agreeable to it, then you would simply offer this resolution.
Okay, thank you very much, Anita. Any comments from the board? Okay, hearing none. We'll go ahead and open this up for the public comment.
All right. So I don't see any hands up. I will unmute the floor here. The floor is unmuted. If you'd like to make a comment, please state your first and last name.
Okay, Jake. Hearing none, seeing no hands up, we'll go ahead and close the room and bring it back to the board for action. Supervisor Sabatier.
Real quick, sorry to bounce back on a previous agenda. Definitely want to also thank Jake for all the work he's done for our Zoom meetings. Absolutely appreciate his help so that we can have a clean meeting and not have any questionable situations. But I do want to say that the 2016 election was, the bond measure was for mainly facilities. That's definitely something our schools are probably looking at right now, is how to increase the amount of facilities that they have as they're trying to figure out how to do the social distancing. So looking forward to approving this. And if there's no further comment, I offer the resolution.
Okay, Johanna, the resolution has been offered. Johanna?
Mr. Chair, Johanna has had a technical difficulty. So if you'll bear with me, I will do the roll call.
Okay.
I assume Johanna is hearing me. Let me just double check and make sure she's in the room.
She is not in the room, it looks like.
So let me do the roll call here. So Supervisor Sabatier.
Aye.
Supervisor Crandall.
Aye.
Supervisor Scott.
Aye.
Supervisor Brown.
Yes.
And Supervisor Simon.
Yes.
Thank you, board.
Okay, we'll move to our calendar update. So Supervisor Sabatier.
So real quick, I'm going to join the Lake Economic Development Corporation meeting tomorrow at 8:30. They're going to be having a couple discussions relating to the master broadband plan that we had and how to bring together our healthcare and our educational facilities to a single meeting to figure out what kind of grants are available to them. And that will be with the help of the Upstate California Connect Consortium. Then I will be jumping off of that meeting and joining Supervisor Crandall at the RCRC meeting that will be occurring via Zoom. I'm so happy I don't have to go to Sacramento for that. And then later on in the afternoon, I will be joining the Lake County Rural Arts Initiative, where they will be offering the city of Clear Lake a pilot program for making Clear Lake an art destination. So I'm looking forward to that presentation and seeing how it is that we can make that happen. On Thursday, looks like the only thing I have on my calendar is a City of Clear Lake City Council meeting starting at 6 p.m. And on Friday, there will be in the morning, start off with an EOC call with an update on what's happening with COVID-19. And then I will be having a phone call meeting with Aguirre Curry, which I guess I'm going to put you on the spot. Supervisor Crandall is going to invite you and see if you wanted to be part of that meeting as well. No need to answer on that one. You're on the spot. And then the following week, don't show it on my computer, but I'm sure that on Monday I will be preparing for our upcoming meeting and meeting with Ms. Hutchinson to go over our agenda with any questions I may have, and then coming back here on Tuesday.
Okay, Supervisor Crandall.
Yes. So again, tomorrow I'll be on the RCRC call. And Bruno said he'd come in and as well after I can exit into another obligation that I have. Thursday, I have the Blue Ribbon Committee meeting. Thursday evening. I think it's either evening or afternoon. The last group, town council, is conducting a Zoom meeting. Friday is, of course, I have the Workforce Alliance of the North Bay at 9, and then once that's finished, and it looks like it'll be finished at 10:30, so I'll be a little late for the Blue Collar Committee meeting. Also, noon, I will have the Middle Creek Project Subcommittee meeting, and then hopefully discussing a meeting with Carol at 3. And then Monday, I have, where did it go? Calendar, sorry. COVID recovery, and then I'll be back with the Board of Supervisors meeting on Tuesday. And what day was that, Bruno, you said?
It looks to me like you're having a Middle Creek Restoration Subcommittee on Friday at 12, which is my appointment as well for a meeting with Aguiar Curry, Assemblywoman.
All right.
You're covered.
Okay, Supervisor Scott?
Tomorrow I have an executive COC meeting at 10 o'clock, a room key meeting at 11, and a Hope Rising meeting at 3. On Thursday, I will be also going to the room key meeting at 11, and then working with some of our homeless population at the COVID center that afternoon. On the Friday the 19th, I'm going to talk to Dr. Pace and see if I can volunteer and help him with testing here in Lakeport. And on Monday, we'll be, I guess, reviewing hopefully some RFPs that have come out for the juvenile center, and then bringing that back on Tuesday. And that's it.
Okay, thank you, Supervisor Scott. After today's meeting, have a board agenda review. And then later on this evening, I think Hidden Valley Lake Community Service District would like me to come out and swear someone in. I'll do the social distancing, but I think I'm going to do that this evening. On Wednesday, 7 in the morning, IFT and EMCC Zoom meeting. Thursday, Space Committee meeting, and then also Group Insurance Committee meeting. On Friday, have the Health Department morning EOC call in the morning, and then Workforce Alliance in North Bay. We have a couple of different, first time I think we have a regular meeting, and then a closed session that we'll be addressing. And then on Monday, the 22nd, have the COVID recovery and reopening work group meeting. And then back here on the 23rd for our Board of Supervisors meeting. All right. Thank you very much.
So,
that concludes our, yep, go ahead.
Anita and Johanna could stick around. We can do agenda review after.
Okay, that concludes our meeting for today. Thank you, everyone.
Thank you, everybody. Have a good night.